Hello?
Hi there. We can hear you. Please just state your name and the municipality within which you reside, and then you have 1 minute for public comment. The mic is yours.
Yes. Hello, commissioners. My name is Connie Smith Latimer. I live in Washtenaw County, living in West Willow, and I'm here representing the Healthy Together program, where we have been working for the past 3 years to help serve and provide resources to seniors to improve their health. And we would like to receive an update on the RFP process so that we might be able to participate in that and prayerfully receive income so that we might be able to create a senior center in West Willow. So thank you very much. We're excited about this program that we can participate in to help seniors on a deeper level.
Thank you. Ashley, out of formality, ask if there's anyone else to give public comment at this time.
No, Chair.
Great. Move then to item 4, which is report from the BOC liaison. Any report at this time?
There's no report, Chair.
I have screwed that up. Forgive me. I skipped item 3, which is before 4. Any report from the county administrator?
No report, Chair.
Great. Move then to our discussion items tonight. We are joined by Sheriff Alicia Dyer, who is with us here. Sheriff, thank you for making time to be available to us. This is an opportunity to engage in discussion on the sheriff's budget, and I would open it up. Please, commissioners, as you have questions, give me the signal, and I'll be happy to call on you. Sheriff, if you had any opening statement or anything you wanted to share to begin the presentation, I'd be happy to turn the floor over to you.
Yeah. Thank you. I don't have anything opening other than I have a presentation and we have copies of it if you all need to see the PowerPoint in paper. And then we also have the budget memo that finance did recently, copies of that if anyone needs it as well.
Would you prefer that we hold questions until the end of the presentation or ask them as they come up?
I think the end would be good.
Okay, we'll do that.
And Ashley. All right, well, thank you so much for having me here today. I am going to be giving you a financial update to explain our budget and also give more context to the memo that you all received from finance. Yeah, that's fine. No worries. All right, so I'm going to talk about our mission and values. I'm going to give a financial overview, and then I'm going to talk more specifically about the jail, food, and medical, as I know that has been a lot of questions have come up regarding that. So I want to talk about that shortfall, talk about the attrition calculation impact on the sheriff's office operations. I want to get into overtime in a more detailed way so you guys understand our overtime at the sheriff's office, as well as cost containment strategies that we have deployed this year. And then my recommendations and long-term solutions that, for all of us to work on together when it comes to operations and the cost of running the sheriff's office. Next slide. Oh, awesome. Thank you. So this is our mission statement. Together, we are committed to creating a safer, more just, and compassionate Washtenaw County for all. And when we make decisions at the sheriff's office around how to deploy resources or how we're handling operations. It always comes back to this mission statement. And our values, I think, are very aligned with the board's values in ensuring that we are reducing harm in our legal system, as well as improving our public safety. This is just to go over the mandates again, per our division. So police services, those are all of the road patrol at the sheriff's office is through contract policing. So we have contracts with a number of municipalities. And then we also have our secondary road patrol funding that comes from the state. We have corrections housing, which is the mandated per Michigan law for the sheriff to run a jail. Court security also mandated. Metro dispatch is, we do metro dispatch for the entire county. Then we have our community engagement division, our emergency management, and our public safety millage programming. The reason I think this is really important is if we do need more funding and we have to make cuts at the sheriff's office, it's going to affect the areas that you see here that are not mandated. Those areas are also where we invest a ton into front-end prevention. It's Shore Moms, it's the community violence intervention work. It's the work that we do that helps to keep our jail population lower. And so arguably these areas save costs in the long run. This is our operating budget. I showed this at the working session I was at earlier this year. And this is our expenditures. And just to highlight the expenditures and the revenue, we actually bring back revenue for the county to the tune of 28 million typically. And so that helps to reduce some costs for the county. And then this is the food and the medical cost. And so this has really been, I think, the point of discussion in a lot of meetings that we've had, whether it's internally in our office with finance or with folks on commission. And if you're looking at this map, I want to explain it to you. So the yellow is the budget that we have for contracted services. The blue is the actual cost of our food and medical. And then the orange line that's going across the top, that is the average jail population. So average daily jail population for the year. So you'll see in 2021, that was around the height of, and also as we were getting out of the pandemic. The jail population plummeted during the pandemic because everything shut down. Court shut down, probation shut down, people weren't out, events weren't happening. And what we saw was a significant reduction in our jail population. This was a year where the contracted services operating budget cost actually did meet our expenditures for food and medical pretty closely. And then you'll see, as we've gotten out of the pandemic, our jail population has started to rise since 2021 by about 50 every year. The good news is this year, it did not follow that trend. We actually see that we are trending very similarly to where we were last year. So the hope is that it has reached a plateau, and then we are going to, our goal is to reduce the jail population whenever possible. And if you look at this chart, you'll see that the more we reduce the jail population, the less it will cost for food and medical. We have to feed people in the jail 3 meals a day, as well as provide for their medical services. So obviously, the more people you have in jail, the more that these costs typically go up. The medical RFP is coming to a close. So we did form a medical review team, and thank you to Commissioner Robbie as well as Commissioner Sanders for sitting on the medical review team. My goal is to keep that team going so we can talk about long-term strategy to reduce medical costs in the jail, but we do have to continue the medical services in the meantime. And then our food contract is up next year. And so then this is the savings from our vacancies over time. So you'll see in 2021, the personnel budget was 16 million, but the actual expenditures for staffing was 14. And so you'll see that orange line at the top, that's how many FTEs were, or that's how many corrections officers were working. And so you'll see in 2021 and 2022 and 2023, when staff was lower, there was a shortfall, or there was an area where there was vacancy savings. In 2024, with the rising population last year, the vacancy savings were no longer because they had to start hiring. And we have continued to hire because if we don't, you risk having a situation where people are more likely to be locked down in the jail, which carries significant human impacts. This is the impact of the attrition calculation. So when the board passed the resolution, and I think the intention behind it was well thought out. I think what was not known is how it would impact the sheriff's operations, because our vacancies are not truly vacancies when we have to backfill overtime. And so if we're looking at our overtime numbers and how many backfill overtime shifts we've had to do, this attrition adjustment really impacted us because we were no longer able to balance the budget on these vacancy savings. And so you'll notice the attrition impact in 2025, the impact to the contract policing, which if you reduce FTEs and contract policing, you also reduce revenue. Same with dispatch services once we are at staffing. But then the huge impact that had the biggest toll was the corrections housing fund, and that's where we have to mandate overtime, typically because it's either that or we lock down the jail, which again, there's human impact to that. And so what this created was a reduction in the sheriff's office operating budget for this year by 2.59 million, and then compounded with the food and medical contract shortfall, which this year will be about 1.6 million. Last year, it was 1.4 million, and there was millage dollars that were able to cover it. But this year, we are really trying to get these costs covered so that way we can use the millage with the millage advisory board for newer programming. And I want to get into overtime a bit because I know it can get really confusing. So our overtime at the sheriff's office is driven by union contracts, depending on the rate. So typically when we have to backfill overtime, it's at the 1.5 rate. If nobody takes that overtime or we have to force into someone's leave days, it can go up to 2.0 and 2.5. When you see the 2.5 rate, that is not good. It basically means we are definitely understaffed and we really need to hire more people because people aren't even taking the overtime. And, the human story behind this is it's deputies that have worked 16 hours back to back to back, not seeing their families, tired, working to exhaustion. And so it's really important. We have had some positive trends in our hiring this year. And our goal is to get to a stable number so that way we are reducing the overtime costs. In the corrections division, overtime depends on staffing. So it's really driven by the needs of the population that's in our jail. On the road patrol side, it's driven by the municipalities and how much they contract. And then in dispatch, it's driven by call volume. And then in DB, or Detective Bureau, it's driven by the investigative work. Ways to reduce overtime, as I mentioned, include hiring. So we're not relying on the overtime to fill our vacant positions. But I do want to say overtime will never be fully eliminated because we have injuries, vacations, leaves, emergencies that come up. And we can't just let a shift go vacant. That's mandated. We have to fill it because we have to still continue the work. And then this is to get more detail into the numbers. So just to give an example of how policies impact the sheriff's office differently, or just impact the sheriff's office just like the rest of the organization. When the parental leave policy was passed, that created more challenges for us because not only, while it's good, we also have to backfill overtime. And so finance was able to estimate in 2024 and 2025 what the total cost would be for our parental leave. And we also have military leave. We have a number of vacations and other things that happen. So whenever that happens, it creates overtime. And then on the left, you'll see here the overtime cost starting from 2021 to 2025. I want to explain why there's a huge jump in 2025 compared to 2024, because you'll see in 2024, overtime costs were about 1.8 million. And then in 2025, they are tremendously higher. The jail was so understaffed last year and the years before that there was nobody else to force. So what happened is we had to do more lockdowns in the jail. What this looks like in practice is it looks like one officer watching 3 housing units and people not leaving their cells. The reason now that we are mandating overtime is because we actually do have the staff because we have hired more people. So the overtime will go down once we get to a point where we have enough hired to where we don't have to rely on the overtime. But simply it was lower last year and the year before is because they didn't have the bodies to force. And my operational philosophy is not to lock down the jail unless it's a safety issue. And so to lock down the jail to cut cost is not humane. And I would welcome anyone on the board to do a tour of the jail. I'd be happy to show you in more detail why this is so important. And then I will also say, again, the jail population has been rising since the pandemic. We still incarcerate the least in the Michigan per capita in the state. Our jail is rated at 404. We have been around 350, 352 this year. Last year was very similar. So we are still going to be trying to reduce the jail population even more. But what you'll see too is the pandemic had a positive impact on costs because there was less people in the jail. So the way to really improve and be more fiscally responsible is to reduce the jail population. And that takes a collaborative approach. We don't drive the population. It's the public safety needs, the courts, probation. There's a host of reasons why someone is remanded from the court into jail. And then all of the police agencies in Washtenaw County use our jail. And then just goes into more detail, and you'll have this in the memo that finance gave you as well, where it shows you the wages and the actual hours. And what you'll see is that dip is during the pandemic, and then since then it's been going up. And what I do think is a positive is the 1.5 rate is utilized the most and not the 2.0 and 2.5. That is good, although we always want to reduce that 2.5 rate whenever we can. Also, per the union contract, holidays we have to pay 2.0. So that also is taken into account with this as well. Snow emergencies, anytime that the county shuts down or there's a holiday, we obviously are 24/7, we still have to work. So these are some cost containment strategies that we've done this year. One of them is we canceled the Ipsy City arrangement. That we were basically handling Ipsy City's investigations for them while they were in transition to get a detective bureau. They have since retained some detectives, and so we were able to stop doing that, but that is not going to have a full effect until next year. So there was still a portion this year where we were doing their investigative services, and there was no revenue coming in for that. So obviously there was cost attached. We also updated our background investigation service that we do to reflect the true cost. We used to charge a flat fee and for each packages, and we went to charging the true cost for the actual hours that were worked. We increased dispatch contract costs to be more in alignment with the actual cost. And then we did not fill some vehicle spots this year and modified some operations to help with projected fuel costs. And that'll be something important to watch next year as well, because we're hopeful those savings will continue. Ideas and other things, the medical review team, I think is a really good team to help identify long-term cost savings. Commissioner Sanders had a good idea about training corrections officers in first aid and CPR and AED to be instructors, so we don't have to pay every year for the certification, and we were able to complete that. We're also going to start a food review team when our food contract is up, which was Commissioner Light, thank you for your input there. I think that we can all work together to really think how we do food in the jail. It is very complex. There are regulations involving dietary restrictions, caloric intake, and it's expensive because there's so many meals required. But the more that we can be innovative with our ideas and really increase, options for healthy food, the better. So looking forward to doing that work. We also work collaboratively with you all as a board, the CJCC and our courts to remedy the community corrections budget. The fine and fee justice work in this county does create some cost barriers for us, but it's the right thing to do. We don't send people to collections when they cannot pay their costs for electronic monitoring. But what we did do as a CJCC is we worked with the courts, and the people that are able to pay are now paying, whereas the people that aren't, we're still not sending them collections. And this actually is very positive because I really think it has helped remedy the community corrections issue that's been ongoing. I want to thank Chair Scott for starting up the CJCC, because I think that really helped bring this issue front and center, and it got us all in the room to have the hard conversations to really make some positive progress there. We reduced the 2.0 overtime for the future as the staffing has provided more availability for overtime coverage at the 1.5 rate. without forcing into leave days. So that's really hopeful. We reduced administrative temp support staff, and we are also continually looking at our operations to see where we can reduce costs. We launched Ignite. Ignite is a program in the jail where people in the jail can get certifications, whether it's diplomas or GEDs. And we are going to be expanding that work and working with labor and unions to help get people pathways to jobs. The more we can get people employment and certifications and degrees, the better chance for success. And other areas that have deployed these strategies have seen a reduction in recidivism, which is positive for public safety and also positive for reducing the jail population. So that's really exciting. We also adopted a new traffic stop policy that reduces low-level stops, similarly to what Ann Arbor was doing and has been doing. And so that helps to reduce low-level arrests as well. And we continue to use summons and tickets in lieu of arrest whenever we can for all low-level offenses. And we are not holding people in jail for low-level offenses that we don't have to hold them in jail for. And so that work is still going on and has helped keep our jail population much lower. And then I mentioned we train deputies to be instructors, so we're not having to pay every year for their certifications for first aid as well as CPR. Recommendations and solutions I have for you all. One is this year approving the reading for the 2.7 million adjustment, which is really kind of the aftermath of what happened with the attrition situation as well as the food and medical. We were able to find a lot of savings this year, but it's not going to be sustainable in the long run. And then really fully fund the jail food and medical contract. That will help tremendously. And we will continue working closely with our team as well as finance to really get more accurate attrition calculations. I do think once we get to a point where we are not forcing for as much overtime, it will actually work itself out. And so we are continuously monitoring that. And then for the future, we are building a jail reduction plan. The jail population after COVID has been going up each year by 50, and it is our goal to have that population go down. We want to incarcerate people less. Obviously, if people have to be in jail, they will be in jail, but really thinking how we can work together throughout the large ecosystem in our county, especially the legal system, to really keep our jail population low. And I welcome collaboration on the jail population reduction plan. And then I also want to highlight this area in orange are areas in reentry, and the area in blue are front-end prevention. And so some other areas, as we're looking at what we can do to reduce the population, they have adopted text message reminder systems for people so they don't violate probation or miss an important court date. And the better we can invest in reentry supports, the more that people aren't returning to jail. So that's really helpful. And then on the front end, it's expanding those deflection opportunities. So we expanded eligible offenses for lead when we started. And then we also have recently expanded lead countywide for all the sheriff's office jurisdictions. And we are trying to deflect people away from the legal system whenever possible. I think expanding restorative justice approaches could also be very helpful. As I mentioned, using summons instead of arrest, and then alternative responder programs. Doing these combined should have a positive impact on public safety, as well as reducing our jail population. And then this just goes into more on why you don't underfund a jail. When you underfund a jail, you risk having more lockdowns. Because the staffing was so low last year, the lockdowns were significantly higher than they are this year. And there's a very, very human cost to that. As I said, that means that people are sitting in their cells and they cannot leave for a lot of hours. It's not good for anybody. You don't want to underfund a jail because of fights, because of crowding, harder time with classification. We are a post-driven operation, so we have to have the staffing. And if it's not available, we have to mandate the overtime. We also risk having long delays in people's visits for their attorneys, which can violate people's due process rights. And then less ability for programming and for services that lower recidivism. And it's my understanding that I think we're all aligned on this, that we want a more humane and compassionate legal system environment for everybody. And as much as we can, we want to reduce recidivism and reduce the jail population. But we also have to treat the people with humanity while they're in our care. And this just names the long-term vision that I just talked about. Thank you.
Thank you, Sheriff. Open it up for questions. Have Commissioner Hodge in the queue.
Thank you, Chair. Thank you, Sheriff, for the presentation. And I got a few questions. A lot of them are specific to the jail. So hope you can work with me on some of these. I've heard some feedback from people that have to do work in the jail to see people that are currently incarcerated. And I've heard that, thank you, I've heard that wait times in R4 are extremely long, that there have been times when people have gone to R4 and there's no one at the window. So they have had to wait 20 plus minutes to see the people that they need to see. Can you talk to me about that?
Yes, so we have opened up options where people can go through the front and actually go down the hallway down into ITR in our jail as well.
Yeah.
A lot of this, my guess is because of staffing and because of what's going on at that day and time. I also believe Commander Shipakasi is online, and I want to see if he has anything to add, and he's the one that runs our jail.
Hi, Sheriff. I am on the air. I'm not sure if you can hear me.
Yes, we can
Yep.
hear you.
All right, excellent. So yeah, and so just to give some context, the jail's ITR was designed to run with 3 people. In an effort to be conscientious of the overall budget, we've been running with 2 and not typically forcing to that 3rd position. Not forcing to that 3rd position can impact the efficiency of that operation. So it's as the sheriff indicated earlier, when you don't have the staff to work, there are other impacts other than just not having enough officers. There's impacts to the people that are in the jail and also to the population that's trying to come in and visit with people.
Thank you. And what I said earlier about the professional visits, the less staff you have, the more those wait times go up. And then you run into issues like what you just mentioned.
Okay. All right. Well, thank you for the explanation. I got more, not done yet.
All right.
All right. So another thing that I'm hearing, and this might be a combination of both like a CMH related thing and you guys, but I'm hearing that there are a number of people that need better mental health care that are in the jail and that they're typically not really getting the kind of care that they need unless they're expressing suicidal ideation. So I don't know if we just put it out there because that's what I'm hearing. I don't know if there's anything you want to say to respond to.
So I'll just say we do need more social workers and mental health practitioners in our jail. We have 2 reentry case managers. We have the CMH team. They are doing the best they can. This is a high need population. When we looked at our data, more than half of the population has mental health needs, which is a longer problem, with criminalizing the mental health and how our state shutting down the mental health institutions. I mean, all these things have had impacts on jails, but I don't disagree. We do need more services for mental health in our jail.
So you're feeling like that's more of a CMH funding issue than you guys?
We have a strong partnership with CMH, so both, right? So CMH, obviously having more CMH workers in our jail would be great on their end, but then we also have reentry case managers as well. So whether we do it or CMH does it, we need more.
Okay. Another one that I got is that sometimes people that have to go see the inmates for services have been brought the wrong person, and it's happened multiple times. So that is concerning too. And then a few other comments that I've gotten recently relate to the cleanliness of the facility. I'm hearing that halls smell like urine, and particularly in ITR, there's urine and feces scent. And then that some people have complained about not having clean clothes or soap. And then this one, a pillow situation that not everybody has pillows. And I know that's the thing that you've talked about before too. But so those are things that I've heard. I don't know if there's that may be a funding related thing to the 2.7 or something to that effect, but I just wanted to share it.
Yeah, and I will say if you are getting feedback like that, it is important to let us know so we can do an internal and look and see if that happened. Reference bringing someone that wasn't the right person, because people should have their wristbands on. So the right person should be brought to services. So we can definitely look into that. I go down to the jail frequently. I have not seen any of those reports. But I can definitely continue to keep an eye on that. We did just pass our inspections with 100% compliance. And I really welcome you all to take a tour of the jail to see it for yourself, because I feel like it's easier to explain when you're actually in the environment. But of course, funding is always helpful to do more.
And you have offered multiple times to give us tours of the jail, and I haven't taken you up on it yet, and I will take you up on it because I haven't been in the jail since at least last year. So I will come to.
Thank you.
Yeah. And okay, so the overtime piece, I want to talk a little bit more, have you talk a little bit more about corrections specifically. So what is the nature of the issue that's causing overtime to be so high and for corrections specifically?
So part of the reason is the staffing was so low when I started, to where since the pandemic, the jail population, as I showed in that chart, has been rising. And so when you have housing units in the jail that you have to manage, the only way to cut down overtime costs would be to shut down housing units, and that risks putting people in other units where they are going to have issues or it's not safe. Or you can lock down the units and have one officer watching 3. That happened a lot last year. That is really inhumane, and we didn't want that to happen. So we have been mandating overtime more. So that way the jail staffing model is more proper. So we're not having to put people on lockdown.
Okay. Okay, next question is related to the memo from finance. And I think everybody has the memo from finance. So there's a piece in there that talks about the vacancy rate is the same, I believe, as last year as it is this year, but the overtime is higher. Is that correct?
So what page are you referring to?
Might be page 11.
I don't believe our vacancy rate is the same. I'm trying to see which.
Pages are not numbered, so that might make it a little bit more challenging.
What they might have been talking about, and I explained this in the slide, we're not going to see the full impact of our hiring until everyone's off training. So there are still people we've hired that they're not counted yet because they can't be by themselves. And so next year, what you should see is a lot of this overtime go down because people will be fully trained. And so, I think that's one part of it. And then the other part is last year, the overtime was lower because there wasn't anybody to even force, which led to a lot of the lockdowns. And so this year there are people to force. So instead of doing lockdowns, we're leaning towards the mandated overtime.
So if I'm understanding you correctly, the vacancy rate, even though the vacancy rate is the same, overtime is higher because we haven't realized the impact of people being hired. Is that correct?
Correct. That's one way to put it.
Okay. What else I got here? A couple more things. The fleet, because fleet comes up in your savings. Can you describe how the savings were achieved through the work that you did related to fleet and how we got there? Because
Yeah.
we get a discount, right, as county government for buying in bulk.
Yes. So we switched from Fords to Durangos, which was significantly cheaper. That was one thing that we did. We also did not fill some of our fleet spots, which helped out. And then I think those are probably the 2 main drivers. We also have been really on our staff about fuel costs, and we are working on doing an idling policy. We're trying to reduce the cost for fuel as well.
Okay. Okay. And then so this other one is related to the fines and fees work. So I was pretty involved in that earlier when it first started. Can you talk about how that is impacting your operations? Because I wouldn't expect that would be a significant cost to you all. I know, I mean, it does have a cost, but that's not necessarily what's leading to the multi-million-dollar issue.
Yeah, so the community corrections is the pretrial services for the courts. And so when the courts remand someone to have to do probation and they're on tether or have to drug test, et cetera, we do not, what other sheriffs and other counties do is if you can't pay the tether cost, you don't get out of jail. We don't do that in this county. And so we don't send people to collections and we don't force payment. And because of that, it is expensive. It's about $90,000 a month for our electronic monitoring bill. And so the costs have to get covered somewhere. And so that is where, it is definitely a burden on our budgets. But I will say that I think our values will support what we're doing. And so what we've kind of worked out with the courts is the people that can pay are paying. People that can't pay, we're not sending to collections and enforcing it.
So it's less about fines and fees more broadly. It's more just about community corrections specifically then.
Yeah, community corrections is where that probably matters the most.
Okay. Well, last thing I have is I appreciate the response to the shooting incident that was in my district. I know that you communicated with me very effectively during that. I think there were some challenges with getting more communication out to the public. I know you've already heard about that. What's the strategy so communication when an incident like that occurs again is clearer to the public?
Yeah, so we are talking with our emergency manager and dispatch manager, Ben and Lee, who are here today. And we're trying to figure out how to really make Everbridge work better. Everbridge is the alert system. It sounds like in this situation, Everbridge was done some hours after the initial partial call out. And then the other thing that was different is we didn't post it on social media like we normally do. Our manager that normally runs that actually just got promoted and is going to a different position, so we're transitioning. And so we just need to find someone to cover the social media updates.
Okay. What is the issue with Everbridge? Because it worked fine before.
So an Everbridge did go out, but it's my understanding that the Everbridge went out not like right away. There was some delay in the Everbridge notification going out.
Okay. That's all I got for now. Thanks.
Open it up to other commissioner questions. Let's go to Commissioner Sanders, then Scott.
So, so I receive or have received in the past Everbridge, rely on it quite a bit, but I've noticed that it's been not active. I've not been getting sort of notices at all. I haven't changed my phone number. I also got communications about this recent barricaded gunman situation, I guess is what you want to call it. And I'm just curious, like, why wasn't the public informed? I mean, you've got people that are still walking their dogs in the neighborhood and they don't know why. You've got police, you know, I mean, to me, that's opening up more liability for us.
So they did lock down the area that was a safety issue. This situation was contained to one household. And so the areas nearby, they were able to cordon off. The Everbridge, and I don't know, Ben, if you want to talk about Everbridge really quick, just the Everbridge notification did go out. It just didn't go out right when the call started. And then the other thing that was different about this is normally the news will report and the news showed up, but it was smaller at the time. It wasn't as, it escalated, but the news ended up leaving. So there was no article that went out to notify people either. But do you want to talk about Everbridge real
So I
quick?
can speak to Everbridge, and really.
Ben, forgive me, do me a favor and move over to the mic.
Sorry.
Thanks.
Yeah, I can speak to Everbridge and just the larger community notification process in whole. So Everbridge is our main tool for opt-in notification to the public of incidents that might escalate, that really you need to be aware of, right? Just for your own safety and awareness that an incident might be going on in your area, but not anything that rises to the level where we're actually asking the public to take action, right? So for Everbridge, we're using that as a tool to push out notifications to the community of incidents that really require their attention. But if we're asking the public to actually take action because of an incident occurring in your area, so by take action, I mean shelter in place, lock down in your house, evacuate if the circumstances require, or generally avoid the area. So anything where we're asking the public to actually take action, we're escalating that and using the wireless emergency alert process, which is, it allows us as emergency managers to push out notification to populations, again, in critical incidents where you need to take protective action. Outside of that, we still utilize Everbridge as a technology to push out messaging when we receive a request to do so. So for incidents affecting other jurisdictions, if we receive a request to push out information to the public, we certainly can do that, and we have a process to engage in doing so.
So I'm not going to spend a whole lot of time on this Everbridge thing, but if I remember, I used to get notices about crimes. I would get notices about extreme weather. Not getting any of that. I just went through my phone. I haven't gotten anything.
So I will certainly look into that because our policy, our procedures, our process for these things haven't changed at all. Since we instituted that back in 2021, the technology, the platform is still working to our knowledge. So I would certainly go back. I'll look into that. And if there's any additional concerns that you have as board members, I will certainly address those individually or as a group as necessary.
Thank you. Thank you,
Yeah,
Ben.
thank you.
Okay, so that's my question about, Everbridge. And then why are we not using social media?
We are. It's just our normal person that does it is transitioning to a different role. And so division heads have been trying to do it in their time. And so we had to reassign someone else to update the social media accounts.
Okay. Let's see. So so the parental leave, the difference between the backfill cost for 2024 and 2025, almost double. So what happened there? And I'll be transparent for the public. I was one of the commissioners that believed that this was a necessary benefit. I won't say that it's always women, but majoritively, women are the ones that benefit in their families from this type of leave. And I don't think that a person should have to choose between their career as a police officer and being able to have a family.
Right.
I also don't know that less than $500,000 a year in the overall scheme of our budgets is a make or break sort of situation. So I'll put my sensitivity aside, but I read this and I thought, I hope that this is not, I don't want this to seem like it's kind of sexist in nature. Like, this is gonna kill us because we're offering this new benefit.
Oh, no,
So that families that we support them.
yeah, no, 100%. And I agree with you. I absolutely think that we should support this. It's just this was the numbers that finance ran just to kind of show how policies affect operations.
Now, this is where you're gonna have to help my memory.
Okay.
I believe that we've been told at least once or twice that you had basically handled staffing deficiencies and that you were at staff levels that were appropriate, like earlier this year. Am I missing something? Because when I read the attrition piece, I don't know that I don't remember receiving any information that says that you were having difficulty filling spots. I'm curious about the detectives. How many do you have? How many have left in the past 11 months? There's some labor questions that I have in terms of, your contracts and what does overtime look like? Even more specifically, like, are there other causes for why we've got excess overtime? Because I want to know, like, are you not able to hire? Are people not interested in working for Washtenaw County Sheriff's Department?
So quite the opposite. We have received a number of applications, and you talk to anyone that's been around, we've hired more this year than we have in probably 5 or 6 years. We are not at staffing though. It takes time. And when you hire someone, they have to go to the corrections academy or the police academy, and dispatch, it can take 9 months to fully get through the training program. So we're not going to really realize the benefit until we get everyone out of training. And then we do have a couple of vacant positions in the DB, and we are waiting to promote until our road patrol staffing reaches a certain level. All of this is driven by the union contracts. There is one person who has retired, but we have not had many challenges there. I will say, if you look at the finance memo, the DB overtime has gone up compared to last year. And in looking at that, we're evaluating it. A lot of it, there's been an increased threats where that detectives have to investigate for the courts. There's a cold case that has taken a ton of investigative overtime that we were able to get leads on. So sometimes it just depends on the work. It depends on how much they have to do follow-up investigations. And we should still see those overtime costs go down, hopefully for next year.
And the last thing, and then I'll turn it over. I'm probably gonna have another question, but I had been asking for ways in which the sheriff's department was attempting to lessen or come to some sort of middle ground with the increases. Like, what efforts has the sheriff's department made to try and attack some of these overages?
Yeah, so the cost containment strategies that we have deployed is we cut a lot of our part-time temp spots that were previously unfunded, that were in our budget. What this means is it's created more work because there's less support staff for division heads. We had deployed the strategies for the fuel savings, making that switch from Fords to Durangos helped tremendously because we also had a lot of maintenance problems with the Fords. For the police vehicles specifically, we have worked to keep an eye on our overtime very closely. And so anytime we can reduce it on the road patrol side, we did. But we are still, the problem is law enforcement can be unpredictable. If there's an emergency, if there's a late call, if there is an investigation where a lead ends up taking 3 or 4 hours to track down a witness or a suspect, it can be pretty unpredictable, but we are constantly monitoring it. We meet all the time with our division heads, our finance and county finance. We have been working together. And what we have really found is the best way to reduce the cost will be to reduce the jail population. The more that we can do that, the more that it will have significant savings for you all as you all set the budget.
So one last question. You talked about lockdown. So I'm gonna ask a question that probably is gonna cause irritation, but if we're facing deficits, lack of resources, I've only heard you speak about the lockdowns in terms of totality, like either we do it or we don't do it. I've not heard anything that's like in the middle. So is it not possible to do partial? So maybe there's not full freedom 7 days a week. Maybe it's 5 days a week. Maybe there's 2 days in that week where you're scheduling that they're not going to be out in population as much for the purposes of helping with the staffing and the cost.
That is something we shouldn't be basing our housing unit and jail operations on money when it comes to this means that for 2 days a week, people would be sitting in their cells all day. Like, there's a real human impact to that I could not support.
Sure.
Oh, but we are.
Hang on, Ship.
I'm sorry. I don't mean to
go
interrupt
ahead.
it. So we do intermittent lockdowns like that. We also try our very best to forecast when a lockdown is going to occur. And then we try, as the sheriff was saying, we try to move those lockdowns around to make sure there's equity for the people so they can come out of their cells. They can interact with their loved ones. They can interact with each other. However, sometimes things pop up at the last second. We don't know that that's coming. We don't know that there's going to be a hospital guard, or we don't know there's going to be a sick call. And when those things happen, that can change our circumstances. So we do try to forecast those things. Sometimes it is a full lockdown, depending on the circumstances that are in front of us. And sometimes it's a partial as well.
Thank you, Ship.
I'll come back. I know I've got one.
All right.
We'll come back to you. I'm going to go to Commissioner Scott, then I'll have a comment, then Commissioner Somerville and Beaman.
Thanks. Thank you, Sheriff, for the presentation. Thanks for Chair for acknowledging me. Few things I'm just gonna say to begin with. One, I'm gonna try to say it as calmly as I can. I've heard from various people who are concerned about the attrition and what happened with that. And some narrative that's come from someplace that this was something we did after you were elected to directly impact you. I just want to clear the air that that did not happen that way. That happened well before that election, and it additionally happened when 8 of the 9 people around this board endorsed your opponent. We didn't think we were doing that to you, regardless of what is being said to people in the community. That was not something we did to you. I want to also be clear that that attrition was not just directed at the sheriff's office. It was across the board in the county, was not just to one place. And we were ending 10-year contracts, and we needed to figure out how we were going to pay people more and not have people be red circled. For people at this board table, they didn't think it was appropriate that people who had worked here the longest would be red circled and not get an increase. So we had to try to figure out ways to find money to make sure people got paid more, especially the people who've been working for the county the longest. That ended up looking actually at vacancy rates that were happening in all different areas of the county and then budgeting appropriately. The vacancy rate at the sheriff's office was staffed in, say, if you got 100% FTE budget, and those vacancy rates were around 88 to 89%. We did not pull 11% back from the sheriff's department. We pulled 3% back, 3%. And that was to make sure people could get more money in their paychecks, working for the county. I have no qualms about the decision we made about doing that. It was right to pay people across the board as table movers to make more money. I have no regrets about that, and I want people to understand these were for union contracts to help people get paid at the top of the scale, particularly have the same movement as people below them. That was not personal. That was for the workers at the county. That's a narrative that's out there about what we did, and I just wanted to be really clear what attrition is and that it was not directed towards you, nor was it directed towards the sheriff's department particularly. As I said, I have heard the narrative is coming from you. That's maybe rumor, I don't know. But a number of people have called me after a meeting with you to tell me that that is what they heard. I just want to put it on the record. That's not what happened. My chafing at the Q3 budget is that this is a lot of money. And I think that we have, one of the ways we can keep people out of jail is by making sure that we are doing what we can to support housing, food, and healthcare access. And I don't have the money to do that with a huge adjustment to the sheriff's department. A little part of me thinks you started in 2025 in January and you knew that this was what the budget was. I wonder about the coincidence of knowing that the budget was $2.6 million less because of the attrition, and you're coming in Q3 with $2.7 million. That's not a question, observation. I do have a question for you now, though. I think that operational decisions have fiscal ramifications. And I want you to talk about the budget analysis that was done before you made some of these operational decisions. Like, it might lead into the jail question, like what operational, when you made operational decisions, what fiscal analysis did you do? Where did you think about, if I'm going to increase costs in this area, where am I going to decrease costs in another area? Because, you know, the budget is the budget. And what I feel like I've got right now is somebody being like, I don't care what the budget was.
So we were able to find, despite the reduction in our budget by 2.5 million, and despite the food and medical that was never funded for the actual cost, we still found and worked our hardest to lower costs wherever we could. In our analysis, the things that we could cut to reduce cost include the things that the board supports. And, and
Those are the things that we support are supported by the millage, not by your budget. The millage budget is separate from your budget.
there is funding that goes to divisions in our budget that aren't just the millage. And if I'm able to reduce cost in the budget, it includes reducing things that are helping keep people out of jail. I don't have discretion over jail operations. It's a mandated, I can't shut down the jail. Dispatch and road patrol are revenue contracts. So emergency management, there's MCLs attached to that. So it really leaves me with little wiggle room to figure out what to actually cut. We did try. We tried. We cut a host of admin temp spots. We also found ways to generate revenue. We looked at, part of the reason we terminated our agreement with Ipsy City was we saw it was driving the detective bureau cost up. So it wasn't we weren't not trying. It's just, you
I
can't
like, I
make
want to
up
like
2
stop and be like, pause. I have questions because like you're saying you terminated the contract with Ipsy that was driving the detective bureau costs up, but yet the overtime costs for detective bureau are higher than ever.
So that we will not realize those savings until next year because that did not happen right away.
One of the things in the memo that you sent back to us was that you said there was no realistic or safe path to achieving that number without creating real risk for the people in our jail, for staff who are already stretched thin, and for the broader community that depends on us to keep things stable. I appreciate that, by the way. This was the first year the calculation was applied like this, and Washtenaw County Sheriff's 24/7 operational reality makes it a fundamentally different than most departments. Saying that that there was no realistic or safe path to achieving that number.
The downtown,
Can I just, there have to be things that you can do, because what if we didn't get the revenue sharing that we got? What if there were cuts at the state? Does this mean your department has no plan for if things like that happen?
we have plans, it's not ideal. And it does not include reducing overtime in the jail. The plan, in order for us to reduce overtime, which is what was asked, these overtime costs are very high. In order for us to reduce it, it does include lockdowns. We never want to do that. And it burns the staff out as well.
At some point, do you think you can tell us how many lockdowns there were in 24 as compared to 25?
In 2024, there were 31.
Yeah.
This year, there were 13.
Oh, that's great. I agree. Lockdowns sound horrendous. And nobody at this table is interested in treating people in the jail inhumanely, but we are interested in thinking about our fiscal responsibility going forward. Speaking of contracts, can you talk to me about how your finances are done? My understanding, it's done with a person on contract? Your finance director, your person who directs your finance and budget?
We have a financial analyst, which is Karen, who is the person that the sheriff's office has been using for years, and they have been phenomenal and have said much of the same things that finance is saying.
How often does Karen work?
So she is with us weekly, and she also I've never had a problem trying to get a hold of her either. She's been great.
What's Karen's contract for working once a week?
I can pull that if you would like. I would respectfully, I feel like we should stick to talking about the budget.
That is the budget. How much we pay her.
So
That
I
is the
don't have the
budget.
contract on hand, but I will get that to you.
My understanding is $70,000.
I will get that to you.
That's $168 an hour. For a person who does does finance for the largest part of the county's budget, 1 day a week.
I will say Karen has been around
She might be
whenever we need it. It's
fantastic.
not just 1 day a week.
Okay, all
And
right.
if it wasn't for her, we would be there would be a bigger adjustment happening right now. So I don't want to there's a reason that the previous sheriff administration had her, and there's a reason we kept her. She has really been critical.
A few other things I'm interested in knowing that I sent in the memo that I sent to you that you responded to, but did not answer the question was, when we had the memo about the food and medical costs as expected drivers, I asked questions about several additional line items, particularly related to training, overtime, and reimbursement assumptions. You indicated in a conversation with Administrator Dill and I that travel and training costs were publicly misconstrued in a recent blog post by Pat Lesko, and that they were reimbursable by the state. With that in mind, I asked that you gave some more explanation about $68,000 for police training overages, $135,000 for continuing professional development fund, $60,000 for jail training fund, and then you have associated travel and training reimbursement offsets, including state or federal reimbursement sources. So I'm wondering if you can talk about any of those things and what you told me that those would be repaid by the state and why you're looking for that money from us.
I am not looking for that money from you. I don't know if there's, and
That was in the memo in the last,
the
in the quarter three
CPE,
first reading. Those are the items that are listed why you need a quarter three budget adjustment in addition to the jail, the food, jail, and medical costs.
the CPE dollars come from the state. This is new. Basically sworn MCOs officers, if it meets certain criteria, you can get refunded and reimbursed for training and travel costs. And then there's a corrections training fund that pays for corrections officers training as well. Those costs are being calculated, and we are still working with finance on those. But I was not aware there was an ask for that line item. So I don't know. And I believe that was finance.
It was in that memo from our meeting last week. I don't know if the memo has been rewritten, so we'll see if it cannot recall. It was also in the memo I sent to you to ask about that I didn't get answers to.
I'm happy to talk with finance. I did not actually make those.
Sheriff, I'm gonna interrupt you just so our deputy finance person can come up.
So the ones that you're mentioning about are the different non-general fund funds. But typically, every year, we bring these as a Q3 adjustment when we know what the amounts are that they are projected to be spent. So this is one you've seen regularly. It's independent of the general fund. And it's just based on current year-to-date projections and has no general fund impact. So does
Okay.
that help?
Not a ton.
Okay.
but Yeah, but thank you for
Okay.
trying. I
Okay.
appreciate it. I have, like many of my colleagues, some other questions and observations. I'll ask one more question, maybe two. In the mandated versus non-mandated services, can you explain down here, we have public safety millage programs, innovation, reentry, outreach, housing, community programs. Why you have no listed for mandate under that?
Because there's no MCL attached.
When county finance, I think, asked about mandated versus non-mandated services, they asked for MCLs and county policy.
I believe the way they were looking at mandates is if there's an MCL attached, it's a mandate. If it's a policy, they were thinking about it differently, but I don't want to speak for them.
I would say
Oh,
that,
there-
that's fine,
Catherine, why
Catherine.
don't you go ahead and speak?
Go ahead.
Sorry. Yes, there's different levels of mandate. Traditionally, when we say mandated, we only said federal or state, and then we had a different level that was less mandated, which was county policy and grant obligations. In the resource management, anything that was a millage was listed under that lower level because you technically have the authority to not levy the millage. So we're not required to do it, but the voters approved it and we tried to do them. That's why it's.
Yeah,
So you're
and so,
following how we
so,
broke it
so
out.
in my mind, that is a mandate. We do have an ordinance that we set at this table about that money. That ordinance, I think, in the mind of most commissioners, went into effect on January 1st, 2025. We haven't seen that ordinance in action, and I think we've given some grace about that. I haven't seen a plan for the ordinance in 2026 either.
So
That
we are
is-
working with the Millage Advisory Board. We've met twice.
Yep.
And we're excited about it. There's a lot of people on the board, I think, that are gonna offer a lot to the conversation. And I'm feeling very positive about that.
Great, I'm happy about that. My final note will be that in the memo you sent back to us about the Q3 budget adjustment and ongoing budget collaboration, you talked about the documentation of key meetings and exchanges throughout the years. There's actually a long list of emails and requests and very few meetings. I will note that at one point, there was an email that was sent from your office that said, we're having no more meetings. That didn't help. It got us to this position. Finally, I would again ask you now in this public venue to have the meeting that you had scheduled with me and Administrator Dill and our Corporation Counsel, Michelle Billard, regarding a legal opinion that you requested and a meeting that you canceled on the day of and have had made no attempt to reschedule. I would very much appreciate continuing to have that meeting.
Yes,
you.
will do. Thank you.
Got other commissioners and I'll get to them. Sheriff, a few quick questions. Biggest one, I guess, really, you provided some recommendations and I think you've outlined as it relates to overtime that there are some related issues in terms of getting the staffing levels up to what they need to be and the policy issue that you've mentioned on lockdown. In the recommendations you provide us, you know, that first one says approve the budget adjustment. The second, revisit adoption attrition calculations or properly fund areas that have been underfunded for years. I'm interested in hearing more about what are those underfunded areas. And I'm also interested just in terms of, even if we did these three, what's to prevent this same conversation from happening again next November? Because it sounds like the policy of not having lockdowns, we understand the values behind that policy, just as we understand the values behind the use of any dollar for a human service endeavor. But I don't know structurally how that changes. So what gets us from the moment of contention and debate and deliberation, all that, to something structurally sustainable in a year from now?
So I would say I need a budget that's reasonable and I will meet that budget. I think the hard part this year coming in was having that 2.5 reduction, and I get why it was done. I'm not like attacking that issue, but having that reduction on top of the jail, food and medical. And I talked to the previous sheriff about this. We reached a breaking point where for years the budget was balanced by underruns in other areas and overruns, and they made it work. But we've really reached a point where the jail, food and medical is what really pushed it over the edge. But if you give me a reasonable budget, I will be within that budget. I just need the chance to actually do that.
Sheriff, I hear that, and let me respond to say that sounds reasonable. The inverse to that is be reasonable with the budget that that we grant, and I think you are trying to do that. I do think it's worth noting for everybody in the room and for anybody listening, some of this is borne out not by you and your administration, and certainly not by Sheriff Clayton and his administration, but by the relationship between this board, this organization, and the previous sheriff's administration under Dan Minzy. Essentially, we had several terms where contention was the rule of the day, and there was a great divide. My hope is that at the sort of the start of your administration, that we go down the Clayton path, not the Minzy path.
Absolutely.
Well, I want
We're
to
forging a new path.
Yes. On overtime, is there any discretionary overtime that is low-hanging fruit? I don't know law enforcement as a profession, but detective overtime. I understand detectives have to work a case, but can we make a conscious decision to dial down overtime in that or another area?
So I actually do have an idea there. So one is not doing Ipsy City's investigations is going to help next year. We're going to actually realize those true costs. The other thing is we're going to take a deeper look at their shifts, because if they're working, let's say a 6 a.m. shift, 8 hours versus 9 to 5, are they having to do more overtime to talk to people after 5, right? So we're going to take a look at the scheduling because I think that we can do some creative things to lower some of the cost in the Detective Bureau.
Okay. Last thing, just to plant the seed is, if we could, in the future, discuss in a different venue, more about the concept of a lockdown and other alternatives. I understand what you've told me and understand the human cost of that. I'd like to find a way to make that human cost both avoidable but also sustainable. And I just don't know enough about the policy related to that. So I would welcome that conversation in the future.
Thank you. Yep,
Uh,
absolutely.
I'll move to Commissioner Somerville.
Thanks, Chair. Okay, try to start backwards because I was only going to say one thing, but now I have two more things to add. So on the issue of overtime, is there any other like policy driven reason why overtime has increased this year? Like deputies on the road, like I guess what I'm getting at is I've heard from people who have contract policing with the county that deputies are being doubled up in vehicles. Like, is that playing a factor into overtime?
No.
How is it not playing a factor into overtime, I guess is my question.
Yeah, so it's nothing, they were always able to double if staffing allows. Typically this happens in Superior and Ypsilanti Township. And it was a union request. The thing that we changed there is if staffing allowed, so this didn't create overtime because it didn't put more officers or more cars out on the road or anything like that. If staffing allowed, they were able to double, not just 8 PM to 8 AM, because some of them are working these 16-hour shifts back to back and they're tired. And so the request was, can you, if staffing does allow it, can we double in the daytime too? And that, has not had any impact on overtime whatsoever because we weren't ever mandating overtime because of that. And that was a standard procedure. We just allowed it in the daytime as well as the nighttime.
Okay, so it's not playing a factor in like a minimum amount of vehicles on the road? Okay.
No.
That doesn't make sense to me, but I'm just one person, so I just.
It's bodies,
Yeah.
not vehicles. So the minimum staffing is one deputy, not one car.
No, I get it. So we're doubling up deputies, but we have less vehicles on the road.
Less vehicles on the road if they choose to double, if staffing allows.
So like deputies are deciding if they want to double up. Somebody else isn't deciding if we need more vehicles on the road.
So it actually, so some of the contract partners have said, the only concern we have with this is it going to increase response times? Because if you have less single people cars, then you do have less cars on the road if people decide to double. Our response times have actually gone down this year, so they've gotten better. Part of the reason for this could be if you have a two-man car and a call requires backup, the person's right there. And so I think that has had a part to play in it, but it isn't, I also want to say this is a union negotiated thing that's in the contract for nights anyway. All we did was allow it in the daytime if the command approved it. So they still have to ask their sergeant. It's not just them deciding.
And like that person who's making the decision is factoring in the overtime that's being used.
Yes, and it has no impact on overtime.
Okay.
And if it were to have an impact on overtime, we wouldn't allow it.
Okay, the other thing on the social media thing, so there's like a staff transition happening right now. And so there's nobody in the sheriff's office who's able to, in like an emergency situation, post something on Facebook. And you also said social media. So like, does the sheriff office have multiple social media accounts?
Yeah,
Like
so
multiple Facebooks, or like, are you meaning apps, like different
apps.
applications?
Yeah, apps. We actually do have someone. We just, that transition, that normally it's always put on social media, and for that call, since we're in this transition phase, it didn't happen. And then I ended up doing it, but we actually do have someone doing that now.
Okay. And then this is not really a question, just, I guess, for my colleagues and like the public, like obviously taking in your presentation, you have some nice slides on things that you have done, other things related to like changes that have been made, for example, operations inside the jail, things that are like philosophical decisions. On the issue of like lockdowns versus no lockdowns at all, I think like probably for most of us sitting around this table, for us, we have a whole organization that we have to budget for. Every department, every employee that works for us, we're trying to figure out right now, like where we're gonna get the money to be able to put more on the table for contract negotiations for all of the employees of this county. And so like we're sitting here, at least I'm sitting in my seat, and when I hear things like, well, I just don't believe in that, or it's not my philosophical belief that we should do this, even though it costs us more money and it's a driving factor and why there's a gap, it's hard for me to like take that in when we're trying to make decisions for 1,400 employees in every single department. And to top it off, we have the federal government making decisions that are impacting HUD funding, which are going to have a direct impact on honestly the criminalization of people who are low income and who have struggles with sustaining affordable housing. For example, permanent supportive housing is under attack. It is the #1 housing solution to keep people out of jail and out of mental health crisis. And so this is me, I'm sitting here, there are 8 other people around the table that have to make decisions on our budget. And we know that there are gonna be millions of dollars taken away from just Washtenaw County, not even the surrounding counties, for people who are currently being supported through permanent supportive housing, who might have a history of like a criminal history, might have a mental health history, might have both, who may lose supports. And like, just from like a, like way above, like just looking in, it seems like we're being told, like, these are the things we need to do, just bare minimum to balance the budget. But then the long-term reduction plan for jail population are all these other things, but I'm sitting here like, where's the money coming from? So if we fill this gap, where's the money coming from to put more money on the table for union negotiations? And like we just had to make some pretty tough decisions around healthcare to make our employees whole there, and that's only going to get worse over the next couple of years. So I'm just throwing this out there because I think I think it's hard for you to take in some of these questions, but it's also hard for us to take in some of the feedback we're getting from you because we're being told we need to fill this gap, that some of this is the decision that we made with attrition, even though we made that decision across the board for the whole organization. And like, even with this Q3 adjustment that's being requested, that's still not like a permanent fix. And so I don't have a question. I'm just putting that out there because this is not like black and white. Like this is very complicated. And I think like if the long-term strategy for everybody in this room is to actually do things that are going to actually make long-term systemic changes, it's not putting more money into the sheriff's office. And I think you agree with that. And so it's hard now because you're the sheriff and this is your budget and we have to approve it and work together. But the long-term solution here isn't us just pouring more millions of dollars into the sheriff's office. And so that conversation I expect was going to continue while we're in the millage advisory discussions, but it's hard for me to like be comfortable and okay with that when I know actually what reduces our jail population is permanent supportive housing. That's actually what reduces the jail population. And that's what is, one of the things that we think about when we think about reducing recidivism. And so I'm just basically venting at this point because this is not great. And like people are hearing different pieces of the conversation about this and what the commissioners did and why they did it or why people think they did it. And we didn't do anything, as I think the chair mentioned earlier, for whoever the future next sheriff was going to be. We were making hard decisions a year ago because it's really hard to figure out the budget for the whole organization, for all of our employees, for every single department. And there are departments in this county that we are responsible for funding where we've had to cut corners and where we're not fully funding certain programs that would actually be a better benefit to the public. And we're being asked to pour more money into the criminal legal system. And so that's just my personal like philosophical beef with all of this. It's not personal to you, but I think it's hard for me as one person around this table to be comfortable with pouring more money into this when I know like what really will reduce the jail population is entirely not this. So I'll stop.
And I'll just say, I don't envy you all. It's not, I'm sure it's not easy trying to think about this climate we're in is not great. You're trying to think about how to take care of the whole organization. I think from my viewpoint, what I hope that you all will know as a board is if I did not have a reduction from the attrition in the budget, and if the jail, food and medical was covered, the budget would have been balanced. So I'm not asking for next year, if this is remedied, I'm not gonna ask for more millions to go to my office. But while we do all this front end prevention stuff that I definitely support, we do have a responsibility to care for the people while they're in jail too, because if you have them in their cells for too long, or that has mental health issues, like there's human cost. So you got to find how you can still have a compassionate environment as much as possible, even though it is a jail. You want to reduce harm in that environment as much as possible. And then if we can reduce the jail population, what should happen is savings from that should then go to the front end prevention, the supportive housing. I'm not trying to expand. Like I would love to put more money into these front end solutions. And I believe we have to do that, but we can't do that at the expense of the people that are in jail that like they're stuck there. So we have to take care of them too.
The floor is yours.
Yeah, sorry. I guess the only thing, I get that, but like specific to like the lockdown issue and like choosing not to do that more frequently as opposed to the previous year where it was 31, which sure, that's a lot, but that's like maybe 3 days on average a month. If I'm doing the math right, I don't know. I'm not great at math, but I guess like nobody wants to do that. Just like I think there are other policy decisions internal to the jail that might feel better doing, but might be costing us more money. And I guess I'm just saying, in the context of everything, where we're talking about people losing access to healthcare or losing access to permanent supportive housing and like permanent, like affordable housing, I guess like we all have to make tough decisions. And so it did, like earlier when you were walking through the slide, it didn't seem like if push came to shove, there was a willingness to make those tough decisions, even though we're being asked to make really tough decisions. Like if we choose to fully like meet this request, like what are we offsetting in other areas in the county right now? And so that's just the point that I'm trying to make. I'm trying to be as respectful as possible about it. And it's like bigger than all of us here. Like this, it's not a fun situation. Ideally, we wouldn't be dealing with a situation where the federal government is totally flipping the script on how we respond to homelessness and housing access. But we're going to be pushed into a situation now where we're not able to use HUD funding for the things that will long-term make a difference and keep people out of jail. We're only going to be able to respond in these like quick little only emergency, only if they want to get treatment and only if they're sober ways. And so that's going to put a lot more pressure on the jail. And so it might seem like we're just talking about the sheriff's budget right now, but like the jail could be overcrowded in the future because of decisions happening just with the housing thing. And so I'm just saying, like, when we got the presentation and the way that it was described, it seemed like there was no willingness to have to make the tough decision to go on lockdown more frequently if that's actually what it came to with the budget. And I get it that that's not great. It's not a great thing for you to have to like come to terms with or deal with. But like if we're talking about like this much money and that's all we have and that's putting pressure on the system, I would hope as one person around this table that you would be willing to also have to make hard decisions with us, because we're having to make hard decisions, and that sucks. And you might not like be supportive of that philosophically, but I don't want to give more money to the police. I have a philosophical issue with that and I'm being asked to. And I voted yes on this at the last meeting. And so I'm just putting that on the table. This is not something that I want to do. I have a philosophical issue with putting more money into the system of policing, but I'm being asked to. And I respect like the presentation. I respect the finance team and all of the analysis given, but I'm putting it out there. Like we are being asked to make a tough decision right now by putting more money into the sheriff's office. I'm one person, but I would just ask you to be considerate of tough decisions that you might have to make as sheriff that might be a problem for you philosophically, because I'm being asked to do the same thing right now. So that's the point that I'm trying to make.
Thank you. Move to Commissioner Beaman.
Thank you, Chair. Thank you, Chair, for being here with us tonight and for this presentation. I got a couple hopefully quick questions. The first one, the trend line on the overtime that has me concerned is looking at our contract patrol. Obviously, this started before your tenure, but is continuing through. As the commissioner with, I believe, the most contracts in my district, it's concerning to me. So can you speak to me about the difference between what we're seeing in the general fund patrol versus the contract patrol, and what we might do to alleviate this gap that we're seeing, or increase, I should say?
So decisions to backfill overtime in policing is a little different. We have minimum staffing levels for every area that we will fill. But there are times the contract areas do not want us to backfill for the overtime. So we also take that into account. I will say that I actually just met with Manchester and Lodi. I think the conversation went really well. They're getting they're gonna be contracting for a cops deputy, which I think is gonna work better for some of the needs that they have that are gonna help with some of these issues we've had with staffing. And the road patrol side, we just had 3 graduate the academy. We will get to staffing for our contract policing areas. It's just, again, it's the length of time because we don't count them as staffing until they're actually completely off training. But once they are, we will see better staffing in those arenas.
Okay, I guess I'm still confused on the discrepancy between the overtime on general patrol versus contract patrol.
What page are you?
I'm on overtime, fund OT hours by program area, general fund OT wages by overtime pay code. I'm looking at the chart on the left. The orange
Uh-huh.
line represents contract patrol. And the
Oh, I
sort of the
see. So
blue-
what this is showing is levels are unchanged over the years. So that's why you do see the dip during the pandemic, but that's why that line is more stable because the minimum staffing levels are pretty consistent. Whereas with corrections, it's post-driven, so it depends on how many people are in the jail.
Yeah, no. I'm talking about the general fund patrol versus contract patrol and the overtime difference between the two.
So that was the contract patrol, the
Yeah.
general fund patrol. Is this DB?
No, so this is the 2 different orgs. So this is literally the general fund road patrol is the dark, I don't know what color. Is that dark?
The dark blue.
Dark blue, great.
Mhm.
My eyes can't see that very well. So that's the number that goes down from 24 to 25, whereas, contract patrol is the orange one.
Is stayed stable.
Yeah.
But what did you all use to compute the
Just-
general?
Oh, just the org code. There's an org code called general fund law enforcement. Okay, so it should say general fund law enforcement.
Okay,
versus
that's a
patrol.
little-
Sorry.
No, it's okay. It's
Okay.
clarity that I need. It helps. Thank
Sorry.
you. No, it's, I need to know what I'm reviewing. So I appreciate that greatly. Okay, all right. I do have a different question, different slide. It's on the recommendations solution slide. Under item 1, there's the 2.7 million adjustment. Below that, there's an additional 1.6. So for 2025, the total would be 4.3 million, correct? All right. Then there is an additional need for 1.7 million. Is that with an adjustment of 4.3 million to the next year? So it would be an additional 6 million next year? Is that what I'm understanding?
So this 2.7 million adjustment was inclusive of the food and medical.
Okay,
We did have savings this year, so that helped to reduce the impacts of the attrition.
okay. So the 1.6 is included in the 2.7? Is that what I'm
It's my
understanding?
understanding when finance's intention was to include that. Yes.
Okay, all right, so it would be, okay, all right, that is much clearer. So thank you, appreciate that.
No problem.
Great. So I know we are at 7, but we got a few more questions. I'm going to go to Commissioner Light, then Robbie, then Commissioner Scott, then Sanders.
All righty, thank you for the presentation with some in-depth information. I know we're kind of beating the horse with this, but about the jail lockdown. I don't want to sound like an a-hole, and this is not meant to. I work with returning citizens. I work with those that are incarcerated. However, jail is jail. It is not a vacation. And so when we have individuals that are in our county jail, Unfortunately, right now, because we do have, a lack of, officers in the jail staffing, we may have to, to do some lockdowns. The state of Michigan, there's unfortunately no legal limit, on how many, can be imposed in the county or in the state. However, I don't want that to be for our county jail. But until, I heard you say we have officers that have graduated and that will be, do we have a roundabout date, maybe? Like, do you have a date of when the next amount of officers will be graduating so that we can know when they're gonna be able to staff?
Yeah, hey, Commandership, can you give us an update on the staffing in the jail?
Sure. So right now we have 71 officers. When the sheriff came into office in January, we are right below 50. And as you would imagine, that causes dramatic staffing problems. So it's not just the corrections academy that they have to graduate from. They also have to graduate from what's called the field training program. And that takes approximately 3 months. The corrections academy is 1 month. And then there's a year probation that follows. So every time that we get a new hire in, they have to do both of those programs. We don't wait for the academy to hire somebody. We do that. We put them through the academy within the first year of their employment per MCL. So if we keep on the trend that we are on now with hiring the amount that we have over the last 11 months, I would imagine that we'll see a dramatic improvement with people coming off of training and being done with the academy by spring. And just into the sheriff's point as well, it's not just not hiring people. It's about hiring the right people that are reflective of the sheriff's mission and the county's vision values as well.
Absolutely. So we're looking to about, so May, June-ish, per se?
Sooner the better, ma'am. Absolutely. Yeah. So in some of those things, we're not going to retain everybody. And if we hire you, we do our very, very best to vet people that are coming in. But if they're not going to be a fit with the sheriff's office, then we have to separate. So as long as things keep on moving the way that they are now, I think that's a reasonable goal.
Okay, so with that, and I know this is something that we may not want to do, but we are going to have to, do some lockdowns, because we don't have the staffing currently, and it looks like we're waiting, and we have about until May or June, that we will be able to continue, to function as we regularly would. I believe that we could put in place, lockdowns 2 to 3 days, a week, preferably on the weekend. I don't know, whenever the not highest visitation, I don't know if we have visitation 7 days a week, but we need to decrease our in-person visits and work on, some video visits. I know for myself, with my loved one that is incarcerated, when he was over the bridge, I wasn't going over the bridge, and especially in the winter, I wasn't doing it. And so video visits came into play, and the support and the love that he needed from his loved ones, he got it over the video because I wasn't driving. So I am going to ask that you all look into making it into, we're gonna have to implement some lockdowns. We don't want to.
I am not gonna do that. It is not humane.
It's jail.
It's
jail. It's jail. This is
Lockdowns
not
are,
vacation.
lockdowns are for safety. They are not because of the budget. It is not humane. We risk litigation. I think it would help if if you can do a tour in the jail, so I can actually show you what that means.
Well, I've asked for a tour early on, and I was told that that wasn't a good idea, but however.
No, I would love,
Not from you. not from
Okay,
you,
okay.
But from some of the staff there, I was told that wasn't a good idea. And it may have been at the intense time when I was going nuts, in the courthouse about our employees, because I don't play about our employees. That's just putting that out there. However, I understand that it may be inhumane if you feel as if it's inhumane. However, we have some individuals that are in jail right now that have done some inhumane things, and this is where they have to reside until they have either served their jail time or if they are going to be, unfortunately transferred to one of our state prisons. I know it's a safety thing. It's a safety thing if we have folks out and populate, out and we're like, okay, we gotta make sure, but we can't, we don't have enough folks to do it. So what do you do if you don't have enough people to man, to staff? Like, what do you do? We have to do something. And I'm not saying lock you down for, we're gonna have to break up the time. We gotta be creative on our lockdowns. Like, maybe it's from, right now, since it's dark early, we gonna lock down earlier. So instead of, we may need to increase it. So I don't know, but we gotta be creative. And lockdown sounds horrible, but like I keep saying, what are we gonna do? And if budget doesn't affect it and we can't, we gotta do something, but we need to.
And we are reducing the overtime with the hiring, so that will help tremendously. But I welcome you to come take a tour, so you can actually see the operation and, I'm happy to talk more about it.
Okay, but I'm still, I know that's not what anybody wants to hear, but it's the true truth that that's what we gonna probably have to do. And, as Commissioner Somerville was saying, it's a lot of things we don't wanna do, but sometimes we gotta get on cause I don't want nobody to be locked down for a whole day. But it happens because that's what it is. The next thing I wanted to ask was, currently, how many detectives do we have? And what was our previous, what was the previous amount of detectives? Like, how was that working?
We have the same amount of detectives. I believe we have 2 vacant spots. Is Commander Lowe, do you wanna?
Yeah, Commissioner, thank you for the question. Commander Lowe, Police Services. So we do have two, current vacancies, the Detective Bureau. That does increase the overtime a little bit, obviously, because the other detectives are picking up the slack. But if where to get those bodies to fill that from would be the Road Patrol Police Service contract. So, Commissioner Beaman had mentioned, some of these shortages that we have, they would be shorter staffed than they currently are to fill those spots. And part of it was retirements, which has been a lot of these vacancies, because years ago, we hired like we're hiring right now. So this conversation will happen again in 25 years. We had that many people that retired, and that many people that we had to hire. there were
So,
3 detectives.
so we have 3 right now.
No, I'm sorry. There was 3 that retired. We have 2 vacancies currently.
So we had 5.
Yes.
Now we're down to 2.
No,
No, we're down to 3.
no, that's the vacancies. So we actually have, how many?
Yeah, there's 2 DB vacancies and we currently have 5 detectives.
5 detectives.
Okay. So we had 7.
And we have one that's also a detective classification with our warrants, that does our warrants and in custodies.
And you said it does impact the overtime.
It would absolutely impact overtime because the detective work, the caseload that they have, and I think we've all kind of seen, recently there were some instances, with the barricaded gum and things like that. The Detective Bureau gets called out on those, and if there's less of them, they got to fill that in with overtime.
Thank you.
Okay, I've got a couple more. Or did you get something else to say about that?
More about the DB?
Yeah, before you.
Oh, yeah.
Oh, no, I was asking, did you have more about the detective Were you about to say something else? Oh, okay. So, the next thing is, we were talking about the doubling up with the officers. So I can only speak for my district. But, is it a possible way that we, limit and not let it be a preference or by their request if they double just for some time? We kind of restrict that, during like the hours of the days, and I can understand if they would like to double up at night, but if it's at 12 o'clock in Superior Township, believe it or not, it don't be that much going on. And I can see, and then in the wintertime, but you know, in the summer, everybody be outside and it be popping off as soon as it's like 8:30 over near MacArthur. I can understand that, but in Salem Township, in Northfield, they don't have hardly nothing going on besides like traffic stuff. So if we can, for like I said, for District 2, if we can have some restrictions on when doubling takes place, or if it takes place at all, until we are fully staffed per se in May or June, if we can just restrict that time, that's my ask. Not a forever thing, and that's the same thing with the lockdown. But until we can be fully staffed, and cut back on some of this overtime pay, I'm just asking for ways that we can cut back. I hate to be like, do this, that, and the other, and don't have a suggestion on how to do it. So that's my suggestion, is tell them they can't double up until like June. Not in District 2, you can't.
So what we currently do, I think there's a little misconception about the doubling up. It's like always happening. It's just automatic. It is not automatic. It's something we do regularly talk about with the lieutenants in our lieutenant meetings that we have. So the sergeant makes the approval.
Right.
And the sergeant's consideration is, what call volume do we have currently? What is our staffing levels at? And what is the deputy's capacity? Are they on their second 16-hour shift? Did they have court in the middle of their day and they only got 4 hours of sleep and then they're back for another 16-hour shift? They take all that into consideration. So it is definitely something we continually look at. You know, we've had a lot of conversation with the contract partners about that. So it's something we'll continually look at, but it is not automatic.
Yeah, I just would like to kind of restrict on how just let's put some limits on it. And I know you said it's the sergeant, but let's put some limits on it. And like I said, at least to May or June, not forever, because I think that's a safe thing to do. However, at the time of day that it's done and when it's done and the season and I hope like all of that is into consideration. But like I said, for District 2, it's not a lot going on.
And the other thing, I think it was mentioned with the labor contract, is there, in their labor contract, they do have it in there where they are allowed to double up in hours of darkness. That's always been that way. There was an arbitrator ruling under the Minzy administration.
You shouldn't even bring that up, but okay.
Well, I just wanted the context.
But for the daytime.
I apologize. I have worked here a while, so I got a little of the historical data.
Yeah.
For the daytime, we'll take that into.
Yeah, it's not that, I don't think it's a necessity. And if it is, if we could just try to work on that and limit it into May or June. So the next thing that I wanted to talk about or to ask about, and it's touchy, the fund balance. What do you all have in your fund balance? Because we probably gonna have to use some of these funds.
So we don't have a fund balance. We actually don't keep our surpluses anymore. If you're talking about the millage balance.
Well, whatever the fund balance was that, from when Sheriff Clayton, what was it,
Yep.
6.5?
Yeah, so.
How, like, do we have any of that left?
So there is, and I believe, so at 12/31, it was at 2.1. And then some of it is being allocated for the dispatch bond. And so that fund balance is depleting because of these funding issues. So I'll have a better idea of where that is at the end of this fiscal year.
Okay. And this is, and my ask for that was because I want us to utilize some of that, because that's what it's for when we come in hard times and you're in the deficits.
Yep, yep.
Let's see if we can, budget some of that, with the pennies that's left in the fund balance over to help the deficit. And then my last thing is a concern that I have. I was sent an article, by a, resident, and there was a gentleman, there had been a case where there was a gentleman who had sat in our county jail for 2 years. So we have housed and taken care of an individual for 2 years. He was charged with open murder. He is going to be released, because there was new evidence that, it was self-defense. I am just going to encourage, everyone to make sure that in all of our offices because we don't need to pay for any extras. And so I don't know what work needs to be done, but that's something that I'm like, okay, he sat here for 2 years.
Right.
And now his charges have changed, but it took us 2 years to figure out that this was self-defense. And what is that doing? We're paying
Yep.
for someone to live in our county jail that I guess wasn't guilty. I don't know. I can't say if he was or wasn't, but are we doing is there audits to go through and say, hey, this person has been here for 2 years. This person has been here for 362 days, when is he, because it costs.
Yeah.
And that's contributing to our food and our medical, and it's just things like that. How do we observe these kind of things, and what do we do to stop that? Because to me, every penny counts, and especially right now, because of the ignorant food that we have in our White House right now, we count pennies. I know I am, down to anybody asking them, nope, we don't have it. So how are we, observing, reviewing, and catching things like this that's went on for 2 years, that's contributing to the deficit that you have now?
Yeah, I mean, it's a really good point, and, it requires a lot of collaboration with the courts. Ultimately, we don't decide bond or if someone is in our jail or not, but, this is where I think a jail reduction plan and a collaboration with the courts to talk to them about what we're seeing. This percentage of our population's been here for this amount of time. Can their bond be revisited, right? There's times on hospital guards where we will contact the judges because the person is, we don't believe the person is a safety risk, or the person won't be getting out of the hospital anytime soon. So to save on the staffing, there's times that we've been able to expedite that process by contacting the judges. So we do try whenever we can, but I think it requires thoughtful and collaborative conversations with the courts, as well as probation and everyone involved in the legal ecosystem.
Okay, and then I have one more thing that was brought to my attention. I've learned that 200,000 residents in the state of Michigan, I don't know how many for our county, are going to have increased or have no health insurance. And so my main concern can only be for Washtenaw County. I can't help nobody else right now. We strategize, and so it's county for county. We gotta do what we gotta do for our own county. So if we have, I think it was 4 healthcare providers that are backing out. We got HAP, Molina, U of M, Humana, and if we're gonna have residents that are not going to be insured or not gonna be provided the Obamacare or whatever it makes up as, this is where I am being extra cautious on how we allocate funding internally, so to any department, any portion of our county. And how we spend, because we are gonna have to be here to assist our residents, and we're gonna have to be the backup plan. And if all of Washtenaw County is not, if we are not being fiscally responsible, and I'm not saying you're being irresponsible, but if we have deficits internally, our residents are gonna suffer because we're trying to fix things internally when I think it could have been prevented, or we could have come together sooner. And I'm uncomfortable not making sure that however amount of residents in Washtenaw County aren't gonna be able to receive the health care that they need, because we are Olivia Popin, fixing up and paying for, deficits. And so we just gotta really take into consideration, because I'm going, it's the song that says, take me through there. I'm going through everybody. So it's not just your department, but we cannot utilize all of our funding in these great numbers, and we have all of these things that are gonna come forth. We have individuals that are gonna lose cash assistance, and it's called the PATH program. I used to work that program. It's like 2 however many million of dollars that are not gonna be allocated to Michigan Works Southeast for that program through, and we're gonna have to do something. We're gonna have people that aren't gonna get any funding, let alone with the food. So we just need to, I just want everyone that is employed or is in Washtenaw County y'all don't have to cover your asses, because we don't have the money, and we got some bigger storms coming through, and we gotta pay for it. So I am open to finding ideas, saying, hey, we can do X, Y, and Z. I'm not coming to the table empty. But we gotta do something to figure this out, than it just coming, directly that way. So that's all I have.
Thank you, Commissioner.
Go to Commissioner Robbie.
Thank you, Chair. You all haven't heard much from me tonight so far, but I'm here. Hello. Thank you, Sheriff, for being here and for your presentation. I am going to keep my comments relatively brief and just say thank you for the work that you do, and your team, all the people that are here, all the people that aren't here. You guys do really amazing work, and what you're doing, some of the things that you're talking about here, are humane responses to complex and inhumane problems. And people are going to your jail, not because you necessarily want them to come to your jail, but because the court system is sending them there, or various jurisdictions are bringing them there to hold, sometimes on a pretrial basis, right?
Yep.
And so you have innocent people, pretrial people.
Pretrial, 9 out of 10 people in our jail are pretrial.
So those are innocent people. I just want to be clear with everybody, those are innocent people. You're innocent until proven guilty in our system. And even some of the people that are incarcerated have been falsely and wrongfully convicted, and they're innocent as well. So responding with humanity and not trying to lock people down to save money is probably the right thing to do, given that these people are innocent, 9 out of 10 of them, as you said. I want to say, when it comes to budgets, we have to be fiscally responsible. And what I've appreciated about your presentation is that you have showed us that you are coming to the table with cuts that you're making within your office, and cost containment measures that you've already employed, and that you've also heard my colleagues, and you put together a list of other ideas of things that could happen, that you've listened to various ideas that people have had. I'm sure that you're listening to ideas tonight, and you've said on a few things, yep, willing to consider that. That sounds good. You're trying to balance, though, the cost containment with the humanity of how we treat the people that are under your care, and how we treat your employees. And we have certain obligations under the contract, and certain obligations to our staff to keep people happy. The thing that a lot of people aren't talking about here is that, part of the turnover rate that we're seeing, the jail understaffing issue that you're having here is not unique to Washtenaw County. It's a statewide issue. It's at the state level, it's at county levels across the state, because the the work is difficult and people leave the job because it's just not worth it for a lot of people to do, especially with all the mandation. And so the work that you're doing to try to rehire staffing levels will lead to better outcomes in the jail. It will lead to better outcomes for the staff, Washtenaw County staff as well. So I just want to thank you for your work bringing that forward. I want to say, I would share some of the concerns that my colleagues have if we were 3 or 4 years into your administration and you were coming back to us continuously with budget overruns. That would be a concern for me. You're in the first 11 months of your time in office, and you were handed a deck of cards, contracts that you did not sign, that were signed prior to your time, and you're having to make do with that. And I'm willing to, as a commissioner, float your office through this period of adjustment with the expectation that this would not be an ongoing thing, that, you understand that you have to stay within budget, just like every other office holder and department head understands they have to stay within budget. And it's about making sure that that continues to happen moving forward. So those are my comments. Just want to thank you for being here today and for sharing your thoughts and for your service to the community. Thank you, Chair.
Thank you. I do have Commissioner Scott and Commissioner Sanders. I do have Commissioner Scott and Commissioner Sanders in the queue, but Commissioner Masiewski, who's not had a question, I want to go to him.
Oh, Jason.
Goodness. Thank you, Chair. Many of the questions I had written down have kind of been covered. And some of the longer range questions, I'm going to take offline and we can talk about those at a different time since we are running a bit long. But I wanted to ask about the hiring process and your projections as people are going through the training. And I wanted to know where, when it comes to filling the vacancies in contracted patrol, when you're bringing on new deputies, where does that rank compared to filling vacancies in the jail or in other parts of your office? We've got, in my area, in my district, we've got the Dexter Township, Webster contract that I have in common with Commissioner Light, and then the Scioto Township contract. So where does filling those contracted responsibilities lie when you're bringing in new people?
So when we hire for road patrol for road patrol. We hire for corrections for corrections. So we're not putting preference over one or the other. Like if we hire someone, they either are going to road patrol and they're staying there, or typically we might hire from the jail to go to the road. But we are prioritizing the contract policing in our hiring process. And it's a separate hiring process for corrections. If that makes sense to you? They're two entirely different roles.
Okay, I appreciate the answer. I appreciate you being here tonight and your staff as well.
Yes,
to
thank you.
answer the questions. And I look forward to meeting soon and going over some of the other things that are more long-term. So.
Okay, thank you so
Chair.
much.
Thank you, Commissioner Masiewski. Go to Commissioner Scott, then Sanders.
Thanks, Chair. Sheriff Dyer, I appreciate that Shipakasi is on the phone tonight. Is he still running the jail right now?
Yes.
He's not out? I thought he was out for a training.
Yeah, no. So as the jail administrator, when he has trainings, we are all 24/7. So just because I have a training doesn't mean I'm not sheriff. It's very similar. He's still running the jail.
Okay.
He's the jail administrator.
He's the jail administrator. How long has he been gone on that training?
So he is in the National Academy for the FBI. He has been gone for about, I believe, a month.
How much longer is that?
He will be done very soon. I think he has another.
Sheriff, yeah, I'll be done December 15th.
December
Okay,
15th.
congratulations, by the way.
Thank you.
Okay. I want to note that I'm actually, just want to go back to Commissioner Somerville's comments and talk about that, like, I'm not interested in doing the same things as usual. And what is a little frustrating is I feel like I have a same budget as usual plus some, and that's where a lot of the problem lies into me. I'm going to be clear, this is your budget. I have no desire to ideate. I want you to be creative, to think about where you're going to make cuts and what you're going to do. if you don't want to do lockdowns because you feel they're inhumane, and that's your subject area expertise, I hand that over to you. I'm not going to tell you how to run your shop, but you have to do something else. Like, and I think that's what you're hearing from us at the table. That it's as if I have a little tiny wee house and there's a chair I really want and I really want it. It's comfortable. I like took my dad to sit in it. He was like, "This is a great chair." You're right. If I want to move that chair into my family room, I gotta move something out of it. And I haven't made the decision about what I'm moving out. Like, if you want to do some of these things with the limited resources we have, you have to move something out. You have to be creative in some way, because when, when we have asked everybody across the board to make these attrition cuts, when other departments in the past have had a shortfall, we made them pay us back from that budget. Some of the people who are probably here tonight to give comments supported that when CMH had a shortfall. Some of you who are here to talk about this supported CMH having to pay that money back. I don't know why this would be different. I think other departments have human needs and they work within their budget. Public health, for example, has very real human needs and they work within their budget. It is a struggle, but their budget director really works hard to say, this is what I've got and this is what we can do, and cuts have been made. And when you're coming to us with this, just saying, we need this much more, and this is just what we get, it doesn't seem fair. It seems like we're rewarding something. Other departments who work really hard to stay within that budget are then not getting rewarded because they're doing that hard work. I mean, that's essential. Is we sit here at this table, that's one of the ways I see it. I think what we need to think about is how we have equitable sacrifice. Like, what is the marginal benefit of increased funding at the sheriff's office versus the marginal cost of health department cuts? Those are the actual realities of what we have to deal with here at the table. If the sheriff's office gets a raise or expanded funding or gets attrition back and no one else does, what does it say? And then safety net programs are reduced, for example, like at the health department, and they've lost funding. What does it say? It says like the county's priorities then, if we give this money here and then don't make up money other place, it sends a message that the police get priority and that prevention and health have less. And this runs counter to the values that I feel like I have about what I think government should be doing. I would like to be investing in public health. I'd like to be investing in thinking about how we make people feel safer and have less need for public safety. And I'm very interested in coming up with equitable sacrifice across the board and making sure that departments who are doing very real challenging work of staying within their budget don't feel like they're being penalized. And I'm very interested in coming up with creative solutions. There is a budget, there is a finite amount of money, there is work we need to do within this community. We need to start thinking outside the box and not just piling more furniture in the room. Thanks.
And I'll just say, I think, for me, we are different than other departments because we can't stop. So with the
Public health can't stop either, Sheriff Dyer.
with the
If public
20
health stops, what happens in this world?
I'm saying with the 24/7 operation we have, some of our vacancies, we have to backfill. And so the attrition impact was felt differently. And what I'll say to Commissioner Robbie's point, I walked into this. There was a slight overrun last year. The jail food and medical contracts were signed and never fully funded. And then there was a 2.5 reduction in the operating budget. I have really done my absolute best this year. I will continue, to your points, I will continue working to try to find savings any way I can in good faith. I am just asking for you to understand some of the reasons why it has been challenging with the attrition, because we can't just, like other areas might say like, okay, we don't have that spot anymore, so we're not going to fill it. We still have to backfill those spots. So it's the 24/7 overtime costs that make the attrition harder for us to to do cost containment with. But I hear your points. I will work on it. And it is my intention to work collaboratively with this board so we can really do the good work that we do to keep our county safe.
I'm gonna ask then that again, please, can you keep the meetings you've made with us and can you collaborate with finance when they're asking for information? In the memo you referenced, there is a lot of points about how that they don't have the information on why certain things are happening. Speaking personally for me, again, I have no desire to run your shop. I do have a desire to know why things happen and what is going on in order to necessitate that funding. I'm not sure I still have a clear idea about that, even after this conversation this evening. And I'm still on my point about equitable sacrifice and understanding a budget as a whole is a discussion about where our priorities lie. And my priorities lie in making sure basic human services are funded the way that they need to be funded. I also would like to tell you, I understand a 24/7 job because I work one too. So you're not telling me something I don't know about how budgets work and how staffing works. It's very much a part of my reality too. I literally and my colleagues, 24 hours, 7 days a week on holidays and snow emergencies and all the things that the people in your office do. We keep people alive and we go there no matter what. You're not telling me something I don't know about the exigencies of running 24/7. But what I'm not getting is the transparency I need beyond that staffing of other programs and other things happening to make it sure that I understand the necessities of funding this office $2.6 million more with no end in sight. Thank you.
Go to Commissioner Sanders, and then we'll close with Commissioner Somerville.
So I guess this has been mentioned, but I wanted to ask directly, what has your efforts been towards working with, collaborating with, like our finance department related to, because coming into office, you were aware that there were issues with the
Yep.
budget, right? So I'm interested in knowing, have you met with them? Has there been a concerted effort to get their sort of institutional knowledge and suggestions on things that could be done? Let me just roll through this and then I can go back if you need me to point out, so I can just get it all out. The humane terminology has been utilized and it appears to be used sort of as a buzzword. And I wanted to address that a little bit because I have not experienced a county commission that I think is more empathetic and caring and responsive to the needs of our residents, all of them. So when we use the term humane, I also have not received any complaints that our jail is inhumane in any way other than occasionally getting communications that an inmate is not receiving their medication or something like that. And I'll speak for myself. I fight for the underdog. Anybody that knows me knows that's clear. No exception about that. That's the same for the inmates. But I have a concern that we're not being equitable. The sheriff's department takes up, 60% of our budget. And that's not a personal to you. That's the responsibility of the office that you hold. But as someone that just attended the ribbon cutting for Alpha House's new East Side location, I'm trying to figure out how do I weigh this request for funding that likely needs to be spread out and better utilized for our vulnerable residents in this county. We are providing 3 meals a day, heat, a place to sleep, lay their head down. One of the reasons that I think we have this millage is because we found that people that had mental health issues and some other possible addictions were reoffending because they were then able to not be on the street, unhoused, unfed. And so I'm trying to understand, and I think that it's great that your administrative staff is here to support your presentation and some labor representatives. I've received a communication from one labor representative, and what I find odd is that I never hear from these same people when it comes to how we are supposed to protect and serve our most vulnerable. I never get a communication about, we need to do a better job of taking care of the housing and homeless. I don't see them filling our rooms. I think that it comes off to me as disingenuous that they're here for this specific thing, but to the rest of the residents be damned. It just doesn't sit well with me. And where have they been? They're just not showing up. They haven't been coming to our meetings. And so now that this is a budget situation, what are we supposed to do about our residents that may be affected by these 4 large insurance companies that have decided conveniently at the same time that open enrollment was occurring to drop these 200,000 people in the state of Michigan from healthcare? We're gonna have to pick that up for our residents that are affected. Because if I'm sitting next to Commissioner Light and she's hacking and coughing, I can have the best insurance in the world. It's not gonna protect me from whatever she's got. So I just wanna understand, and I want our residents to understand the decisions that we are being asked to make. It's great to have a lobbyist group on your behalf, but they don't know half of the story. They only know one side. There's 3 sides to the story. Your side, our side, and the truth is somewhere in the middle. I think as the 9 commissioners, we're closer to knowing what the truth is. We ask these questions for a reason. We don't divulge everything at this table, but we know more than we are able to share with our public. And so I'm trying to understand, and that's why I started asking you at the beginning of the year, what things was your office doing to try and mitigate some of these expenses? Not saying that they were your fault, but everybody's gotta take a little bit of a hit. And I'm an equal opportunity offender. Some of my colleagues are too, but I won't call them out. But we are tough on all departments. It's not just the sheriff's department. But we do have to try and figure out, we are in unprecedented times right now. We're 5 years out of COVID, still not really recovered, I don't think. And now we've got this entity running our country that is doing serious damage. And we're the ones that have to try and clean it up. So it's like having 6 kids and one of them is always causing a problem. The other 5 are not, you don't hear a peep from them, but you still need to take care of them. So what do you do? I'm not saying you're.
I gotcha.
I mean, you have to show some sort of equality when it comes to love. And that's what this really is about. How are we taking care of our other residents that are going to need? So we can have money, but we need to be super stingy with it. Because there is another shoe that's going to drop, right? And so while I have the bully pulpit, I will say, I would love to see our labor partners more consistent in their concern for the total county and not just some buzz situation, because they're sitting on resources and they could be helping us more than they are. I'll take the hit for that as a former UAW member. I'm not afraid, and I will happily have a conversation if they dare.
And, you know, I will just say we are gonna be building out a labor council to focus on a jail jobs program. And so I think that is actually gonna be a really positive step where we all work together to get people employment, real jobs. And I think that can also help reduce the jail population. And I'll say, you know, from my end, and I can only speak as sheriff running the sheriff's office, the most vulnerable people in our county are in our jail. The mental health issues, the substance use issues, unfortunately, I wish there were better options. And so our goal is to really work together collaboratively to continue to find alternatives and treatment and mental health resources. And we are all in a climate right now that quite frankly sucks. I sworn in sheriff, there was all these ideas we had. I haven't come to the board with any requests that I have for community priorities, and the goal was to try to find federal opportunities and kiss that goodbye, right? So we have had to be very creative and, you know, work with the resources, like this jobs idea, Ignite, all of that is gonna be no cost to you all. And we're gonna keep trying to find ways to improve and make things better without it being a cost on the county. Thank you.
Go to Commissioner Somerville.
Thank you, Chair. And okay, so thanks, Sheriff. We're almost an hour over regular working session time. People kept referring to my comments, and so I just wanted to kind of reiterate for people who weren't here for them. But the point that I was trying to make, which hopefully got across to you, but just in case, I just want to reiterate. When I'm looking at like the projected amount for jail overtime, that is a direct reflection of a philosophical choice based around, I think, people's humanity that you've indicated. And I think what I indicated is that we have decisions that we have to make around people's humanity as well, but for the whole county, for every department and for human services out, like external to the county. And so like I'm looking at this and I'm looking at this projection on the chart we got from the county administrator. And if the projection for jail for corrections overtime is 90K, and I've heard you say a few times, like it is inhumane to increase the amount of lockdowns, period. Like basically you don't want to do it, you won't do it. Is that correct?
I will not, it's not just me, this is standard jail operations.
I get it,
You
but
don't put people on lockdown because of budget.
I get that, but if you have to, and if you're being mindful of like the increase in costs and the overall impact of the budget, that is something that should be considered. And I'm using this as an example because if we had an extra $400,000 to $700,000 this year and next year, just to externally put out into the permanent supportive housing system, like that would be amazing. That would mean somebody doesn't end up homeless. That would mean somebody doesn't get traumatized and lose all of their belongings and have to hit restart on life. And so regardless of if they've ever been impacted by the criminal legal system, because not everybody who's experienced homeless has either committed a crime or has been impacted by substance use. So I guess the point that I'm trying to make, that I'll just try to make once again, is that we are being asked to make tough decisions. And by us not having extra money and by us pouring more money into the sheriff's office, we're making an inhumane budgetary choice right now not to prevent what's coming down the pipeline that we know is coming from the federal government. And so I'm just trying to put that into perspective. Like, you know, we have to vote on this item on second reading during our regular board meeting. And like, do we adjust it? Do we approve the 2.7 or do we lower that with an understanding that maybe you'll be a little more flexible and make some internal policy decisions that might maneuver those numbers a little bit? And so I guess that's the point that I'm trying to make. I'm trying to be like, honestly, a better partner than I was even thinking about being 6 months ago, because I'm telling you, and I think people understand this about me. I don't want to put any more money into the jail system at all. But like, I guess what I'm asking, like, you need to be willing to work with us, and you can't just say you won't do this one thing. All of this is humane. I don't want to see a single person in Washtenaw County become homeless because of a decision that the federal government's making, when we have the resources here right now to put aside to deal with that issue, but not if we use it to fill a gap in your budget. And some of those gaps are being created by policy decisions because of like humanity versus inhumanity. And I guess all of it is inhumane. And so I like, there should be some wiggle room and there should be some willingness to figure out how to reduce this projected cost for overtime for corrections. If that means you have to reduce a day for in-person visitations, not all visitations, but if you have to switch and like add more virtual visitations to reduce the cost, I guess that's one thing that I'm asking. Because it all sucks. It's all inhumane. But should we not be prepared for this other really big challenge that's coming down the pipeline that none of us are in control of, just because of policy decisions internal that we don't get to make for you? You were the elected sheriff. I respect that. I respect the voters, but you have to make hard decisions now, just like we do. And so that's the only point that I'm trying to make. I'm trying to be as respectful as possible about it. This is tough, but like, we're gonna be on this tough, hard decision boat for at least 3 years. And I guess I'm just asking you to make hard decisions with all 9 of us and not just expect us to be comfortable with like your philosophical opinion about your operations, when at the end of the day, we all need to work together to make the whole county whole. And like, while you're responsible for one sector of the county, we have the weight of the whole county, and even people who don't work for us. And so that's the point that I wanted to make. And I really do hope that it's coming through. It's a hard conversation to have, but it needs to be had, because there are a lot of people who never enter our criminal legal system who are going to be screwed by the cuts at the federal level with just permanent supportive housing alone. That's not even everything else. So I will end. I just wanted to make that point clear one more time, because it's a bigger picture. People are hearing snippets of this conversation or have heard brief mentions like at prior meetings, but what it boils down to, we're making budgetary decisions. If we take money from here and put it here in your budget, we have no money to deal with this other crisis that we know is coming. And so that's all I wanted to, like, the point that I wanted to make earlier. Like, I get it. You have mandated things that you need to do as sheriff, but there's also some flexibility, and I'm just asking you to be more flexible in the decisions that we can be flexible on. Thank you.
Sure, thanks for coming.
Thank you all.
It's prerogative of the chair that we're gonna skip item B at this point, the quadrennial. Just given how late we are. Chair, how long of a break would you like to take?
13 minutes.
13 minutes, okay. Can I get a motion to adjourn? All those in favor? We are adjourned.
It's late for the full board meeting of the Washtenaw County Board of Commissioners on December 19th. We always start the meeting, we stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Brendan? My fine tide friend, could you please call the roll?
Commissioner Beaman,
Present.
Commissioner Hodge. Here. Commissioner Labarge. Here. Commissioner Light.
Present.
Commissioner Machewski. Here. Commissioner Robbie. Commissioner Sanders.
Present.
Commissioner Scott.
Here.
Commissioner Somerville.
Here. Okay, hail, hail, the gang's all here. At this point in the meeting, we'll move to public participation. If you're here for public comment, you have 3 minutes. You can come to the podium and talk. There's a little signal of lights out there for you. Green means you're good to go. Yellow means that you should start wrapping up your comments, and red means your time is up. It will interrupt you when your time is up, not because I'm rude, but because I'm trying to be equal to everybody and have everybody have the same amount of time and show no preference for people going over. Please introduce yourself with your name and the city or township within you reside. It will make it easier for our amazing clerk to keep track of who's talking for the minutes. After we finish with people in the room, we'll move to online people. And after that, commissioners will follow up. We cannot follow up in the moment. It's not the way things are done. So we just listen to everything in aggregate and then respond. With that, would anybody like to make public comment this evening?
Good evening, Commissioners. So thank you for this time to speak. I just wanted to come and speak to you all about what's going on at Women's Huron Valley Prison. We got some new reports since the weekend that another woman has died due to the conditions of the mold there. And so it's horrific. And I know that as a governing body, there's nothing that you guys can do with the state. But we're just asking maybe if you all could even just do a resolution of support in support of the women that are speaking out and what is going on. There also is legislation that's being introduced to allow visits, elected officials to be able to pop up and visit because that right was taken away in the lame duck session, I want to say in 23. And so there is legislation now before the board, before state reps. And so we hope that that does get passed because there does need to be spontaneous checks at this facility. And so also wanted to ask if maybe you all could go in as a governing body to see what's going on there. Of course, they will take you on a guided tour and all of that. However, there are some things that I know that you all will be able to see. You can smell it in the air. And we got reports of some elected officials that went into a meeting back in September that actually had an allergic reaction to the mold while sitting in the building themselves. And so I know it is prison, I know, you know, but nobody deserves this. Nobody deserves this. And we just are here to ask if you all could put forth a resolution just to raise your voices to say that this is not acceptable in Washtenaw County because this is where this prison resides. So, thank you.
Can you say your name? and
Oh, I'm
city or
sorry.
town? That's all right.
I'm nervous.
We know who you were, but for the record.
My name is Trisha Duckworth and I am a Ypsilanti Township resident. And should I do the other?
And now
9?
you have a proxy public comment that you're going to give to us. Is that
Yes.
correct? Yep, okay. So totally different time, set anew, okay.
505-064. I'm in the Valley of Death. Yes, this is the Valley of Death versus Death here. Let's not leave here out. There ain't no medical. This is Death here. Just want to ask y'all to say a prayer for Jennifer Wallace family. I found out today that she passed yesterday. It's very heartbreaking. So we just asking that y'all pray for the families who lost their loved ones in here. This is so sad. My heart is just so hurting right now. But uplift them and keep them in our prayers. I don't even know where to start or what to say no more. Okay? We so stop. When is we going to take the time up there that people can do so? I'm speaking to the people that should do something and supposed to do something. Look into every time you look around, someone is dying in WAC, the Valley of Death. We won't answer. Why is no one taking it serious? Why? Why? People have loved ones out there. Kids is waiting on their moms to come home, their grannies to come home. And then they get the call that they are dead. They're not here no more. Families, I'm asking you all, do I find out? Just don't let them just tell you anything. It's more to the story. There's way more to it. Just do not let them just put it up on the rug or say they died from this or that for that. No, y'all need to find out really what's the cause of death with your loved one. Because what they telling y'all is lies. I'm here to tell you, they just telling you lies, the cover up. This facility is not safe for no one to be in. We've been sitting here in the cold for days. Finally, the other day, neighbors came in later on at night because we had to make calls to get someone to come in here to check the woman was running water out the wall. Our showers right now is loaded water is running all over our feet as I'm speaking right now. I think we had to put a bucket up under there to wash our dishes. That's the only way we can wash our dishes in here. This is just a shame right here. I don't know how it happened, Miss Connie Washington.
Thank you.
Shay, can you tell us the name? Did you get the name of the, can you
Name is
tell us the
Crystal
name?
Clark.
Pardon me?
Crystal Clark.
Thank you.
Thank you.
Thank you. Next for public comment?
Hello. My name's Tracy. I'm a resident of Ypsilanti, Washtenaw County. I'm also a student in my 4th year of college at Eastern Michigan University, working along with Survivors Speak. I've had the privilege to do a lot of advocating. I've done rallies at the prison, some of everything, but I am here today to, because I'd like to speak about the abuse and the medical neglect that is going on and has been an ongoing problem at Hermon Valley Women's Correctional Institution. The prison for some time now has been infested with black mold, asbestos. We all know constant exposure to mold can and does cause unwanted medical issues. I understand, that I heard someone speaking earlier saying that people have done inhumane things. Sometimes they live in inhumane conditions. That's not true. If a person is sentenced to time for doing a crime, that doesn't mean that they have to accept a death sentence because of the inhumane conditions that they are subjected to. The incarcerated women that have been affected by the poor living conditions and a lack of proper medical care have been speaking out only to be silenced. They get punished for speaking out. They are treated poorly. Some of them are having their medications taken away from them, pillows, blankets, officers throwing them in lock, putting their hands on them. There's also been evidence of physical and sexual abuse at Women's Huron Valley Correctional Institution. And yes, one person died this week. Crystal Clark has mold growing out her ears, her nose. She's had other health issues, her along with other women. If these problems are not addressed, more lives will be lost. I can't say that this is restricted to a certain culture or a certain neighborhood, because every last one of us have had someone or know someone that has been incarcerated, whether they were guilty or not. So I'm just asking that everyone and anyone that is capable, and like if you have the available resources, or let your voice be heard, because there are women that are being affected and they're scared to use their voice because they do have a lot of time to do, or someone will abuse them, or even worse treatment than they're going through now. Thank you for listening to me.
Thank you.
Hello, my name is Kelly Zeckmeister-Smith. I'm a constituent in Ann Arbor. I'm here to uplift the same story as Tracy and Trisha did. I actually have a statement written by one of our student colleagues, Bree, at the University of Michigan. What is happening at Women's Huron Valley facility is not right. No one deserves to live in moldy conditions. Under the 8th Amendment, which says cruel and unusual punishment shall not be inflicted, United States citizens have the right to be free from toxic environmental substances. Women's Huron Valley knows their facility has mold, yet still subjects people there to these conditions. This is immoral. This is not right. Everyone deserves a clean, safe environment regardless of circumstances. Women's Huron Valley is directly violating the rights of every person at that facility by turning a blind eye to the conditions of the building. What more needs to happen before Women's Huron Valley and MDOC step in and make things right? The institution knows what is going on, yet no action is being taken. Before inspections, officials just paint over the mold, or those incarcerated themselves have to clean it with their bare hands and bleach until the next inspection happens. A federal judge has recently ruled that the conditions at Huron Valley are dangerous, calling it infested with mold. Women inside are getting sick with infections, rashes, coughing, and death. In one particular case that we really want to highlight tonight, Crystal Clark, a 41-year-old woman currently there, has mold, as Tracy mentioned, growing out of her ears. She cannot sleep lying down. Anytime she tries to advocate for herself, she is retaliated against. Her health is declining, and we want to get her out. And so we are just urging you to use your platform, use your resources you have, please. Anything you can do, whether it's a resolution or better. It's clear that Women's Huron Valley and MDOC are purposely neglecting people. By ignoring the conditions of the facility, they are violating the rights of every single person currently there. Change must happen and something must be done. I do have an information sheet if I can pass around. Is that allowed? Okay, thank you so much.
Anyone else for public comment?
Good evening, everybody. My name is Laura Sanders, and I am from Dexter Township. Yesterday, at about 3 p.m., Mira advocates received a video of 2 immigration agents escorting a young Black immigrant woman out of the Ann Arbor Police Department City Hall building on Huron. This occurred despite clear local policy that prohibits the Ann Arbor Police from aiding immigration enforcement. We immediately contacted Chief Anderson, who was very responsive. He informed us that ICE used the Ann Arbor Police Department to allow the targeted woman to go to the bathroom. This has very much confused the community and broken trust, and some folks don't even believe this explanation. Despite clear guidelines, the Ann Arbor Police passively colluded with what was likely another unlawful arrest, yet another immigrant person from our community to be torn away from her family and disappeared. ICE has been in our county every single day making unlawful arrests. They have never presented a legal warrant, read anyone their rights, or honored due process. They have left school children abandoned, and now they are deporting people directly from Willow Run Airport. As far as we know, the Ann Arbor Police did not inquire about the lawfulness of this arrest or try to stop it. Instead, they were complacent with the kidnapping of our community member. We cannot say to ICE, we don't want you here, we won't work with you, but can't come on in and use our John. This was a city building, but this could happen in any of our municipal buildings, which is why we are informing you. We ask you to expand your policies to prohibit ICE from entering any municipal building or using any of our local resources to carry out their brutal, unlawful, and inhumane enforcement activities. We thank you and will be following up. Thank you so much.
Good evening, everyone. My name is Ryan Yapel. I'm Scioto Township Treasurer. I'm also a Scioto Township resident in the little bit of District 9 that's in Scioto Township down in the southeast quadrant. I'm not here to speak tonight in my official capacity as treasurer. I am, in full disclosure, Sheriff Dyer's campaign treasurer and continue to be. Appreciate you having public comment this evening. I also appreciate you bringing the sheriff to the table to have this discussion on the budget and the fiscal operations of the sheriff department. I will say that as someone who is now a year into local service, government finance can be quite complicated. There's a lot to learn and there's a lot that can be done. Commissioner Somerville, I think one of your ideas about maybe switching some of the in-person visitation to being remote or done virtually, that's something I could live with over locking people up. If we don't have to lock people up and have them on lockdown for 24 hours a day, I think this commission's done a really great job of taking care of the residents of the community as a whole. And when we talk about 9 out of 10 people in the jail or on pretrial detention, they are innocent until proven guilty. We should not have them on lockdown to treat them with as much respect and deference as we can, because if we were put in that situation, we would want the same treatment. We need to take care of their medical needs. We need to take care of their food needs. We can be unhappy about how all these things cost. They cost a ton of money, and they're not getting any cheaper. We see how our own health insurance is going up year over year at double-digit percentages. We have to expect something similar is going to happen, in a congregate setting. I really appreciate you all, having service to the community. Scioto Township's Downtown Development Authority was recently abolished. You had a communication in one of your earlier packets this summer, a letter from our board letting you know that hundreds of thousands of dollars a year would be going back to the general fund. Am I saying all of it should go to the Sheriff's Department? That's up to you guys. But ultimately, we're trying to find a solution. I hope you all continue to work with the sheriff and with the staff to try and find a solution as you would with any other department. Thank you.
Good evening, everyone. I'm Carolyn Stark. I lived in Ann Arbor for 40 years, and I'm also a member of Ann Arbor Indivisible. I have always loved Ann Arbor and Washtenaw County and have felt pretty safe from crime in this county. I have been confident that law enforcement and elected officials would respect the rights and dignity of residents and punish those who threaten our safety and well-being. Therefore, it has been difficult for me to understand why some community leaders have wanted to cooperate with ICE. I recently attended the excellent October 27th panel discussion of how ICE impacts Washtenaw County. Actually, I was out of town, but I watched it on YouTube and it was very good. It was helpful to learn about the response of the Sheriff's Department and county officials to ICE. I'm so glad that the Sheriff's Department is not cooperating with ICE and not helping them. Thank you to Commissioner Andy Labar for participating in this panel discussion about the impact of ICE. I learned that Washtenaw County Commissioners had eventually complied with a request from ICE to turn over 19 I-9 employee forms. However, I was pleased that the commissioners have so far refused to voluntarily hand over information related to the county ID program. Despite ICE's demand for this information, I understand that a legal firm has been hired to evaluate legal options so that this question of not providing all of the information that was gathered from people who applied for their county ID, that's still in legal limbo. I am requesting that you continue to remain firm in refusing to turn over the information that ICE has requested. This is not a business as usual time in our life. I have expected that there would be no tolerance of any gangs, such as ICE, invading our county. In their everyday work routine, they have quotas of people that they need to wound up, and they don't care whether they're citizens or not. They just grab people, they racially profile them. ICE performs criminal acts such as property damage, home invasion, unprovoked physical assaults, emotional abuse, kidnapping. Individuals who usually have no criminal records and are hardworking citizens. ICE is no better than a human trafficking gang, which would not be allowed free access to our schools, churches, homes, and businesses. They are allowed to carry dangerous weapons and wear face masks.
Carolyn, I'm sorry, it's time.
Oh,
Sorry.
they
Thank
have-
you.
Okay.
Thank you.
No idea. And for the sake of our community, please resist cooperating with the illegal and immoral group called ICE.
Thank you. Thank you.
Yes, I'm back again. My name is Bill Bray. I'm with Manchester Township. I've been trying for over a year and a half, close to 2 years, to try to get the township supervisor to enforce the blight ordinances, which is clearly in their ordinance. It's not one car, not two cars, it's 15 to 20 cars. And I do have evidence that it's a chop shop going on. And I do not want to go to the sheriff department, state police we would have to go to. But it's got to be clear, it's got to be taken care of. He needs to be pressured. He thinks he's a king. Well, that's something different there. But he thinks he's a king, but he's not. I had a meeting with him the other day, and he would not take me into his office. He stood out into the lobby, and he tried to degrade me. He tried to talk to me like I was a dog, said I was a big troublemaker. That's what ticked me off. Said I was a troublemaker. I'm a Vietnam Marine veteran. I was a fireman for Ford Motor Company, and I still volunteer for hospice and Meals on Wheels. And I do talks for kids, 40 of them last year. I was rated #1 in the state for that. I'm not a troublemaker. I just would like that guy, whatever he is, if he thinks he's a king, he's not. And he's luckily, I've learned over the years not to go resort back to my Marine tactics. But he verbally insulted me, which I did not like. And then he turned around and walked away from me. But he needs to do his job. He's getting paid to do a job, and he's not doing it, which he come out and told me he's not going to do anything about it. Plus, there's gas cans there, there's like 6 or 7 houses in a row. If one of the houses went up, there's no fire hydrants, it's on a lake, but it would take probably, response time would probably be at least half an hour for a fire department to get there. They would all go down. So I would like, if there's any kind of resources that I could go to besides the council here, I would be welcome to it. And the case has to be taken care of. Thank you. I'm going to get out of here early and give some more time to other people that's got some good things to talk about. Thank you.
Thank you.
Good evening. My name is Dave Drennan, and I'm actually a resident of Northville Township in Wayne County, but I live in the shadow of the Arbor Hills landfill. I'm also here representing the Conservancy Initiative, which is a nonprofit environmental organization in Northville Township, and we fulfill a valuable service. We're the watchdog of the landfill, and we try to keep an eye on their operations, although from afar. The Arbor Hills landfill, I think everyone's aware on the council or the board is reaching its permitted capacity over the next several years. And the landfill operators, I'm guessing they probably have contacted you and are already starting to lobby you. They are asking for a new landfill to be built just north of the existing landfill. I'm here to tell you that, you know, when they started their operations 55 years ago, it was a different area. It was very rural. It wasn't developed. The development is now 1,000 feet away from where the new landfill is being proposed to be built. Over the next 6 months, Washtenaw County will be having to decide whether to approve the new landfill or deny their request for the new landfill. I know this board will have the final decision. I know they'll treat it carefully. But I wanted to come here tonight and introduce myself to the board as a resource that if there's anything the Conservancy Initiative can do to help you to answer questions, we would love to paint a different picture than I'm sure Green for Life is painting on how that landfill operates. And we all, well, I won't go any other. The next part of my talk is just, Michigan doesn't need this landfill and Washtenaw County doesn't need a landfill. Eagle has stated data that shows we have over 21 years of existing landfill capacity in the state of Michigan. About 20% of our landfill capacity is used by waste coming in from Canada. In addition to this excess capacity, what Eagle's data shows is that the waste generated in Washtenaw County, the stuff that gets picked up at everyone's curbside, the majority of that waste doesn't go to Arbor Hills. It goes to Woodland Meadows, which is in Wayne County, located on I-275 just north of Michigan Avenue. And that's been in the news lately because that landfill has an approved expansion. And you can see it if you drive by I-275. That landfill is going to be there for at least the next 25 years. So simply stated, Washtenaw County and the state of Michigan really don't need that landfill. And what we should be concentrating on is innovative solutions and more recycling businesses, which will also spur the economy because it'll be new businesses in the area. With that, I know I've already sent some recommendations to the board. I'll do it again to make sure you have my contact information. And if we can do anything to help you with your decision, please reach out. 2 seconds left.
My name is Emmy Destel. I live in Ypsilanti. I am here to ask that you fund the jail's food and medical. I'm frankly a little disturbed with the callousness that has been expressed by some commissioners, especially in regards to people who are incarcerated. Just because someone did an inhumane thing, that doesn't mean that they should be subjected to inhumane conditions. And if you have a child that is causing more trouble, then you inevitably spend more money on that child. And lockdowns are not humane. As someone who lives with mental illness, I can tell you that it is hell to have to be in the same room for just one day. I've been stuck in an ER for 8 days, one room. And what that did to my mental health was so damaging. I felt like I was crazy. And objectively, maybe I acted a little crazy because I was in a hospital for mental health issues. I don't think that some people on this board are taking it seriously, that some of the most vulnerable people in our county are in the jail. They are the most vulnerable people because their care is not in their control, it's in the county's control. And I think you have a responsibility to fund that and to take it more seriously and look at it with a little more kindness. I have no doubts that you strive to be empathetic people, but I think in practice, there are things that are missing from your repertoire, from your experiences that are leading you to make assumptions about people and assumptions about people who've done bad things. So with that said, please fund food and medical for the jail. Thank you.
Jeremy Haley, Ipsy Township. Good evening, everyone. Just make a correction from last time. I couldn't make out the word because my right eye was doing something funny. It says anarchist. I was doing something funky. But I'd like to say congratulations, Commissioner Robbie, on the new addition. It's awesome. Just amazing that 2 half cells with genetic information can wind up looking like start at that point and end up to where we all are at today with looking who we are. It's an amazing thing. What I like to talk about is the rule of 72, and that kind of talks about financial doubling. Reason why I say this, because when I bought the house and the house got reassessed the second year, my house tax went up about $2,400 for that reassessment, adding over $200 some dollars extra a month to my house payment. This new millage that's coming on is going to add an extra $20 more. At some point, it's going to make my living conditions highly unaffordable because it keeps going up. And right now I can tell you I'm at a max, figured out about $2,000 mortgage payment I can afford. I'm sitting at about $350 away from that. How many more millages can I afford to have thrown upon me to try to fix things? Meanwhile, at the point where I need help, then I go, yeah, I need help, then I need to go access some of those millages to get help. It doesn't make any sense when you're robbing Peter to pay Paul, when you're using one millage to pay for the excesses of another that you're failing on one. I'm just asking, the system needs to be rethought and rethink and redone in a certain way. If this is affecting me, even with the $20 increment on top of what I already had, how many other people with my position are going to fill that? That's, one less tank of gas, one, little less on the electric or food. It adds up. And like I said, I'm at the point, I figured out it's going to be about $2,000 and I'm done. I'm cooked. Like turkey neck will be next week. What will I do at that point? Even at that point, a 1-bedroom place would be just as much at that point for what I'm paying for now. If anybody has any suggestions on how we can rethink this, I have a few, but the rule of 72 says your property taxes doubles every 10 years or so. That doesn't bode well for me. So, for a lot of other people. Thank you.
Good evening, everyone. Bob King, Ann Arbor. I first want to acknowledge that I sit here and listen to the horrendous conditions at Huron Valley Prison. I think, and I'm very grateful that we have the sheriff that we have that is running an operation that does think about the humanity of the people that are in there. And I appreciate the commissioners that support that. It's really important. The second thing is I listen about ICE. I appreciate we have a sheriff who's not cooperating with ICE. And that's a principle I believe, extremely strongly in. I've been through many, many tough budget situations, both with the UAW and figuring out when we hit really hard times, what do we have to do to change and to adjust? So I really appreciate the very, very difficult job that you have as commissioners, because you have to think about people that are going to be homeless. You have to think about people that aren't going to have food. You have to take many, many different things into consideration. And I think that that's an honest assessment. And I think that everybody has to be part of that. What I don't know, and I really don't know this, but is every department being asked to do the same as you're talking about the sheriff's department, number one. Number two, I don't understand how the county signed contracts for food and for medical services that were above the budget and then didn't adjust the budget to do that. The sheriff's office didn't do that. That was done by the county. So to me, that's county responsibility. Third thing is that I appreciate that the vacancy policy was for all departments, but I think you have to look at whether you're running a manufacturing operation, whether you're working in a hospital, wherever you are, different departments have different needs and have different requirements. And it doesn't feel like you looked at the 24/7 operation, the state mandates and everything that the sheriff's department has to deal with, and that you work together with the sheriff's department. So I know almost everybody in this room I've actively supported in different elections. A lot of you, my personal friends, I consider my personal friends. I really hope and pray for all of us. We're at a terrible time. And Caroline and Crystal mentioned, we have a terrible administration in Washington. We cannot allow what they're doing to divide us. So I believe that we all have to come together. We all have to figure out what is a plan that we're dealing with the difficulties that you're all handed, the budget cuts you're having already. I think you're going to get more, sadly. So let's all really be committed. Let's accept responsibility for what you did as a county on the food and on the health care, but let's also work together to figure out, because you do have an impossible job of how do we figure out to get funding and share it equitably and in the best and most fairest way we can. Thank you.
Hi. I am Elisa Guyton. I am a resident of Ann Arbor and live in Washtenaw County and work in Washtenaw County. And before I begin, I'm going to go back to my heart. And I'm actually going to ask all of you wonderful people to breathe with me for a moment. Sit in your chair and just take a deep inhale with me. Hold it at the top and slowly exhale. Thank you. You all are sitting in a seat of leadership. Leadership for Washtenaw County, leadership for the citizens who live within this county. You have an impossible job ahead of you. And that is why I respect each and every one of you, your voices, your experience, your wisdom, your knowledge to what got you here today. Yes, the times are crazy and chaotic. There's a lot of people out there who are saying it's an us versus them, and I'm going to challenge that. And I'm going to say it's a we problem. What is happening in our county, what is affecting the people in our county, all of them, including the ones who are suffering under lockdown, whose mental crisis are going to put them in suicidal conditions, as told by Trisha Duckworth and what she's experienced with Survivors Speak. Mental health is a crisis in Washtenaw County. What are we doing? How are we spending our dollars? How are we reimagining this budget to make sure that each and every person within our county is being treated equitably, humanely, and fairly? as a mother to two amazing biracial children who is worried about what world they're going to step into tomorrow, 5 years. I'm counting on you to be there for every single citizen in this county. So when you have hard decisions to make, remember the stories that Trisha Duckworth represents with her voice. Remember who you serve and what their mental capacity is, what their mental health is. So when you have big decisions to make, I encourage you to take a breath. Thank you.
Good evening, Commissioners. Ian Robinson, resident of Ann Arbor. I want to echo what a lot of people have said, particularly the last two speakers. I've been doing this work with the Huron Valley Area Labor Federation for over a decade now, and I've got to know many of you. I know that we share a lot of common values and principles, and I think that right now you are facing an extraordinary, really impossible situation. The cuts, on top of all the usual constraints, the federal cuts, and also the violations of civil rights that are taking place every day in our county right now, are challenges that your predecessors or you yourselves in earlier years didn't have to face. Now you do. I think that I want to echo what Bob said about us not allowing ourselves to be divided when we share 80–90% of the same values. Let's not allow the pressures and the anxieties that are coming down on us from the federal level to get us fighting with each other, because divide and conquer is the oldest game. It's the oldest way to defeat your enemies. And from Trump's point of view, we are the enemy. All of us. And so, I want to speak to two things in particular. First, I want to speak to the discussions that have been ongoing and I know continue to be ongoing. I don't believe a decision is going to be made about it tonight, but to reopen the pension and the healthcare plans that used to be available to county employees. We've seen a study, and this is very complicated stuff. I don't pretend to understand all the details. I believe that you're gathering more details, but it looks to us based on the study we saw as though this could be beneficial from a financial point of view for the county to do this as well as for the employees. So I want to urge you to do it if you possibly can, if that proves to be true, or if it's neutral. It's neither better nor worse than the old system from a fiscal point of view, then do it for the employees who worked so hard and made so many sacrifices for this work that they do as public servants in our county. And the other thing I want to speak to is really to echo what was said about the sheriff's budget. I think that, there's lots of details there too, but this budget, I believe, was approved on first reading. I think it should be approved on second reading. It's the details that are being argued about are not large enough to warrant voting no on this budget, in my opinion. Thank you very much, and good night.
Anyone else in the room for public comment? Ashley, do we have anybody online for public comment?
Yes, Chair. First, we have Hannah McCarthy.
Hi, Hannah, go ahead.
Hello, my name is Hannah McCarthy. I am a resident of Ann Arbor Township and a student volunteer from EMU who has had the pleasure of working with Survivor Speak. As my fellow community members, Trisha, Tracy, and Kelly have spoke about tonight, I would like to discuss the atrocities that are happening within our own community. Some may already be aware, but I wanted to make sure that all of you are in the know. It is with great concern that I report that Women's Huron Valley Prison is infested with black mold and even asbestos. Within the facility, there are 3 deadly molds that have been found. These conditions have led women within the facility to face great harm and even death. As discussed, just this past weekend, a woman has passed away within the walls. If action isn't taken, more women could die. I am asking you to use your voices to help save these women, possibly even pass a resolution in support of the women who are speaking out against these conditions. Thank you very much.
Thank you, Hannah.
Next, we have Luna M.
Hi, Luna, go ahead.
Hello, today my name is Alina Shaheen. I am a resident of Wayne County. I'm not from here, but I've been working with Trisha and Tracy with Survivor Speaks, and as a student of EMU, like to talk about the threatening conditions occurring at the Women's Huron Valley's facility. The prison has been reported to contain dangerous level black mold, including multiple toxic strains as well as asbestos. These conditions have already led to several severe illnesses, and women have died, just one from yesterday. If action is not taken about this, more lives will be lost. We're asking you to use your voice and consider supporting these women, including Crystal Clark, who has faced significant harm due to mold exposure combined with ongoing physical, mental abuse, and neglectment. We hope that support, even in the form of resolution or public acknowledgement, could help protect the women who are speaking out and fighting for their safety. And it has been going on for too long. So we just need more advocacy, and we need a solution to help these women. Thank you so much for letting me speak.
Thank you.
There's no one else online, Chair.
Okay. At this time, we'll have Commissioner follow up the public participation. Commissioner Justin Hodge.
There we go. Thank you, Chair. Microphone wasn't working there for a minute. Sorry, Greg. I don't know what's going on. Thank you, everybody that came to give public comment and have hung in there with us and to what's becoming a rather late meeting. You don't have to go to closed session with us, so it's going to be even later for us. I wanted to respond to Trisha specifically and everyone that came to support your remarks. Thank you for connecting the other person on the other side of the phone with us too. I think I appreciate you coming with a specific ask, and ask being a resolution. That is something that is within our ability to do. I know you've been advocating about the situation in the prison for a very long time, and I wish that there was more that we could do here, but I think it is well within our ability to do a resolution, both related to the prison itself and then the bills that you mentioned. So, and I'm sure other people are interested in this too. I think there's interest among us in doing that, and we'd look to do that soon. That's the main thing I wanted to respond to. Thank you. To Jeremy, I see you in the back over there. Yeah, I just want to provide some clarity about the WISD millage. I think people have the perception that we put that on the ballot. We did not. That was something that was put on by the intermediate school district board, and because they have the authority to do that. I certainly understand the frustrations around the rising taxes that people are paying related to millages of any kind. I actually did an exercise recently in one of my classes where we compared the amount of taxes that people are paying in different places across Washtenaw County. And it is a serious difficulty for a lot of people across Washtenaw County. So I'm glad you raised that, because that is difficult. And we will, at a certain point, and we're already at that point for many people where it's becoming unaffordable. And we don't, I spoke to a realtor recently who relocated a family from that lived in the city of Ann Arbor to Dexter Township, and specifically because of how high the property taxes that they were paying related to the various millages that are in that one municipality. So it is something that is definitely impacting families. So while we did not put that one on the ballot, it is still something for us all to be thinking about as other millage conversations happen in the future or related to ones that we have that might be expiring. So thank you for sharing that as always. And thank you to everybody else that came to do public comment.
Thank you, Commissioner Hodge. Commissioner Light?
I would like to thank everyone who came out for public comment to inform us of things that we may or may not have heard and to provide us with more in-depth information. To Survivor Speaks, Trichet, and the rest of the advocates, we appreciate you for continually to inform us of what we have before us in our county, because this is our county, and I am an absolute advocate of making sure that we do not have individuals dying on our watch. The word inhumane has been very present tonight. And I know when we were having our conversation about budget with our sheriff, I indicated that, you know, an individual may have done something inhumane, and, you know, then they may be placed in an inhumane space, not for conditions of life. That is something I want to make that clear. I am not advocating for anyone to live in inhumane conditions. And that's one thing I can say about our jail prior to Sheriff Dyer even coming into office. That jail, it was clean. And it still is. It was taken care of because people have to live there. And so that's something that I know we will continue to do. But back to our Huron Valley, we have to do something. We have to, it's always, our hands are tied when it comes to anything state. And as you said, just our advocacy and just assisting any way we can is what we should do. I know that there were some individuals that attend Eastern, and I was the former director for our Returning Citizens program. And what this program did was allow for our social work students, criminal justice students to go into the prison so that individuals could receive degrees. And I'm wondering if, you know, we can add, you know, those folks on board so they can, you know, tell us, hey, what's going on in there as well, to advocate as well. So make sure you reach out also to that program, to our prison program through Eastern Michigan University. They can be a big advocate because they're there. And they can get the information from the inmates because they're with them. They're educating them and assisting them to be educated. So as you said, everyone is gonna have to be on deck. And the next thing I wanted to do is to make sure that we reach out to our governor and we ask for a medical pardon. Because, you know, it comes down to our governor is gonna have to pardon her. And like I said, we can advocate and rally with you, but that's where we need to push the hardest, is because she's gonna be the only one that can do it. She's gonna have to do it for us. And as I always say, what I won't tolerate in this county is for anyone to come here because of whatever they may have been charged with, to die here. And that was not, we don't have the death penalty. So that is something that will not be tolerated. And we will have to speak later to all come together to figure out a way so we can get our governor to pardon this individual and to clean up and to ask more questions of why we have a facility that was once 2 facilities is now 1. What's going on? Where's all the money going to? So we will have to come together to do that. So I just wanted to speak on that. And with our landfill expansion, well, so I took this tour and I went and I visited GFL, and I was very pleased with the tour, with the information that was actually kind of an overload, but then he was like, you can come back for some more. And I will be going back for some more. I have some colleagues that was able to go back to get the some more. I highly encourage that you go, you sit, you tour. I went with sandals on and I changed my shoes in the truck and I'm like, I don't want to be, I'm on a landfill. I could have kept my sandals on. There was, I just, that was not what I imagined of a landfill. And when I looked at the map, when you take an in-depth look at everything and you do the researching, we need to come together and really say, you know, is this going to cause problems in Washtenaw County if there is an expansion? So I think I'm encouraging to have more conversations and to go and to have a one-on-one, to tour, to find out about the employment opportunities, the diversity that is there, and how my Salem Township residents benefit from the landfill. So I'm just asking for you to ask more questions, to visit, and for us to have more conversations. So maybe that we can come to some resolution of that is not as bad as it sounds. The next thing that I wanted to talk about was just to go back to our sheriff's budget. I'm not about locking down folks. That's not what that was. That was an example of saying, what do we do? If we don't have the staffing, and what do we do? So, you know, it's not about a lockdown situation. I would never advocate to have someone held for hours and days, but we need to be creative on how we can make adjustments. Like I said, the video visits, it did a wonder for me personally with my own loved ones that are serving a life sentence without the chance of parole. So I didn't have to go over the bridge. I could stay here and I could still see my loved one on a regular. So we just have to be innovative on how we are making sure that the individuals that are incarcerated, that their mental health, that we support their mental health, their physical health, and all of the things while we are going through these budgetary issues. But we also have to remember, as I said, we got to be creative on how we utilize our funding. We have some things that are coming towards us, and I've told y'all, I'm not scared, I'm not afraid, I'm being strategic. And so we have to be careful on how we utilize our funds. We have to make sure that we are utilizing every nickel and dime as they should. We can't misallocate. We have to do what we have to do. And yes, this is a hard job. I signed up for it. And because I did that, I'm going to make sure that I represent each and every one of the citizens and residents in this, I should say residents, not citizens, because I don't even want to go there. But every resident in this county that resides here, the blood is on our hands. So if we are not careful how we spend, and if we are allocating all the funding for this department or this department, then what happens to our residents when we lose the health care, when our SNAP benefits are gone? Like I told you, I went to a Michigan Works Consortium meeting today. And so the cash assistance funding, if it's not, the button isn't pushed by the 31st, guess what? We got folks out here that will not have anything. So it's not because we don't want to be able to make sure each department doesn't have a deficit. It's because we don't have the money. So we got to do some things. As far as with our pensions reopening, I am all for however and what is going to, for one, keep our employees here. But we have to be fiscally responsible. If it is something that is going to work within the budget, I'm all for it. If it's not, we got to be creative and figure out how it's going to work. So everything for me tonight, it's not no, or we shouldn't. We have to figure it out and we have to be responsible. And that is our job, is to be responsible. And because we're going to be held accountable, not nobody else. No one. It's going to be us. So thank you all for coming out. Your input, please send us emails, call us, let us know your thoughts, because it's all of our county. And I like to base any decision that I make that our residents are included. So please make sure that you stick with us and know that we are not out here just saying no. We're out here making real life decisions. And it's for all of our children, our future. Cause see, my little brown kids, I want them to be able to survive in Washtenaw County. And if I sit here and I don't make the decisions and with my colleagues that we have to make, then they suffer. So, and as I tell people, I'm not going to jail or hell for anybody's mess ups. So please, let's, as others have said, let's try to work together. And let's just be realistic on how money is spent, because we don't have money to just be ignorant with.
Thank you. Commissioner Robbie?
Thank you, Chair. Want to start by appreciating everybody that came out today. Great turnout. You know, in terms of the folks that spoke, thank you for speaking up, and to those that didn't speak but are here to support, thank you for coming out as well. And it's 9:15, you know, on a Wednesday night, and you guys are here participating in democracy. It's very important, and I thank you all for doing that. I'm going to try to quickly go through all the topics that were spoken to today. Trisha and the team talking about Huron Valley, thank you for your advocacy. This is not, unfortunately, a new issue. This is something that has been a long-standing problem. And these issues have been brought to the attention of the state and the Michigan Department of Corrections for years, and no action has been taken by the Department of Corrections to rectify the situation at that facility. It's completely and totally unacceptable, continues to be a problem, and now people are dying and suffering permanent human damage as a result. It's unacceptable and needs to change. I pledge myself to you and your group, whatever I can do to be helpful and to be a voice for Crystal and the rest of those that are incarcerated in those inhumane conditions. I want to help you in whatever way I can. I wish that, I don't know, I was quickly looking up on my phone if it was possible to get the health department involved or other, it's a state facility, so I don't know if that's possible, but we should explore every avenue possible. And frankly, there should be criminal charges brought against the people who are running the facility. Those are the people that should be ending up in front of a bench, in front of a judge, and held accountable for the way that they're running that facility. Because, you know, this is unacceptable. It's unacceptable in Washtenaw County. It's unacceptable in any county. This is the only women's correctional facility that is run by the state in the state of Michigan. It is in Washtenaw County, and this is, I've heard bad things about many correctional facilities across the state. This is the one that I've absolutely heard the most horrendous things about. This is where the worst conditions exist in the entire state, and it happens to be the only women's facility in the state. It's unacceptable. So thank you for your advocacy, whatever I can do to be helpful. On the immigration issue, thank you, Laura. I don't know if she's still here. I think she might have left. Thank you for bringing that forward. That situation is heartbreaking, absolutely unacceptable, should never have happened, should not be allowed to happen in our community for any law enforcement agency. Thank God we have Sheriff Dyer, but any law enforcement agency across this community should be turning ICE away. You cannot take a piss in our facility. What the hell is that? So furthermore, I would say what I said on social media recently, which is ICE is a criminal agency, and they should be treated in our community such as a criminal agency. Our law enforcement should be viewing them as criminals in our community who are taking community members from us. They should be asked to identify themselves, to unmask themselves. They should be arrested when they're breaking personal property. The best thing that I can compare them to is the accounts that were written of the British soldiers in the 1700s that were abusing their power that was given to them by the King of England. And it seems that ICE and the Department of Homeland Security generally seems to be taking their directions from somebody who fancies himself a king as well, and are conducting themselves in that way in our community. That needs to stop, and we should be leveraging every asset, every part of our government, whether it's law enforcement or any other agency, to put a stop to that and to frustrate their activities in our community to the greatest degree that we possibly can. And so I do think that law enforcement should be actively engaged in viewing them as a criminal entity when they enter our community. And I'll keep on saying that, said it on social media recently, and I'll keep on saying it publicly. On the landfill, I'll be very simple. I oppose the landfill expansion. I will continue to oppose the landfill expansion. We don't need more trash in our community. This proposal is complete BS. We are under a full-on assault on our environment, not just from the landfill, but from data centers as well. The gravel mine that's in our community, and biodigesters that are being proposed. The list goes on. Our environment is under attack, and Commissioner Beeman, a lot of it's happening in your district. This is unacceptable. I oppose it. And despite the fact that you're not from our county, I agree with everything that you said. Thank you for coming out tonight to speak. This is an issue that also impacts our residents, and it impacts the future of our community as a whole. On the pension and healthcare issue, I'll be simple there as well. I support the expansion, the reopening of our pension and retiree healthcare systems. I've said that from day one. I continue to support it. I will continue to support it into the future. It is financially feasible, in my opinion. It makes sense. The county is actually going to be in worse financial shape if we don't reopen the pension and healthcare, because we have less and less employees that are paying into it. We need to open it up so that more employees pay into it, so we have more money to invest, so that we can create a more financially solvent pension and healthcare system. The numbers, I believe, bear that out, and I fully support it. On the millage question, sure, millages are high, and I believe that we need to ensure that taxes are spent wisely in our community on services that people that are actually serving our community. But I will say this, millages are one of the only ways that we raise revenue right now, and I want us to rethink that. I've been advocating for this for years. I believe that the county should be focusing on creating more enterprises that the county can actually earn revenue for the county taxpayers using various enterprises. So like the parks do a good job of this as an example, through various parks facilities, whether it's selling food at the Rolling Hills Water Park, bringing money into the county by actively competing with the private sector. There's a lot of people, a lot of companies in our community that are making a lot of money off of our citizens. And I see no reason why the county should not be getting involved in some of those enterprises to earn revenue for the taxpayers. It makes us less reliant on property taxes and more able to do the things that we want to do without fully putting the burden just on property owners. So we need to be looking at ways to expand our revenue streams. We can do it. There's models of how to do it. This is just throwing an example out there. I used to live in France for a brief period of time. The French government brings in over $140 billion in revenue from companies that it owns, including the electrical company. They own the entire country of France's electrical system is owned by the state, and it brings in revenue upwards of $100 billion. So we could be doing things like that at the county. We could be investing in infrastructure and enterprises that bring revenue in, that reduce our reliance on property taxes. And the added benefit is that during a recession, we have more control over how that revenue picture looks. So we need to be looking at all that stuff. Thank you for coming out tonight. And that's where I stand on those issues. Thank you.
Thank you, Commissioner Robbie. Commissioner Beeman?
Thank you, Chair. I'll try to keep it brief and just echo a lot of what my fellow commissioners have said. Thank you, Trichet, and others for coming forward. These are unacceptable, inhumane conditions and should not be allowed to continue. The loss is too great. And we know some people up in Lansing, they used to sit around this table. And I think it's time to make some calls in addition to what we do in terms of a resolution. I would fully support that, but I think we also need to put some pressure on people that we know that have moved from this table to Lansing to help us with this heartbreaking situation. And Bill, I know you left, but I will contact Manchester Township again and see what we can do about the blight situation. It's unacceptable, and the treatment is unacceptable of a resident. We should all be able to approach our local officials with issues, and we may have banter, but it should be respectful. So that was very disheartening to hear. For those who don't know, one of the reasons I ran for office in 2018 was ICE. In 2017, I drove through my rural community and I saw my migrant workers zip tied on the side of the road. Before we had what we have today, it was happening then. And now it's happening at a very different pace. But it's still the same and it's still worth fighting for. And I can only speak for myself, but I believe my fellow commissioners all across this table are united in not working with an agency that's going to kidnap our residents. It's beyond. In terms of pension and healthcare, I want to make what works with the budget that's best for our employees. That's always driven by the numbers. I want to make sure it's sustainable. I want to make sure that, you know, it's available. So I'm open. I just, I'm a data girl, so I just gotta run through the numbers and make sure that it's absolutely doable so that we don't end up in a situation that would be detrimental to our employees. So that's very, very important to me. And in terms of millages, I agree. I don't like the way that we have to continue to use taxation. I'm also going to push another thing up to Lansing. We continue to be written into legislation and not receive funding for it. So we continue to have the breadth of our work increased and the funding for it, if not decreased, not increased. Our funding is flat. So when we look at things like data centers coming and biodigesters coming and more gravel pits and just all of these tremendous things coming our way, and there's no additional funds that are coming for us to make sure that your water is clean and your air is clean and that you are safe and all of those different things. I was looking at legislation that mentioned county services 12 times. We're not getting dollars for it. So just another call up to Lansing, please help. But just thank you for everyone for coming forward tonight, and your participation is so appreciated.
Thank you, Commissioner Beaman. Commissioner Somerville?
Thank you. I'm gonna try to not miss anything. I do not support the landfill expansion. I was partially on the environmental council call, but I had to be in two places at once last night, so I stayed on for as long as I could. But I work in Lansing, and I have had many conversations with the senators and House members who represent the community that's impacted the most by that landfill. And so I've seen some pretty brutal accounts of the circumstances that residents are in just outside of Washtenaw County, and that's no way to treat our neighbors. I also support bringing back the pension for employees who want that as an option. I know that we did that a few, like over a decade ago before my time here. And so we have some employees now who are part of that system and others who are not. I think we should allow employees the option. I think that there's a significant number of employees at the county who will choose the pension system because it just makes sense. If I had the option to switch to a pension in my full-time job, I would. I appreciate the feedback that we got from folks who were here interested in the conversation related to the sheriff's budget. I especially appreciate the fact that everybody understands the difficult situation that we're all in. That's really helpful to to know that everybody kind of gets it, at least everybody who is here in the room tonight and gave feedback to us. To the comment related to us enacting some sort of requirement for local municipalities not to collaborate with ICE. I wish counties had that much power. There's other states where where county governments have more zoning power, and I would love that. That would be amazing. They should give us all of the power. But unfortunately, we cannot do that. I do think it's disturbing to hear when local agencies are working with ICE on a values level. I think it's pretty apparent that residents in Washtenaw County, whether you're in Chelsea or Ann Arbor or Ypsilanti, are not comfortable with aiding and abetting the illegal agency that's abducting innocent people. And on the Crystal Clark comments, thank you for everybody who came out. I support the resolution, and I think it sounds like Commissioner Hodge wants to work on that together. So I can help with pulling some of the House bills that have been introduced. And thanks for the ongoing advocacy. When I was an undergrad student, I went into Huron Valley once a week, 2 different semesters, and worked, learned like with students inside Huron Valley, and that was over a decade ago, and the same problems exist, and they're not new problems. So I am committed to continuing to advocate, even though we're a level of government removed from being able to actually force the people who can make it better, make it better. But it's unfortunate. I know people personally who have been incarcerated at Women's Huron Valley, and I always believe when people mention the conditions because I've seen them, and I've seen buckets collecting water in the activity room that you go in for classes. And so I can only imagine what the spaces look like that the general public cannot see when they're going inside the facility. Um, and just, broadly speaking, I think a majority of the people who are even uh, at Huron Valley should not be there. So there's that. But thank you for your advocacy.
Thank you, Commissioner. Commissioner Sanders?
I almost forgot what I was gonna say. Um, Huron Valley Women's Correctional Facility is actually in my district. I have been asked and agreed to attend 2 meetings, one in person, one virtually, regarding the health conditions that are occurring at that facility. I've asked a ton of questions, some that involve how is this affecting the staff out there? Who are the staff represented by their labor, their organized labor? I've asked whether or not there has been any reach out to that union and their affiliated in solidarity other unions in this county to see if they are supporting, and how are the staff affected, because they are also working in that area. It is a state-run facility. Although it is housed in my district, we have no authority over it whatsoever. Our fire department, our first responders, our police are not first responders. The state of Michigan is responsible for policing that facility. I have agreed to go on a tour. Actually was supposed to do that this week. And I don't think they got my lien documentation in time, or I didn't think they did. And then I didn't receive a confirmation email with my name indicating that I was going to be allowed to tour the facility. So it looks as though they are trying to reschedule me and possibly some of the Pittsfield Township trustees. There was some leadership from Pittsfield Township that did attend the tour. I have not had an opportunity to debrief with them to find out how that tour went and what their thoughts were. So we are at least attempting to see what they will allow us to see, because you don't have free reign. I don't know if anybody's ever been in a facility before, but you're not allowed to take your cell phone in. You can't take more than $25 in with you. It's very restrictive. So I think possibly they will have this tour rescheduled for January, and I'll be able to ask questions when that tour occurs. And I don't think anybody that's incarcerated should be neglected when it comes to their health. And I've been curious about what it is about the women's facilities. I'm not saying that the men's facilities are much better, but we've had 2, Scott Correctional in Huron Valley. They closed Scott because of egregious conditions and lawsuits that the state lost related to the treatment of inmates, rapes, and all types of things. And I'm curious what has happened to that money? So we had 2 facilities that were being operated, and now we're down to 1. And we're still getting the same types of reports about the treatment. And so my questions are very much having to do with what, is this why is it that the females are treated so much differently and dismissed as though it's not important? But more importantly, and I don't care if this sounds like I'm throwing anybody under the bus, the governor, the buck stops with the governor. We cannot offer clemency. That's not within our power. And we don't run the Department of Corrections. But I will, when I'm able to share what I've been able to witness, as long as they don't cancel my visit now that I've opened my mouth. The other thing is the GFL landfill. I've had an opportunity to visit that location twice. Most recently yesterday. I took 7 guests with me for a second tour. I've not been approached by anyone that has offered to share another side of that story or their concerns about that landfill and specifically what they are. It's not in my district, but I have made it. I've been in communication with Commissioner Light. It is in her district, and she is aware that I went out for a second visit. And I took Michigan Works with me, as well as the owner of a truck driving school here in Washtenaw County. It is a unionized facility. They have various jobs that pay well enough for people to be able to afford to support themselves here in our county. Degrees are not required. And I was actually pleasantly surprised with the first visit. I can say honestly that I went out there with an attitude about why they wanted us to come out, and some preconceived notions about, they would be offended if I said this, but trash. And I would say that the education session that they provided for us was very in-depth. And I would be open to speaking with anyone that has an alternative view of that landfill and the service that it provides. But I know everyone in this room knows trash is not going away. We're producing it. We're trying to do a better job with recycling. That hasn't quite caught on. I've asked this before of Ann Arbor Recycle. There are no education programs that I'm aware of in our public school systems that talk to our children about recycling. We're past the point of, for the most part, of being reprogrammed, but our children are not. And I think that's interesting as well. But trash is not going away, and you got to figure out how to manage it. And unless they're making up stories, this is an extremely regulated facility. And I haven't decided yet whether or not I would support an expansion, but I would need to have some conversations with folks that can give me another view of what I have experienced in terms of my 2 tours at that facility. And I think it's interesting that it abuts to Wayne County. Literally, a road is the dividing line. And you've got $1 million homes that have just been developed within the last 10, 15 years. And they knew that landfill was there. They still built there. They still built those homes. So I had a ton of questions about that. It was rural. It is being developed as we speak. There's a Myers going up out there. There's a lumber company. There's a ton of development going on. They don't seem to be concerned about it. And it does not accept toxic waste. So I would love to get more information, but I've not been approached about why it should not be allowed to expand. So I'm open to having those conversations. I ask a ton of questions, and I try and understand more than one side of an issue. So appreciate having an opportunity to respond. Thank you.
Any other commissioners for follow-up to public participation? Commissioner Robbie again.
Just one more quick comment I forgot to make earlier, on the question of millages. One more thing I want to say quickly is, and this connects to what was said by the Scioto Township treasurer, but one of the other areas that I really think we need to be continuing to look at is all these tax exempt districts that are not paying into the tax dollars like you are as a property owner, that should be paying in to contribute to everything from schools to all the other things that we're talking about here. So I just wanted to make sure to say that as well. They eliminated their DDA. More of that revenue is now coming back to the county to do services. Everybody needs to pay their fair share. I just wanted to make sure to say that.
Thank you, Commissioner. I'm not gonna belabor any points. I'm just gonna say that I already asked the racial equity officer to see if he could arrange a tour for me and him, and I'm sure other people also at Huron Valley. I will know because I'm allergic like crazy to mold. So I will tell you. I also want to note that, we know the issues about health insurance doubling. We had a double-digit increase here at the county, and we worked on paying the lion's share of that ourselves, so our employees would not have to. More of what we want to be doing with our money. I appreciate everybody who came out to talk to us. There are so many things, so many varied comments. I appreciated that. I think we are all aligned here about being not big fans of ICE at all. Commissioner Robbie talked about them being like British soldiers. Personally, I think they're the Gestapo, but the analogies abound out there. Or the peelers in Ireland. Anyway, it's not a good thing. We'll talk later about Q3 budget impacts, but I just want to note that yes, we, again, as I noted in the working session, the attrition was done across the board. This was not directed at the sheriff. Neither was it something that happened after she was elected, as is part of the rhetoric that is happening out there. This happened before the primary election. And additionally, again, if you didn't hear the first time, the attrition was done so we could give raises after the 10-year contracts were up, because the plan was to red circle people at the top of the wage scale. So finding vacancy rates where money wasn't used was how we gave raises to people who weren't going to get them, how we got to a table mover. I stand by that decision now as I did then, and I feel it was the right thing to do. We asked for a 3% attrition from the sheriff's office when the functional vacancy rate was really between 10 and 12%. 3% is what we cut. We didn't cut 10 or 12%. We cut 3%. I am asking that we think about doing things creatively, and when you make operational decisions, you have to then figure out where you're doing things off and on. If I want to take a trip to Ireland this year, I have to figure out where I'm taking savings from for someplace else to do it. Guess what? I can't do it. So I'm not doing that. So you have to figure that out. You can't keep moving the furniture into the room without moving something out. We'll get there when we get there, and I'm sure we'll have more conversation about it then. At this time, I'd like to move to liaison reports. Does anybody have any liaison reports? Commissioner Hodge?
I'll be very quick. Thank you, Chair, for recognizing me. Thank you to Ashley. If you click on, if you're in the easy to use board portal, you go in there under liaison reports, there's what is called liaison report package now. And as I said at the last meeting, I was going to send you a written liaison report, and I did via email. And now it also appears in as a liaison report package. So I will not say any of the things that I said in the written thing, so you can all read it. I will add one other thing that's in addition to the most recent liaison report that I have for Advisory Council on Reparations. I mentioned in the written document, which you can all read, about the Underground Railroad tour that we did. That was discussed again as like the debrief for it was done at the most recent meeting, along with the overall strategy for the Racial Equity Office, which we've seen a part of that graphic before. So you can learn more about that there. The other thing I would say is I'm going to borrow some of Commissioner Light's language on this one. I'm hopeful that the next time we do one of those tours, some of the non-chocolate commissioners will go. That's to use your language on that one.
I was at work in the ICU.
Look, there's plenty. There will be. Look, everyone wants to go. I know there are plenty of opportunities, but okay, I will stop now because I have angered the board.
Can we, again, I'm just gonna focus on making sure that this time is to a liaison report from a specific committee that you serve on. We spend a lot of time talking about things that aren't liaison reports during this time. Thank you for your written report. Commissioner Light?
I have a liaison report that is actually a praise report. The Alpha House in District 2, Superior Township, has officially cut the ribbon to our temporary short-term housing for our homeless families. So I am very excited, and the commissioners were there for the financial support that we were able to provide. We were very happy about that, and all the other partners. And so it is just a blessing that we are able to start leading the way in the path to eliminate our homeless population in the county.
Okay, liaison reports from committees, please. Otherwise, do it in current and future discussion. I've got Commissioner Somerville, Sanders, Machieski, Labar.
Okay, I have a liaison report for Commission on Aging. At the last Commission on Aging meeting, we got a presentation from the folks who run and like manage the skip funds that we always allocate. And so I would encourage us to maybe have them come for a presentation at working session so the commissioners can get a better understanding of how the skip program actually works. And they have some pretty cool stories of situations where they've been able to make a real impact and getting people more stabilized and save some of the money with their fixed incomes. So they don't end up in an endless cycle of eviction. We also received a presentation from Washtenaw Housing Alliance on the shared housing program. That might be a cool thing to do, like a joint presentation on, maybe during a regular board meeting. It's a cool program that they've brought back to try to pair people up with older adults to help with the housing crisis that even young people are experiencing, but also help offset some of the financial constraints that older adults are facing on fixed incomes. And then there was a recommendation, a resolution approved to recommend that we move forward with the RFP for the millage in January of 2026 for food, transit, and housing. I did have to leave the meeting early, but I would have voted yes in that resolution, and I will continue to say here that I think we need to get the RFP out immediately in 2026. Thank you.
Thank you, Commissioner Somerville. Commissioner Sanders?
Let's see, 3. So, the Watts, my assignment for Watts, I had a conflict today, with Michigan Works meeting. So I had to choose. I chose Michigan Works. Watts has canceled their last 2 meetings. So I was not able to attend that one. I'll have to ask for information about what happened at that meeting today. But I attended the Michigan Works Consortium meeting along with Commissioner Light. And I think that the takeaway from that meeting is related to the possible loss of funding for their PAD program, which will affect about 10 of their employees. It's not a situation where they can necessarily shift them to something else. And so I think they have until December 31st to get that money in. They need it immediately. Michigan Works does not operate with like a reserve. That's just not how their budget works. It's kind of, they pay, they get reimbursed. It's a quick turnover. So I am hoping and praying that that money will be released that has been held up because of the shutdown, but also because DC is not really concerned with continuing funding for programs like that. So, but they are important programs. Let's see, what else? Watts, Michigan Works. Washtenaw County Road Commission. I was able to attend their 9 a.m. meeting. They had 2 this week. And they got presentations from their finance director, audit. They're looking good. They've done well. And we have benefited from additional funding from the state, Michigan, that will help us get a better grip on our roads, culverts, and bridges here in the county. And I'm going to say this, so don't cringe, but what they said was we will be experiencing quite a few additional roundabouts. So people can kind of whine right now.
I'm not
before
whining.
They have to deal with the traffic to get them placed, but they do work. So I don't have any, all I have are, good things to say about that meeting. They've got a wonderful team. They do a good job. They're very responsive, and they have taken seriously some of the previous history that they've had with the county commissioners in terms of their work. And so that's all I've got to say about that. Thank you.
That's great. Thank you. I have Commissioner Machewski.
Thank you, Chair. The Board of Public Works actually met this morning. And one of the things I want to highlight is the highly anticipated annual agricultural tire drive that will be occurring on December 6th from 9 a.m. to noon at the Farm Council on Ann Arbor Saline Road. So tell all your agriculture friends to bring their tires to that annual event that the Water Resource Commissioner's Office helps with. I also want to note that last night Dexter Township, and I know Laura Sanders was here earlier, she's a Dexter Township trustee, they approved a single hauler ordinance, which has been worked on. I worked on that thing when I was on the Dexter Township Board 10 years ago. And they finally were able to make some movement on that at their meeting last night. So I just wanted to note that as something that Warma has been trying to do for a number of years. It has been unsuccessful with, but Dexter Township took a step forward with it last night. So regarding the Materials Management Planning Committee, which I'm a member of, the gentleman that spoke in public comment, David Drinan, he's an ex officio member of the MMPC as well, the gentleman from Northville Township. So his voice is heard at those meetings as well. We have about another 7 or 8, maybe 9 months of meetings to go to develop the materials management plan. And I just wanted to note really quickly that the goals in that plan, again, are to reduce reliance on landfills, to increase diversion of recyclable materials, to improve and increase education around what materials can be recovered, and provide greater access to actionable information. And the plan will cover things like recycling, organics, special materials, capacity and siting of landfills, and be an overall plan for a 10-year period of time. This body will have an opportunity to vote on that plan. We're required to approve it or disapprove it and send it back, as well as the municipalities in the county. Probably that voting process will occur beginning in the summertime, late summertime, maybe next year, as we continue to move through a draft. There will be public engagement sessions, or at least a session coming up for the Materials Management Planning Committee that will occur, I believe, in January. And so there is public engagement at every meeting, there's public comment, but a specific meeting specifically for public engagement will occur in January. The plan is still being drafted, and so there's a lot more to come in the Materials Management Planning Committee. Thank you, Chair.
Thank you, Commissioner. Commissioner LeBar?
So in terms of the continuum of care, we had our meeting today, and the notice of funding did come out from HUD, and unfortunately it is essentially as bad or worse than we thought. The upshot is we're looking at a $7.3 million hole in the homelessness system, and particularly I want to flag one thing for us. Right now we spend 90% of that money that we get on permanent supportive housing. We are limited now by HUD policy only to spend 30%. The thing to flag is not just that, but it looks like an initial read that the HUD regulations will not allow us to send somebody from permanent supportive housing to transitional housing using these funds. So there would need to be a return to homelessness before they could get into transitional housing under the funding here. I flag that both for the human cost, but also because it will have an impact in terms of our sheltering opportunities this winter. So not good news, but news nonetheless in terms of we'll have to have a plan and a response in place. But that is unfortunately the reality we're dealing with now in housing. Next, Chair.
Commissioner LeBar, can you say those numbers again for us? Your first part right there, just,
Sure,
I just want to drive this point home.
Sure. The total hit to the homelessness system in Washtenaw County is $7.3 million. And to put it in perspective, we spend 90% of the HUD funds in this area on permanent supportive housing. We're now capped per HUD to 30%. And keep in mind what they're saying is basically we're only going to do transitional housing and only going to do it if the folks are sober and getting employed and all the things that the data shows. Nope, you got to go housing first, then deal with those other things. So it's bad policy in reverse at the worst time.
7.2 million.
7.3.
7.3 million. Thank you. In case you're wondering what our concerns are about budget adjustments. 7.3 million. Okay, thanks. That's the end of liaison reports unless I missed somebody. All right, next item on the agenda is a report from the county administrator.
Thank you, Chair. Good evening, Commissioners. Just a couple of quick items this evening, beginning with an update on the Eastern Washtenaw Community and Recreation Center. As you all know, we continue to build out the design and development team for that project. And we are focused now on the construction management RFP. Some of you may know, the commissioners that sit on that committee and who have been going to those meetings, that we've received 10 responses to that RFP. And just today, they spent some time going over the submissions in preparation for interviews on next Tuesday, November 25th at 9 a.m. So really looking forward to getting that team built out. I think it'll be a huge step towards really hitting the ground running with that project beginning early in 2026. Also want to take the time to thank Megan Bonfilio, our director of Parks, and Tony Kayumi, the director of OCED, for participating with me in a virtual discussion with Ottawa County. Ottawa County has a Parks Foundation, and we wanted to hear more about what was happening there and how we might leverage a framework like that to support projects here in Washtenaw County. So I want to thank them both for participating there. And then my last item is one that I am very happy to announce to this board and to this community. We have completed our process for the Director of Aging Services. And I just want to take a moment to thank Guillermo Hernandez, the Executive Director of HR, for shepherding that process through. and those three commissioners that participated in that process, Commissioner Light, Sanders, and Machieski. Thank you for that work. Joining us virtually this evening is Shannon Ifler. She is on the line and would like to say hello, and I'd like to say to her, welcome to the Washtenaw County family.
Well, thank you. Can you guys hear me okay?
Can hear you.
All right, awesome. So first want to say thank you for having me here tonight and certainly for the opportunity with your stamp of approval to serve as Washtenaw County's Director of Aging Services. So I too echo County Administrator Dill's comments around appreciating the time and energy that the county staff, commissioners, and the County Administrator Dill himself provided during the interview process. So my family and I are very excited to join the community, and I look forward to leading the Aging Services Department. So in this role, I will prioritize equity, community engagement, and make data-driven decisions, while always ensuring strong oversight of the distribution of the older person's millage funds. So as a social worker, I lead with heart, and I bring extensive experience serving older adults across direct service, research, and government. And I have a combination of practical application with evidence-based strategies. So I view this position as an opportunity to build an efficient department while also positioning Washtenaw County as a trailblazer in innovative aging well practices. So not only being a premier destination for aging in Michigan, but also in the nation. So through fostering aging-friendly communities, we can strengthen economic development, intergenerational connections, and cross-sector collaborations. So we can build on the work that's already being done in the county by service providers, stakeholders, and residents, and create a vibrant, resilient community for all ages and abilities. So I really appreciate the opportunity to introduce myself, and I truly look forward to serving the county well.
Thank you, Shannon. Yeah.
Thank you.
Then I'd like to close with one other thing, and I rarely do this, but I just want to lean in and thank the 9 county commissioners for your work around the budget. I know we're not there yet, but this year, there have been some very difficult decisions and challenges that we've faced as an organization and as a community. And I'll just say in the last couple of weeks, I've talked to most of you on a number of occasions about some very difficult items. And I want to lift that up to say to this community, a lot of work has gone into this budget, a lot of thoughtful conversation around what we do and how we create value for this community. And then lastly, I'll just say to our chair, Katie Scott, as you know, I have interrupted your day job about 10 times over the last week and a half with conversations around the budget. Just want to say thank you for giving the time and energy to the challenges that this organization faces right now. And then close with thanking all 9 of you for really leaning into some very difficult decisions. And I think our community will be better for the dialogue that we've had around this table and the decisions that we are yet to make. Thank you.
Thank you. Thank you, Administrator Dill. Next item on the agenda is a report from the Chair of the Board of Commissioners. I'm going to key up Jeremy in just a second to talk to us about this Washtenaw Care model. But I just want to also note that I heard also from Eileen Spring, who we all know is the director at Food Gatherers. She wanted to be here to give public comment. She was exhausted. I wonder why. But she noted that today was the 4th drive-through distribution morning. The first distribution was on 11/8. They served 241 households. Today, they served 198 households. In addition to the drive-through, neighbors came via bus and even on bikes. And each time when they arrived to set up shortly before 8 o'clock, cars were already lining up. Like the need is there. They're still going through the details of who they served, but she knows that during the first 3 distributions, 52% of the households were receiving SNAP benefits. 17% had a federal employee affected by the shut down, and 47% of them were households residing in 48197 and 48198. They were offered a squash. That's great. It's very seasonal. I love a squash. Hefty bag of potatoes, as your resident Irish American commissioner. I appreciate that. Onions, apples, a hearty box of shelf-stable pantry items, including low-sodium items, a gallon of milk, and important outreach information on how to access food in their neighborhood going forward. She wanted to note especially that she appreciated the help from the Racial Equity Office, Derek, Akeen, and Victoria, woo, and the use of the MSSI vehicle at each of the drive-throughs. Brady Peck got a shout out for helping them quickly secure the Briarwood location and managing the traffic queue at each of the events. Right, that is so Brady. It is so Brady, and I bet he was fantastic. If you don't know Brady, you're gonna love Brady. She said it was an inspiring display of public and private partners coming together very quickly to help. Food Gatherers was able to maintain our regular distribution to our 140 community-based pantries and host these additional distribution sites because in part help, there is Domino's Pizza donated a small trailer and driver for every distribution, dramatically increasing our capacity when we need it the most. And of course, Food Gatherers staff and dozens of volunteers at every shift, often braving chilly weather. It was cold and blustery winds to help our neighbors. So that's a little success story. We had a part in that, so thank you. Jeremy, come on up and talk to us about this program. I think he's got a little presentation. Commissioner Hodge and I have heard this at the Board of Health. We both thought it would be a good thing for you to hear. We are knowing with HR1, we just call it that instead of the other name, that there are some serious issues that are going to happen to have people be able to maintain healthcare in the county. Jeremy, I think will elucidate some of those things. Additionally, I don't know if you say it in here, but I think I say it every time I get the chance. The number one reason people go bankrupt in this country is because of healthcare bills. So I'm interested to think about what we can do to try to help mitigate that here in the county. Thanks, Jeremy.
Great. Thank you, Chair Scott, and thank you for having me here. My name is Jeremy Lapidus. I'm the director of the Washtenaw Health Project. Oh, we got a slide thing. Great. I'm here with some really uplifting news. I'm just kidding.
That's very funny.
All right. So, but first, healthcare coverage is essential. It is life-saving. It protects lives. It enables people to work. It protects families from medical debt or going bankrupt. And it frees up money for other things like housing or food. It also brings money to the local economy by helping pay healthcare providers and folks that work in healthcare offices. It's very important. So I'm going to go over a little bit of the healthcare coverage impact from the HR1 federal mega bill that was passed this summer. Thank you. But first, a little overview of healthcare coverage in Washtenaw County. Before the Affordable Care Act, about 9% of people were uninsured. And since the Affordable Care Act rolled out, now there's only about 3% uninsured today in Washtenaw County. About 250,000 or 70% get health insurance through their employer. And then there's about 11,000 who don't have insurance. Of those that don't have insurance, about 3,500 or a third of them are on the Washtenaw Health Plan, which is coverage for people who don't qualify for any other health insurance. And that's a program that we run. I want to talk a little bit about a story of a client that we served recently. AC is a 28-year-old hairdresser who's self-employed. She's a part-time student and her income is near the Medicaid limit. During her Medicaid renewal, which happens once a year now, she filled out her income but didn't deduct her expenses. And so it looked like she was over income. So she lost her healthcare coverage. In August, she was admitted to the psych ER for treatment. She was discharged from that psych ER with 48 hours of medication, no health insurance, and could not afford a prescription refill. She reached out to the Washtenaw Health Project when her friend referred her to us, and we were able to help her. We confirmed that she was eligible for Medicaid and enrolled her in Medicaid under presumptive eligibility, by which we were able to get her insurance turned on within 24 hours so she could get her medication immediately. We connected her to Washtenaw CMH so she could get ongoing care, and we worked with MDHHS to make sure that her Medicaid was correctly turned on and she was eligible for full Medicaid coverage. So now she has the medication she needs to stay stable and employed and in school. She's connected to therapy, reducing the risk of future ER visits, and her previous psych ER visit is now covered by Medicaid. AC is the type of person who's going to have trouble when the changes that come into effect with HR 1 happen, and they're starting already. So near-term marketplace coverage is impacted, or that's the Obamacare Affordable Care Act coverage. This is what the government shutdown was about, was extending the enhanced subsidies. We are getting people walking into our office. We help 1,200 people a year with Marketplace, and they are seeing premiums double. And they're making a really difficult choice of, do I want to have health insurance that costs 10% of my yearly income? Or am I going to not do that and be able to afford rent and food? It's a really tough choice. We're used to being able to say, here's a great option for healthcare for you. But now we're having to say, we have a bad option for you to choose from, and I'm sorry, we can't help you more. We're estimating that I estimated earlier that it was about 3,000 residents that would lose Marketplace coverage. I think that's going to be higher than that. It might be 3,000 to 6,000. That's about half of those on Marketplace could choose not to be covered. And there are also provisions in this bill that do not allow people who have work permits to get subsidies for Marketplace. So they are legal residents here, but they are not going to be eligible for Marketplace subsidies, and they will not be eligible for Medicaid. So they have no health insurance options. And that's the small part. And there's the Medicaid changes, which are starting to take effect in October of next year. Refugees and asylees are not going to be eligible for Medicaid. There's at least 1,600 in Washtenaw County in the last 5 years. I don't have a better number than that. It's likely more. Medicaid renewals are going to happen twice a year. So folks like AC, the hairdresser, they're going to have twice as much opportunity to fall off of health insurance. And Medicaid work requirements are going to go into effect in 2027. Estimates are that 40% of people on the Healthy Michigan Plan in Washtenaw County, so there's 20,000 people on the Healthy Michigan Plan, 40% could lose coverage. So that's about 8,000 residents locally. And it's not because people are ineligible for coverage that they'll be losing it. It's because of they're not able to navigate the bureaucratic challenges of staying enrolled. And the purpose of this bill was to create more of those so people would lose coverage. If we do nothing, 10 to 15,000 residents could lose coverage, making our uninsured rate go up to 7% or maybe even higher, close to where it was before the Affordable Care Act rolled out. This is a pseudo rollback of the Affordable Care Act. But we don't have to do nothing. We can do something. And I really believe that we can be a county that shows other counties in the state of Michigan how to respond to these challenges. The Washtenaw Health Project has a system in place to help people enroll in Medicaid. We help 4,000 people already navigate the bureaucratic challenges of Medicaid to stay enrolled and to get enrolled. We help 1,500 people update issues with MDHHS that might cause them to lose coverage. We help 1,200 people on Marketplace, and we have 3,500 residents enrolled in our Washtenaw Health Plan coverage. With support and community partnership, each of these areas could grow to help residents overcome the administrative barriers to health insurance enrollment or enroll in the Washtenaw Health Plan if there's no other option. So Washtenaw Care. This idea came to me from Commissioner Moskiewski. He said, what we have now is Trump Care. And so I said, well, what we've got to create is Washtenaw Care. Washtenaw Care, this vision I've developed in partnership with community partners, as well as talking with a couple of funders, Ann Arbor Community Foundation, United Way. Affordable health care coverage is available for anybody in Washtenaw County who wants it. Washtenaw County residents know how to access health care and health insurance and can get help with enrolling in health care from a trusted partner at a convenient location with expert support. It is a coordinated cross-sector countywide response to the healthcare coverage threats resulting from the HR 1 federal mega bill. The core components of Washtenaw Care are going to be, one, public messaging. There's a lot of misinformation or kind of feelings of I can't enroll in health insurance. We're going to need to counter that by saying, yes, you can enroll in health insurance. Yes, you're still eligible. No, Medicaid is not ending. And here's where to go to get help. We'll also need to expand Washington Health Plan enrollment to cover people who are not going to be eligible for health insurance, like those 1,600 refugees. And then the biggest portion of it is access to care checkups and community partnerships. We'll have walk-in locations and convenient places throughout the county where people can walk in and say, hey, what's going on with my health insurance? Can you help me? And we'll be able to check in and say, yes, your Medicaid's active, or no, it looks like you need to fill out a renewal, and here's how to do it. WHP will work with our community partners and train nonprofits and volunteers in order to assist with this. So just a little bit of numbers here about what I think we're going to need to do. We currently help 4,000 people with Medicaid enrollment every year. I think we're going to need to help close to 10,000 people a year when this rolls out. We currently help 1,500 people navigate bureaucratic issues with MDHHS. I think it's going to need to be close to 4,000. Washington Health Plan enrollment is currently around 3,500. I think it's going to need to rise to at least 5,200, maybe even higher. And we don't have the capacity to meet this need right now, but I believe we can build to get there. This is just an estimate of the cost of what I think it will take, which is a public information campaign of 100,000 to 300,000, Washtenaw Care access checkups and enrollment support in connection to primary care, 1 to 1.5 million, and then increased Washington Health Plan enrollment, 1.3 to 2 million, total cost of 2.4 to 3.8 million dollars. Now is the time where I think we can lean into the values that we have in Washtenaw County and say, everybody who wants healthcare deserves to have healthcare, and it should be affordable for them and shouldn't cause them to go into poverty. Thank you, everyone.
Thank you, Jeremy. I'm just gonna have you stay there for a minute in case there's any questions or comments. I'm gonna go Hodge, Maciejewski, Somerville, Labar. Okay.
Thank you, Chair. Thank you, Jeremy. I won't make too many comments because I've already seen this, but I appreciate you taking the time to present it here. It's been, as we've talked about here and in other spaces, it's one of my goals to make sure that Washtenaw County stays a place where everybody that wants access to healthcare can get it and have it be quality and affordable. So I appreciate you coming up with a plan like this to try to continue to make that a reality despite the federal landscape being what it is. So I appreciate the time and for you coming here to present this to us.
Thank you, Commissioner Hodge. Commissioner Maciejewski?
Thank you, Chair. Jeremy, I'm gonna go back to the Medicaid enrollment information you just presented, going from 4,000 to possibly 10,000 people assisting them enroll. What is that? What is the process for people who does this work in terms of helping people enroll? What is the process? How long does it take? What's involved?
Yeah, so we at the Washington Health Project do a lot of that. There are other people in the county who will help with it too, but we do more than most people. If someone comes and they need help enrolling in Medicaid, some people can do it on their own. You send them to a website. If you've got a W-2, you are computer literate and speak English, you might be able to navigate that on your own. So you can fill out an application, you have to upload proof of your income or send that in. And then, you can get approved. It sometimes takes 45 days. It can be pretty hard to contact a caseworker if you have a question. Now, if you've got a challenging situation, maybe you have multiple jobs, or maybe you don't, you're self-employed, it can be kind of tricky how to fill out some of this information. So we'll walk people through that. There are questions that are asked about when you're doing a Medicaid application that you sometimes don't actually have to fill out. They ask questions about assets, which you may not have to fill out if you don't need to. But it's not really obvious about that. And so people often don't return paperwork that's required because they don't want to answer questions about their assets, which they don't have to answer in the first place. And so it can be a really confusing process. If someone has all the paperwork together, it can be a 20 to 30-minute process. But if you've got to go home and find your pay stubs, or go home and try to think about, well, what were my expenses and what was my income? That can be a really, really time-consuming process, and it can drag out over months, frankly.
Are most of the enrollment assistance is done in person, or can you do it telephonically? How does most of it happen?
Yeah, I mean, most of what we do is in person. We have an office at the Towner Building, and we do that mostly in person there. We do assist folks telephonically, and we try to make sure that they don't have to come in more often than they need to. So we'll have an appointment with them, then they can send us documents, or, they can upload them themselves. But we find that it is difficult to assist folks, because if folks are able to navigate it telephonically or virtually, they might be able to do it on their own. It's the in-person help that is more helpful.
Have you ever considered, people have to come to Towner, is what you just
Yeah.
said. Have you ever considered going out into the community and doing it more kind of a community-based thing where you're going to people?
Yes, that is exactly what I've proposed
Right.
here, is going into the community in different locations around the county to be able to do that. Frankly, we have 30 to 40 people coming through our door every day and aren't able to respond to that right now. And so it's harder to do that kind of outreach, but I would very much like to do that.
Right. Historically, you haven't done it though.
We did do that in 2013 and 2014 when the Affordable Care Act rolled out. We transitioned a lot of people to Medicaid that way. That was funded by some CMS funding that went away.
Right.
So we're not doing that currently.
Thank you.
Mhm.
Thank you. Jamie, thanks you for being here, and for the work that you do. Whenever I talk to you or whenever you come here, it's like very clear how passionate you are about making sure people have access to healthcare. So I really appreciate that. I am curious. Obviously, some of the impacts for capacity will be determined by how many people can actually be out there helping folks. To what extent, if any, do you think some of the local health systems would be willing and or able to step in and help do some volunteer labor to help keep people connected to health insurance and help with the paper? I mean, obviously I know that some of the hospital systems have social workers that do some of that, but do you think that in a time like this, when the resources are going to be stretched, that there's a way to build some sort of volunteer network of trained people who can be, trusted to do this type of paperwork, to step in to fill some of the gaps, so that way we can use more of the money to actually provide the healthcare, and get people to step up. And I'm thinking about different ways to engage people in the community in volunteer capacities to help fill some of the gaps in the area where you need people to help free up some of the other money that we might have to actually either house somebody or give them health care or help them with their medication. So I'm just curious if that's been bounced around at all, and how we might be able to help build out some sort of professional network of people who can do that work on a volunteer basis.
Yeah, so I'm gonna take two parts of that. One is volunteering and one is health systems.
Yeah.
On the volunteering, that is definitely a part of this. Was thinking about a volunteer and training coordinator as a position. Well, that would then be able to train volunteers and then coordinate the sites where they were located, so that, and supervise them, because this can be pretty complex and nuanced work. And so making sure that folks aren't filling out applications incorrectly and doing a disservice to folks.
Right.
But I do think that it definitely is a part of this and will be a part of the solution.
Cool. Yeah, I would love to figure out ways where we could be helpful. I also think that there's definitely people who I know who are retired social workers who are really frustrated right now at everything that's happening. And I feel like we do this thing, especially in Washtenaw County, where we show up with posters to share our community frustrations with the decisions being made in Washington. But sometimes I'm like, okay, but how can we actually turn this frustration into action? And I know tons of people who worked as social workers for 40 years, and now they're just they're retired and they're trying to figure out how to do the most good. And I think people, obviously you need to make sure that people are trained appropriately, because if you're not actually doing it right and you're just making it worse for somebody, it's not really helpful. So I'm glad to hear that you're considering that. I think that would be really great.
Yeah, and I think I'm excited about that, and I think that we'll be able to make sure that we're in different locations across the community, and we'll also need to help recruit folks to let them know that that's
Yeah.
where we are, so that we've got regular folks coming.
Maybe we use the RV.
I have already
and
had,
take it on the road. I
I've
don't
already had a
know.
conversation
I
with,
think we have this RV that's like a mobile office.
yes, I've already had a conversation with Derek about that. I'll say on the hospitals or the health systems, one, they are going to respond to this in some way. I've already had conversations with them about some of their plans, and I want to work closely with them on that. They are also facing extreme financial pressures right now, and so I am doing my best to see if there's any funding they might provide for this, but I haven't been successful there yet. But I know we will work together on this as we are seeking to keep people covered.
Generating a lot of, I'm cute, as you know, LeVar, he likes on Sanders.
Thanks, Chair. I'll be brief. Jeremy, excellent idea that you've come up with here. I want to be supportive. Let me ask though, this is in response to timely federal legislation that has just happened in the last 6 months. How does this answer the question long-term? Do we have this structural need for Medicaid long-term and for this expansive work? My fear is folks would say, why propose a structural answer to something that could be temporary at the federal level? But I think there's ongoing work that WHP does that could be funded with this in terms of that Medicaid expansion and navigation. Is that right?
So yeah, I mean, this is written into law, and unless there's another law passed by Congress, I don't see this as a temporary need. I see this as a need that's going to grow and then continue to be there. Once you help people with a renewal or Medicaid, it's just going to come back in 6 months, or work requirements reporting. It's coming back. So I don't think it's going anywhere. An expansion here is needed in order to meet the need that's going to be ongoing moving forward, unless there's some sort of change out of Washington.
I ask that because I think the issue is relatively timely, but the consequence is structural. And your answer there speaks to why we would need this going forward. Really, the only thing that I think could change that dynamic is getting a single payer plan or some sort of massive overhaul of federal health care. So.
Right. And I would be very happy if something like that happened.
That does not surprise me. I would love to be helpful in this and work on it. And you and I have talked in my professional capacity, happy to talk to your board. So thank you for bringing this to us.
Thank you.
Sure.
Thank you, Chair. Thank you, Jeremy, for being here for the presentation and for your reach out earlier this week on this. Very much support this initiative. Happy to do whatever I can to be helpful. I do think you put a price tag on it in your slides. It's kind of a wide range, but I hope that this board can act swiftly to allocate at least a portion of those dollars. It sounds like you're working with some of the healthcare providers in our community. I don't know if you're asking them for specific donations or to help reduce the cost of that. It sounded like you were when we talked on the phone. But, you know, I think it would be good for us as a board to put something down as a start to help meet that goal that you've set out for us. I think Washtenaw, the idea of Washtenaw Care is a really good one. As I said to you on the phone, I would actually love for us to go even farther than that and start providing more care to those that are not eligible for Medicaid, expanding the health plan itself, you know, and expanding it to people that are going to be losing coverage on the exchange because of the subsidies going away, but falling beyond the economic constraints of Medicaid that are going to be without health care because they can't afford the increased cost of care on the exchange, but don't qualify for Medicaid. There's, you know, obviously that's another huge population that we're going to be looking at. So we have a huge gap for health insurance in our community. We need to think creatively. We need to invest in it. And I do think that there are ways to, especially with that latter group that I mentioned, create some, potentially even some programs that are health insurance at a reduced cost that still involves some buy-in from those that are receiving the healthcare. You know, since we can't necessarily do a payroll tax or things like that, that are other ways of funding health insurance, like what Medicare and Medicaid do. But I'm willing to think creatively with you, willing to support all those things, and willing to support dollars being allocated by the board in the immediate term to support your Washtenaw Care vision that you put out. And I mean, even if there's like a segmented, I know you kind of broke out like the different 3 categories and how much each one costs, but I wonder if there's a way to like make a phased plan that's like a more manageable thing, that maybe it's, you're coming to us for a, you know, $750,000, like this is what I can do for that much money, right? Is serve this many people, do this many things. This is what I would prioritize, that kind of thing. Probably would be more manageable for the board to look at, but, and still get you advanced down the road of getting towards that 3 whatever million you're looking for.
Thanks for your support. Be happy to come with a phased plan.
Thank you, Commissioner Robbie. Commissioner Light?
Thank you. We appreciate your hard work. I'm always excited when you come before us because you bring some good things. I just wanted to just add a little more on to Commissioner Somerville. We can include for those volunteer services, some of our social work students and healthcare students at our universities and colleges. So I think that will be a good way to make sure we get some knowledgeable, helpful volunteers to better assist.
Great, thanks.
Thank you, Commissioner Light. Commissioner Sanders?
Well, first, I was sleuthing you, Jeremy. Been calling you Jeremy. You've never once said it's doctor. I like
just
to
call me
give-
Jeremy.
I like to recognize people's, you know, that it's not like you just paid $5 to get that credential. So I'm literally sleuthing you, and I'm like, he's letting me call him Jeremy all this time. He didn't never corrected me. So Dr. Lapidus. I'm gonna ask you to take an educated guess related to the 200,000 Michigan residents that we mentioned earlier that are being kicked off of these 4 plans in Michigan. They're no longer participating in Obamacare. What do you think that will look like for our county? You know, if you had to hazard a guess. Because I guess Melina has pulled out University of Michigan, HAP, and there's one other. There's one other, I don't remember, but the article said that there would be 200,000 Michigan residents that would be affected.
Yep.
And they announced this last week, right in the middle of open enrollment.
I think you're referencing the Obamacare Affordable Care Marketplace, some plans
Yes.
not being offered in Washtenaw County that used to
Okay.
be offered. Is
Okay.
that correct?
Yes.
And so, yeah, Molina is definitely one where a lot of our folks that we served enrolled in. There are still other plans on the marketplace for folks to enroll in. I would say that they're okay and a fine replacement. So I think many people will choose those plans. There is a lot of confusion, though, about does my doctor accept this plan? And so, you know, what we're finding when we're helping people enroll in the marketplace right now is that instead of like a half-hour appointment, where it's like, yes, I'm just going to re-enroll in the same plan I've had for a lot of, you know, like the last few years, you have to choose a new plan, or you have to decide not to go with the plan. The people pulling out of the insurers pulling out of the marketplace, there are still plans there, but the plans are less affordable because of the expiring subsidies. So folks are kind of having to make that decision. It's more around the cost of the plan rather than the fact that these other plans pulled out. Now, the reasons why these plans pulled out, you know, maybe it did have something to do with the expiring subsidies. So I don't think that in and of itself, in Washtenaw County specifically, will cause folks to go without coverage. I think it is the price.
Okay. I'm gonna be a flamethrower and say that I think this would be a perfect opportunity for us to have discussions with these AI entities that want to come into our county. This sounds like a community benefit sort of thing. It wouldn't make or break their budget, so I'm just throwing it out there. There any other agitators that would like to join me, please do.
Thank you, Dr. McKee.
Thank you, Commissioner Sanders.
And anybody else have any questions for the esteemed doctor? I will just say, I think that's fabulous. I love the engagement that we had around the table about it. I'm glad that you were able to present this to the commissioners. And I think we definitely have to do more talk. I think about like every one of us, I can think like we all have personal relationships and like I can think about every single one of us at the table, an instance where we've used our own healthcare and like the peace of mind you have on like knowing that you can go to a healthcare provider and that it's going to be covered and that you're going to get the service you need. It's huge. And I'm eager to think about what we can do to and come up, you know, not doing things in the normal ways and thinking about new ways to do things. So I'm there and I'm glad to see that there are a lot of willing co-conspirators around this table. So thank you. Thank you very much, Jeremy.
Thank you so much.
Thank you. That's the end of my report. My God, it's 10:30. My phone, of course, beeped and told me it was time to go to bed, but here we are. The next item on the agenda, we have two special order of businesses. One, I will open then. This is a public hearing. Declare it open on the 2026-2029 quadrennial budget. Is anybody here to comment on that at this hearing? Okay, I don't see any. That hearing's closed. Next hearing, a public hearing on the Brownfield plan for 716 Sanborn Road, Manchester, Michigan. Anybody here to comment on this item? Okay, I don't see it. That hearing's closed. Oh, I'm throwing around the gavel. All right. Next item is appointments. Do I have anybody who would like to move the appointments?
So move. Support.
Okay, can we do, any discussion on that? Okay, great. Let's do a roll call.
Commissioner Labar,
Yes.
Yes.
Commissioner Light,
Yes.
Commissioner Machewski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville,
Yes.
Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Motion carries.
Okay, fantastic. Next item on the agenda is the consent agenda. Somebody like to move the consent agenda?
Support.
Any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Great. At this time in the evening, Commissioner, I would like to move our closed session up. And so I'm looking for somebody to move that. Commissioner Hodge, I think, see, I'm putting my shoes back on is what I'm doing back here.
Nice.
All right, Commissioner Hodge.
All right, thank you, Chair. I would move that we go into closed session to discuss pending litigation, Wasim Talil versus Washtenaw County et al. And to also discuss collective bargaining negotiation strategy, and 3, to receive opinions, plural, from counsel.
Is there support? Okay, that's a roll. Can I, yep, sorry, no, don't move yet. That's a roll call. Brendan.
Commissioner Machewski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott.
Yep.
Commissioner Somerville,
Yes.
Commissioner Beaman,
Yes.
Commissioner Hodge,
Let's do it. Yes.
Commissioner Labar.
Yes.
Commissioner Light.
Yay, yay, yay. Let's
Motion
go.
carries.
All right, see you when you see you. Some people needed to be humans for a minute, so I'm just gonna wait for them to come back. Michelle's not even here yet. Supposed to be at work at 11 tomorrow.
Let's be, same. 8 o'clock.
Coming in. All right, they're coming in. I'm gonna call the meeting back to order. Let's just do the first reading resolution. Would somebody like to move that? Commissioner LeVar? I guess I have to look up to see who's raising their hand.
Well, Chair, I try and do what I can here. So, on the first reading, resolution to adopt the 716 Sanborn Brownfield Plan in Manchester.
Is there a
Support.
second?
Support.
Okay, any discussion on this item? Commissioner Robbie?
I will be very brief with this, given the late hour. My understanding is that this brownfield is, it appears, the first project that we are receiving, Nathan, that is, housing only brownfield. That's what makes it eligible.
Right, it can just be housing. It could even be mixed use, with even no affordable housing that would still qualify under this,
Right.
Option.
But the point being, there's no contamination on the site. They're able to access the brownfield TIF capture due to the recently passed law that allows for capture for housing.
That's right.
Okay. And of the housing, the affordable component of it is 120%. So 20% above the area median income for a 15-year period. And it's 6 of the houses.
Correct. 6 out of the 30. The other 24 will be for sale. These 6 will be rented at least for 15 years during the affordability period. And the 120% refers to the maximum income of a qualified household, but they'll set maximum rent a little bit lower at 100%.
And rent is $2,500 a month to start?
Correct.
And the 24 homes that are being sold, are they being sold at a reduced cost or are they just market rate?
I believe they're market rate. Yeah.
Okay. I'm gonna be a no. We're using tax dollars to basically fund, market rate housing development here. I don't think that's a proper use of taxpayer dollars, but I'm not gonna belabor the point. I'm just gonna vote no and move on. Thanks.
Commissioner Somerville?
Yeah, I have a question about the rentals. Is there anything in the deeds that would restrict those from being short-term rentals?
Well, we'll have an affordability agreement as part of the reimbursement agreement, the usual brownfield reimbursement agreement that would prohibit that. But I don't, here's one of the developers here, Brian Farkas. You can speak to that if you want.
Brian Farkas, Ypsilanti resident. I've done a lot of these meetings, the first one in my home county. There'll be a lease agreement that'll prevent that. So they will not be short-term rentals. And so it would be impossible for them to do short-term rentals.
In every lease, even after like the first initial leases?
Yep. So we're very big on compliance, especially with our TIF agreements. And so we're gonna be watching that. If they were to have someone live there that made more than 120% AMI, that could violate the terms of the TIF and would prevent us getting the recapture.
I'll get to you.
Okay. Is there any way to deed restrict the property, like the affordable aspects of the property from short-term rentals?
I believe we recorded a deed restriction on these once it's passed, but we could. We wouldn't be
Okay.
opposed to that.
I would be,
Let me just thinking this through a little bit, brain's a little slow. I don't,
Because it's
you know,
1
we,
a.m.?
we have the power of reimbursement.
Mhm.
And if there were any issues with compliance, that's a pretty powerful tool to make sure that they are ensuring that these are rented properly and not as short-term rentals. So I feel like we have pretty good teeth to
Okay.
prevent that from happening.
okay, thank you.
Commissioner Beaman?
Thank you, Chair. Just want to appreciate the board for their consideration of this. It's a very advantageous build in Manchester, and I do appreciate the affordable rental component, especially as I'm having evictions in another area of my district from a bad actor. So appreciate good people coming forward, making housing available.
Commissioner Robbie?
Thanks, Chair. Just to build off of Commissioner Somerville's question, is the restriction on Airbnbs past the reimbursement agreement, or is it just during the duration of the reimbursement agreement?
Our concern would be during the affordability period, the authority's concern. So it
Which
would
is the
be
15 years?
15 years. Now, there is reimbursement happening of tax increment revenues beyond the 15 years, so there would still be some agreement in place. Whether or not that, I'm not hearing that they would probably argue against having that prohibition continue at least for the length of the TIF. But beyond that, I can't speak to.
So after that period of time, they could be Airbnbs, short-term rentals.
Yeah, I don't think we could regulate that beyond the
Right.
term of the reimbursement.
Thanks.
I just was kind of wondering, and it's immaterial, but how many Verbos and Airbnbs there are in Manchester. But anyway. Okay. Any other questions or concerns? All right, all those in favor, please say aye.
Aye.
All those opposed? Thank you. The item passes on first reading. Would somebody like to move the final reading, Commissioner LeVar?
Sure. Under 2A, a resolution approving the 2026 budget of the Washtenaw County Convention and Visitors Bureau. B, a resolution authorizing the chair's signature on the 10-year management agreement with the CVB. C, a resolution amending the older adults millage framework, adding Mylan seniors for healthy living to the list of qualified senior centers in the ordinance. D, a resolution approving the 2025 third quarter general fund and non-general fund non-structural budget adjustment. E, a resolution to adopt the 2026 through 2029 quadrennial budget. F, a resolution to approve contract 57321 with Wayne State University.
Support.
What items would you all like to pull for separate consideration? Commissioner LeVar?
D and E, please.
D and E.
Yes.
Okay. Anything else anybody wants to pull? All right, discussion on A, B, C, or F. Commissioner Robbie.
Thank you, Chair. I'm going to vote no on B. I've already told the CVB this. My primary concern is when I was on the board 10 years ago and we negotiated the closure of the Ypsilanti CVB and merger with the Ann Arbor CVB to make the Washtenaw CVB. Part of that negotiation and part of that deal was to have a quarter of the funds be dedicated to the Ypsilanti community. That was a commitment that I was part of making, and that is being removed in this 10-year agreement. When I make a commitment, I like to stick with the commitment that I made. And so I will be voting no on this item because of that removal.
Any, Commissioner Robbie?
If I may continue to item C.
Sure.
While I continue to have issues with how the senior centers have been funded, I think that this was an appropriate framework in terms of evaluating how much money should go to Milan, given that it's a split community. I'm generally not in favor of the broader list that we have and the methodology that we've used to determine senior centers in the county, but I am going to support this one somewhat reluctantly because there was a lot of thought put into the split and the methodology of how it would be funded. And I hope that we give equal consideration to future senior centers that do come forward and seek resources from the county, and that once we hire our staff member, that there will be some type of process or methodology developed for how we can add other senior centers, remove senior centers in the future, how we determine and curate that list. So I'll vote yes reluctantly.
Any other discussion on items A, B, C, or F? Commissioner Sanders.
Is it possible to, for the sake of the public, to have an explanation about Commissioner Robbie's mention of the 25% coming out of this contract?
I think if there's, sure. I think that the contract has been discussed, like, we talked about its final reading. Commissioners and whose districts they are okay with that. The members of most of the members on that board felt like that was the members that represented that area were okay with that change. Personally, I think it reflects a more equitable way or an equal way of looking at the county like as a whole, because it's a convention bureau for the entire county. And I think that also smooths out some of the issues that other communities had. I'm not talking about Ann Arbor, I'm talking about other communities outside, east and west. And I think also that the CBB has also had a real commitment to IPSI that I think continues in this agreement. I'll let Commissioner Somerville talk about it. I could see her hand up. She might be more eloquent than me at 1:10 in the morning because she's younger.
And to be clear, I'm not questioning, I'm just asking for more transparency for people that don't know what we know.
Sure.
Yeah, a business in my district, a business owner serves on the Destination Ann Arbor board. I've had extensive conversations with that business owner and a number of other business owners in my district, as well as the mayor. I've also talked to the supervisor of Ypsi Township, and while there's not full agreement there, the thing that I can say in my experience in the last 7 years as being elected official and serving the city of Ypsilanti, and now the surrounding area, that I have full confidence in the unified model being presented, and there's data that backs up that this, like, the way things have been going, and I think the way things that will continue with the commitment to fully have full operations in Ypsilanti and not any in Ann Arbor now, are gonna only make it a continued success for the Ypsilanti community and surrounding. I don't know if Justin wants to add anything, but the other point that I've shared with anyone who has any concerns is that we can at any time give us 6 months notice to tear this contract up. And so I have full faith in the staff and the board. And we've also included some two elected official positions on the Destination Ann Arbor board to help keep things straight. So I feel good about it.
Commissioner Hodge?
Thank you, Chair. Since Commissioner Somerville mentioned me, I thought I would talk too. Thank you. I would just add that we've seen consistent data and large amounts of data over time that demonstrate that Destination Ann Arbor is contributing more than 25% to the Ypsilanti area. I have no reason to believe that that is not going to continue. I am encouraged by the addition that Commissioner Somerville mentioned of adding having the two elected officials be appointed by the Board of Commissioners to be able to be on the board and to continue working with them to make sure that happens, as well as the ongoing commitment to having an office in Ypsilanti or the Ypsilanti area. There's a ton of data that we've been provided. The data convinces me that they will continue to support the Ypsilanti area, likely at a level above 25%, because that's what has been happening.
That's what I wanted to be laid bare for our residents to better understand. So thank you.
Commissioner Light?
I was just gonna say, removing the 25% has also relieved us of having to pay rent to a space in Ypsilanti that was typically holding us hostage, and it was benefiting the landlord of that building. And so now we will have the opportunity to utilize a new space in Ypsilanti. So I think it was kind of a good thing so that we could be relieved of that bondage.
Commissioner Robbie?
There are three components that mentioned the Ypsilanti community in the original agreement. One was the location of the office, which was a separate item from the composition of the board, which was a separate item from the funding level. And the first two items are still in there. The last item's not on the funding level. I'm a big proponent of putting stuff in writing. I understand that the CVB is investing a lot on the east side currently. But, you know, Sarah will not be the director forever. Hopefully for the next 10 years, maybe not though. Maybe she goes on to bigger and better things, but so there will be new people that will come. And I think it's important to set in writing, what our intent is. And if we want them to protect at least a quarter of the funding going to the east side, then we need to put it in writing. And the CVB can spend more, they have been spending more. But anyways, I pretty much expressed myself earlier that I made a commitment and I want to stick to that. The difference with the east side and the Ypsilanti community than the rest of the county is that the east side had its own CVB that they decommissioned to form the Washtenaw CVB. It was a merger of two CVBs. No shade, but Dexter, Chelsea, all these other areas didn't have a CVB that they gave up the resources of to create what we have now, which is why Ypsilanti was protected with that 25%. That was the history of it. So anyways, I'm voting no, but just wanted to add that context.
I will note in context that is 100% a part of the case history of what happened here, but while Ypsilanti does provide the second largest amount, it's at 10%. It doesn't contribute 25%, but I still think that Destination Ann Arbor is committed to continuing to focus on the east side of the county. I think that this represents just a kind of more forthright way of going about things. I'm pleased to be voting yes myself this evening. I also, think that at some point in looking at this, it's a 10-year contract, that maybe there's a point that I'm sure that Destination Ann Arbor would be happy to participate in. And 5 years down the road, just doing an analysis of how that money is being spent. And at that point, if there's something horribly awry, I think the contract allows us to readdress that at that time. So I'm thrilled with the contract as it stands right now. Commissioner Robbie, and then let's try to move forward. It's 1:15.
All I want to say is the 10% statistic that you mentioned, that was the case 10 years ago as well. They only contributed 10%, but I really fought for that 25% because I believe that the Ypsilanti community deserved to have a disproportionate share of the money because they were sacrificing their CVB, and that's how equity works. Happy to go.
Commissioner Hodge.
Thank you. And Commissioner Somerville is probably going to call it a question if I talk too long. I would just say that I would rather continue to see investment beyond 25% rather than capping at 25%, since that is what has been happening. So I think this is a bigger win than 25%.
I think so too, and I'm happy to take the lead on this item from the commissioners who represent that part of the county. Yeah, Commissioner Somerville.
I'm so sorry, but I just want to be clear that I've had conversations with business owners in Ypsilanti who have confirmed what I already know, which is that Destination Ann Arbor and Ypsi Real heavily invest in the Ypsilanti area, not just in Ypsi City, but in Ypsi Township and in Superior Township and, you know, in Pittsfield Township, which is sometimes not considered, but a big portion of Commissioner Sanders' district also benefits from the advertisement and the work that's done by Destination Ann Arbor. So just wanted to point that out. Like, business owners, people who serve on the board that are the Ypsilanti representatives are comfortable with this effort. And by not unifying the whole county in this effort, I think we risk potential limiting what we're doing in Ypsilanti. So yeah, I'm totally good.
Any other comments, questions, or concerns on items A, B, C, or F? I just want to note that in case it was not clear, this contract 57321 with Wayne State to provide evaluation of case management services for the MAP program is through the sheriff's office, just as a point of clarification. Let's have a roll call on A, B, C, and F. Brendan, what's your name?
Commissioner Machieski,
Yes.
Commissioner Robbie,
Yes, on AC and F. No on B, yes on AC. Okay.
Commissioner Sanders,
Yes.
Commissioner Scott,
Yes on A, B, and C, no on F.
Commissioner Somerville,
Yes.
Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner Labar.
Yes.
Commissioner Light.
Yes on A, B, and C, and no on F.
Right, motions pass.
Great. Let's move on to item D, a resolution approving the 2025 third quarter general fund and non-general fund, non-structural budget adjustments from finance. Questions, comments, and concerns? Commissioner Hodge.
Thank you, Chair. I think that we had a long discussion about this in working session. I think this is going to be a challenge for us looking into the future to figure out how we're going to manage some of the costs. I will vote yes on the budget adjustment with the expectation that we're going to work on this in the future so this continues not to be a problem year after year. I want us to make sure that we have a balanced budget. So I would not want to vote no on this and have the county's budget not be balanced. But I recognize that there are concerns and I hope that we will address them in the near future. So I will vote yes on it.
Commissioner Sanders?
So I had a question about whether or not we have the ability to ask for repayment from, if we were to approve the 2.7. for the sheriff's department.
Catherine, I didn't have my microphone on. Catherine.
You saw me looking around.
It's you.
So the sheriff's.
Tina.
office- The sheriff's office is a general fund department, that gets funded, right, majority by our, operating tax from the, our millage. We have a structural problem likely. It will be difficult and challenging, but I think part of it potentially could be paid back, but it would take a lot of operational decisions and impacts and understanding the context.
I wasn't expecting all 2.7, but I was asking generally if we were to decide that, say we wanted to recoup 600,000 back. I believe next year they're gonna have a bond that will be paid off, which is approximately $800,000 or $900,000 a year.
That bond payment comes out of the public safety portion of the mental health public safety millage. That is the designated funding source for that bond payment.
So your answer is yes,
well-
but it would be a real pain in the butt.
Well, I mean, the board could decide to have the millage dollars pay back, right? Part of the projected shortfall for the current year.
Okay. Other comments or questions or concerns? I am thinking, and it's really hard right now. On the resolution, I'm looking at the resolution about the third quarter, a resolution amending the. Wait, am I looking at the wrong thing? Resolution. D, yeah, D, the resolution on D. So our resolve is that we're adjusting the sheriff's budget 2.7 million for the third quarter budget shortfall. What portion of that is the jail, food and medical? 1.6 million?
1.7 million.
1.7 million. I'm having a problem thinking about how I would do this, but I would like to make an amendment to have a third quarter budget adjustment to the sheriff's office of 1.7 million. Not 2.7 million.
So because we need a balanced budget, I need to know which of the funding sources you would adjust. So the million interest earnings, 700,000 of unspent wage reserves, and $1 million of surplus appropriations.
Well, I mean, I'm trying to work an amendment that offers something rather than just voting no.
Yes. I would say we'd have to adjust that other side of it too. So either we don't use the interest earnings or we don't use surplus appropriations, just so we can keep it a balanced budget.
What makes the most sense from a finance perspective?
All of the items in the Q3 adjustment are just aligning the budget better with actuals as they're projected. So all of them are fine. It's really just depending on if you want to allocate revenue of the interest earnings or allocate expenditures. But either way is okay.
Can my amendment just be $1.7 million allocated as finance times best?
Sure. We can figure it out.
Okay. That's my motion. I had a support. Okay. Do we have any discussion on that amendment? What is the question? Commissioner Hodge?
Thank you. I mean, this is a question for you or the administrator, but what is the consequence then for, it's $1 million less?
So in our financial statements for 2025, the sheriff's office would report at this point $1 million shortfall. There is, it's late, I'm gonna forget the terms, but there is a letter that goes to the state that explains that shortfall. Keep looking, Tina.
I can help, I can help.
Okay, thank you.
So the financial statements will be reflective of a shortfall when it compares final budget to actual cost of $1 million. There, along with the financial statements, will be a note disclosure. And the note disclosure is excess of expenditures over appropriations. And that note is reviewed by the state, and sometimes we get letters on things that are included on that note each year that we have to respond to. A one-off potential budget overage that is covered by fund balance, because ultimately that's what will happen is the shortfall will be covered by general fund balance because there's available fund balance. A one-off note from 1 year is no big deal, but if it becomes a habitual thing over time, then they scrutinize it more seriously, and if it also increases over time. So it would just be, we would be responding to a letter.
What are the consequences potentially for?
Well, it depends, if we try to issue debt, the state could look at, or the bond rating agencies could look at, they do look at fund balance levels, but they also look at, how our budgeting and our financial statements and how well we do that. We try to not have shortfalls, right? We try to progressively and proactively address them, but there's always, every year, there's some instance of not capturing all the expenditures all the time, because right now, we're doing projections and you can't modify the budget after year end. So sometimes the year comes in. So it's just a scrutiny thing and a review thing that we respond to.
But help me understand, because you just said every year, you don't mean every year we get this kind of letter from the.
No. There's parts of the budget that we have small nominal shortfalls every single year. So it's a standard note in the financial statements. If you want the page number, page 94, financial statements.
But if we were to not do this, then this would not trigger additional scrutiny by the state.
If you did not do any.
If we did not do this amendment, is what my question is.
If we didn't do the amendment.
If the amendment fails and then we pass the Q3 budget adjustment, then we don't have to deal with this letter with the state.
For the sheriff's office, right? There might be other departments on the note disclosure that would still have a review of the state.
But I think we would know that at this point, wouldn't we?
Yes, most cases, right? We try to proactively address it, but each year, I mean, there's a list I can show you.
Do we have any other departments that would be on that list this year?
Not that I'm aware of currently, no.
Okay, thank you.
Tina, I assume the same thing happens if we vote the amendment down and then vote the budget adjustment down.
Right. It's the magnitude's the difference.
Okay. Other questions, comments, or concerns on the amendment? Commissioner Somerville. That's what we're talking about. Any more on the amendment? All right, we'll vote on the amendment. That's a roll call.
Commissioner Robbie. Commissioner Sanders.
Yes.
Commissioner Scott.
Yes.
Commissioner Somerville.
Yes.
Commissioner Beaman.
Yes.
Commissioner Hodge.
No.
Commissioner Labar.
No.
Commissioner Light.
Yes.
Commissioner Machewski.
Yes.
Motion passes.
Okay, so now we have a Q3 budget adjustment of 1 point, that was my amendment, and I forget the number, 1.7 million. Any questions, comments, or concerns on the item as amended? All right, we'll do another roll call vote.
Commissioner Scott.
Yes.
Commissioner Somerville.
Yes.
Commissioner Beaman.
Yes.
Commissioner Hodge.
No.
Commissioner Labar.
Yes.
Commissioner Light.
Yes.
Commissioner Machewski.
Yes.
Commissioner Robbie. Commissioner Sanders.
Yes.
Motion passes.
Thank you. It's good to know that the board finds feeding and taking care of the prisoner's medical needs important. So thank you very much, everyone.
Next item that was pulled for separate discussion was the resolution to adopt the 2026-2029 quadrennial budget. Comments, questions, and concerns? Commissioner LeBar.
Thanks, Chair. I'd like to make an amendment to the budget to fund the Youth Assessment Center budget request that was presented on a working session a few meetings back. So I would move an amendment to fund the Youth Assessment Center budget request as a 3-year pilot for 2026 through 2028, funded by the use of fund balance in the amounts of 39,883 for 2026, 49,185 for 2027, and 58,590 for 2028.
Support.
Support.
I don't, Commissioner Robbie.
Commissioner, can you remind me what the Youth Assessment Center is? Is it a county agency? I think? At the left. Oh, that was the presentation that Jared gave?
The youth, forgive me, Chair.
Commissioner LeBar, thank you. Go ahead.
We had a presentation on the Youth Assessment Center, which is essentially a county entity at this point that helps align the needs of somebody who is experiencing the criminal justice system with other human service needs that they have in sort of the full spectrum of their lives. There was a budget request that was presented on in working session, I want to say the last in September or the first in October, and it was not included in the formal recommended budget from finance. So this would simply fund the relatively small amount out of fund balance. I would argue for this in large part because of the good it will do, but also because I think it will kind of better activate the $100,000 that we've already been putting towards the Youth Assessment Center the last several years structurally, so that we're not sort of losing out on that progress.
Commissioner Somerville.
Thanks. Yeah, I just found out about Commissioner LeBar's amendment a couple hours ago, but I'm excited to support it because I think it's the right thing for us to do. This is not a lot of money, and I think it's going to do a lot of good. So I appreciate Commissioner LeBar working on this, and you know, sometimes good things happen last minute. Thanks.
Other comments, questions, or concerns on this particular item? I see none. Let's do a roll call.
Commissioner Somerville,
Yes.
Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner LeBar,
Yes.
Commissioner Light,
Yes.
Commissioner Machewski, Commissioner Robbie. You said yes? Okay. Commissioner Sanders,
Yes.
Commissioner Scott,
That's me. Yes.
motion carries.
Great. Other comments, questions, concerns on the budget? I do have another motion that I would like to propose. This is, and I think that, Ashley is printing it out for me. This is a motion to amend the budget, so you'll have it in, oh, look it, here she comes, she's so quick. Motion to amend the budget to put the funding for the jail food and medical increase budget request into a central reserve for 2027 through 2029, pending a full program operation review of the Washtenaw County Sheriff Office to identify ways to achieve a 2% reduction and fully itemize the potential operational impact. Any operational adjustments will be built into next year's reaffirmation to reallocate any found savings into that budget. Wondering if I have a support for that. Thank you. Okay, let's discuss that item. I'll give you a moment. Commissioner LeBar.
Chair, I'm just seeing this for the first time, but I would,
Sort of new to me, like a.
yes, I would argue in the totality of the evening and the issues we're talking about, seems like a sensible plan and something I would support.
Thank you. Commissioner Robbie?
So what is the central reserve? What does that mean?
I'm gonna let Catherine take that for me. Thank you.
Yeah. So what it would be doing is it'd be, instead of having the money in the sheriff's office, it would be having it in this word we use for central budgeting, where we put all of our reserves. So it would keep the budget balanced. The money is available for that request in 27 through 29, but it would be, and so it keeps the money in the budget, but it doesn't put it in the sheriff's office until we finish this program review that the chair is talking about. So it makes it available, it's just to operationalize it. We move it in the reaffirmation depending on all of that outcome. That's what we talked about.
That makes, yes.
Yeah.
Are there guidelines set forth for how central reserve works within the budget document? Or is this sort of like a
It's
something
like
that you've discussed?
it'd be
with the
more
chair?
like a holding account more than anything else. So
Like an escrow.
Sure. It's not in a separate fund, so sort of, but so the big point is to make sure we have funded 2026 so we can operationalize like the jail food medical contracts that we're gonna have next year. Give time to finish that whole review process. And then pending that, we'd move that money out of that reserve and into the sheriff's office. Any savings that are found could be also allocated through the next year's reaffirmation.
So are we, I mean, I guess I don't understand the purpose of doing a central reserve. Are we then funding on an annual basis or quarterly basis the jail food and medical? Or not funding it until we're putting it in in this fund and then not funding it until this review is conducted?
2026 is funded. So we don't have the issue that we had to do just now in the Q3 technical adjustment. We wouldn't have to do that next year. And so it's saying the 27 through 29 future structural money would have to, before it's moved into the sheriff's budget, would have to go, finish this other review. I know it feels kind of weird, but so we want to make sure that we're not allocating that money that's needed for that jail food and medical contract in the future years. It's just held in this other fund until, and then moved into the sheriff's office next year in the reaffirmation. So we wouldn't have to come up with new funding next year for it.
The funding will be there.
The funding will be there for the jail food and medical, but
When do the jail food and medical contracts expire?
jail medical expires.
Wait,
Oh, hold on.
I'm talking to Catherine right now. Go ahead.
Jail medical expires this year. The RFP is in process. Jail food expires next year. There'll be an RFP next year for that.
Expires at the end of 26?
Jail food is at the end of 26, right? June of 26.
Soon, because there's new RFPs that are in now.
Yeah.
That's the medical?
Medical RFP is in now.
And then pending a full program operations review, who is conducting the full program's operations review?
Ideally, finance and the sheriff's department together.
Okay. For ways to achieve a 2% reduction, is that a reduction of the totality of the budget or an across-the-board reduction of every line item? Is it?
Totality of the budget.
And what do you mean by fully itemize? What is itemize the potential operational impact? Does that mean just describing the impact that it has on operations? That's what you mean by itemize?
Yeah,
Describe?
yes.
We
Okay.
can change it.
And then this last sentence is basically saying, the savings that are found would be basically like banked against the central reserve to reduce the supposed liability of the reserve towards covering the food and medical costs. You're saying it would be built into the next year's reaffirmation to reallocate any found savings in that budget. What is that? What are you trying to say?
So assuming that 2% can be found and what the operational impacts are amenable, how do I word this? Sorry. It's not necessarily netting the two out, but in the big grand scheme of things, it would net the two out. But it's really just saying that these savings would be available to reallocate to other purposes in the next year's reaffirmation.
So where would the found savings go? Like, would the sheriff still be able to, like, would it still be built into her budget that she reduced her budget by two, like, you see what I'm saying? Like, would she still have a 2% budget reduction, or would the county be like covering that, basically taking that back in exchange for allocating the central reserve into the budget? Because it's not part of the central reserve is not part of the budget. And so we're gonna give the sheriff a budget, ask her to reduce by 2%, and then have this central reserve that we're potentially gonna dump in certain conditions.
The central reserve is part of the budget. It's held in the central reserve.
In the general fund. It would stay in the general fund.
Not the sheriff's.
Sheriff is in the general fund as well.
Yes.
We're talking general fund dollars for both aspects.
But it's a different budget. So because all the questions that we've had throughout the day, but all the questions we've had throughout the day today pertain to the sheriff's budget. All right, we're not saying like, oh, the general fund, the questions we had were specific to her budget. And we were saying some people are alleging she's over budget, so we're talking about the sheriff's budget as a unit. But the central reserve is not part of the sheriff's budget. It's part of the general fund budget generally. So I'm wondering if the 2% reduction is achieved, will that be credited to the sheriff's budget? Or will it be counted against the central reserve allocation?
I sent a memo to the sheriff asking for a 2% budget reduction. This attempts to try to find that.
That's fine. I'm asking for like a budgetary answer to how this will actually play out mechanically.
I think I'm following what you're asking. And I guess, but to me, the two questions sound like the same thing.
Well, I guess,
So-
let me ask it a different way.
Okay.
too, Maybe, okay, so.
Yep.
Are there conditions by which the central reserve will not pay the sheriff's office to cover the food and medical expenses? Like it says, pending a full review of program operations to identify ways to achieve a 2% reduction. It doesn't actually say that there has to be a 2% reduction. So I'm wondering, are
To
there,
achieve means to see it.
okay. I'm not gonna argue with you because I feel like this language favors my position, to be honest, but like, I think that the 2% reduction, there only has to be a review for the 2% reduction. Is that correct?
It's my amendment. No.
Okay, I mean. So if the 2% reduction is not, upon achieving the 2% reduction, will the sheriff's budget reflect a 2% reduction?
Yes.
Yes.
And will then the central reserve pay for the full cost of the jail food and
The
medical?
money would move from the central reserve into the sheriff budget for jail food and medical.
Yes.
That's the way it's worded.
Any other comments, questions, or concerns? Commissioner Machewski?
Thank you, Chair. I do feel that the phrase "to identify ways to achieve" is in some ways contradictory and not exactly clear.
Okay.
I think if you want to implement it, the identify doesn't even need to be there. I'll leave that alone for a moment, though. The easier part of this is when you say next year's, are you referring to the 2026 budget reaffirmation?
It'd be the 2027 through
2027.
2030. Yes.
Yes.
Okay, so I would suggest that you might want to just state the years instead of saying next year's.
Oh, and any operational adjustments would be built into the 2027 reaffirmation to reallocate?
Yeah, I think it would be
Can I
clearer
just
if you just.
change
stated
that? That's not
stated the numbers.
substantially changing anything. Do I need an amendment to change that? Nobody objects to me changing next year's to 2027. Okay. I see a lot of shaking heads. So yes, let's take that next year's and change that language. 2027, 2029,
2030.
2030.
20
Thank you.
Not 20,
Thank
2030,
you.
2030.
And
Almost
maybe,
can't even count anymore. It's 1:46.
Next year's reaffirmation will be 2027 through 2030. So it's just identifying the proper terms of that reaffirmation budget. as-
In that last sentence, then it should say into the 2027 through 2030.
Yes, that's what we
That's
just
what we-
changed. Yeah.
Yes.
Yeah. Go ahead, Commissioner Machewski.
I'm just gonna.
Little cheeky smile you
I'm
have
just-
there.
I'm just gonna suggest that the way it's written now, where it says to identify ways to achieve, are to me, not clear and possibly contradicting.
Okay.
So, and I'll just leave it at that.
Commissioner Light?
I was gonna say, but the ask is to identify ways to achieve, which is you're asking for that 2% reduction. So that's what you want.
Ideally, for me, we would have a 2% reduction. I am actually fine to leave the language being a little amorphous there.
Yeah.
Because it's also talking about fully itemize the potential operational impact. That gives us a chance to talk at this table about what that 2% cut might be and what the organizational impact might do. And it's not saying that we are necessarily gonna cut 2%, but it's saying like, look, we've done the work, we've identified the 2%. If we had to make this cut, we know what that cut could be. We've seen the potential organizational impact, and we can have a knowledgeable discussion about that at the table. So I would leave that the way it is to allow us a little bit of flexibility there.
And that's what I was, because it's saying what we want.
Yeah.
Yeah.
Thank you.
Thank you.
Thank you. Commissioner Sanders and then Beaman.
So we're talking about 2% of 1.7,
No,
2.7,
2% of the budget.
2.7. That we're funding.
No, our total.
Or our total.
Of the sheriff's budget,
The sheriff's budget.
which will be about $1.3 million, roughly speaking.
Okay. Sorry,
I have
hold on, hold
ideas
on.
now.
Okay, so $26,000?
No. What the chair is requesting is a 2% reduction in the total sheriff general fund budget. In 2026, that would be about $1.3 million.
Okay. And that would be per year? The 2%.
We're looking for
2% per year.
Okay. Okay. Thank you.
You're welcome. Commissioner Beaman.
I'm just putting it out there. If we can't do a friendly amendment, it's fine. I wondered if we wanted to strengthen, identify ways to achieve as defined actionable pathways to achieve, but it's just semantics, so it's 2 a.m.
Let's just say that that's what it means. Yeah. Okay. Any other questions, comments, or concerns on this amendment? All right, I see none. Let's do a voice vote on this amendment.
Commissioner Somerville, Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner Labar,
Yes.
Commissioner Light,
Yes.
Commissioner Machewski,
Yes.
Commissioner Robbie,
No.
Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville, did you want to?
Am I the last person?
Yeah.
Yeah.
You were the first person.
Sorry, did you make amendments to the, no, yes.
Right, motion carries.
Okay, any other comments, questions, or concerns? Oh my gosh, on the budget, are we gonna do it? On the budget, on the 26 to 29 quadrennial budget. Okay, let's have a vote. Everyone's like, vote. Vote.
Commissioner Beaman,
Yes.
Commissioner Hodge.
Yes.
Commissioner Labar,
Yes.
Commissioner Light,
Yes.
Commissioner Machewski,
Yes.
Commissioner Robbie. Commissioner Sanders,
Yes.
Commissioner Scott,
Yes.
Commissioner Somerville,
Yes.
motion carries.
Thank you so much, commissioners. Thank you, Brendan. I'm gonna say that a kid, when he was little, he hated, I'd say like, just get that report done or whatever and get that monkey off your back. And when he graduated, I said, you finally got that monkey off your back. He's like, I never hear about that damn monkey. That's how I feel about the budget right now. We just got that monkey off our back. Commissioners, who would like to move the single reading? Commissioner Labar, perhaps?
So, forgive me, yeah. Single readings, a resolution accepting the 2025 Clean Sweep Grant Award. B, a resolution adopting the 26 Board Commissioners calendars. C, a resolution authorizing the above midpoint hire of Shannon Eifler as Director of Aging Services from admin. D, a resolution approving the 2025 apportionment report from equalization. E, a resolution reestablishing the Police Services Steering Committee as a special committee to the Board of Commissioners. F, a resolution calling on Congress to require HUD to award eligible continuum of care funding. G, a resolution allocating additional older persons millage funds to senior nutrition programs. And then 4A, approval claims.
Support.
Any discussion, or anybody want to pull anything for a different consideration? Okay, any discussion on any of these items? Commissioner Sanders?
I just had a quick question, the amount for allocation for older millage, older person's millage. It doesn't, are we supposed to have a dollar amount?
It's in, hold on. Just pulling it up. Okay. Okay, did you find it?
Yeah, it's been pointed out. I just didn't know whether or not it should be like in this language. Okay. Good.
I think that we didn't have the amount for the Wayne State MAT program. We didn't, so sometimes it's there and sometimes it's not always consistent maybe, but it will be reflected in the minutes, I'm sure. Okay. Any other questions or comments? Commissioner Machewski, do I see your hand?
Yes, thank you,
Okay.
Chair. I just want to welcome Shannon Eifler. I very much appreciated her comments earlier in the meeting, especially when it comes to creating something that is not just a successful program locally, but statewide or maybe even the nation. And I appreciate her perspective on that. Excited to have her come on board. And then related to G, the older person's millage, I will again suggest that potentially the first thing that she might want to work on is a strategic plan for nutrition services for older adults. I'm supporting this resolution tonight. But I am not a particular fan of this kind of shotgun approach. It is short-term, it is needed in the community right now. But I would like to see us have a strategic plan for this and reevaluate our program, how it operates, I think the way we've historically done it. I know Dexter has been getting $1 for reimbursement for a meal. We need to reevaluate this and meet actual costs. And again, I look forward to having her join us and dig into this work and have what I think will be an outstanding older adult program here in Washtenaw County. So thank you, Chair.
Ditto.
Any other questions, comments, or concerns? Great, let's do a vote.
Commissioner Hodge,
Yes.
Commissioner Labar,
Yes.
Commissioner Light,
Yes.
Commissioner Machewski,
Yes.
Commissioner Robbie, Commissioner Sanders,
Yes.
Commissioner Scott,
Yep.
Commissioner Somerville,
Yes.
Commissioner Beaman,
Yes.
motion carries.
Did we move the approval of claims too? Oh, we
Yes.
did, great. Any items for current and future discussion? I don't see any. And would somebody like to make a motion to adjourn?
So moved.
All in favor? See you guys soon. Happy Thanksgiving.